Just like we prayed yesterday, we declare today, no one is going to come and go back the same way they came in the name of Jesus. But blessings are going to flow. Yes, that knowledge that will be
Amen.
transferred to each and every one of us. We're going to go with it and we are going to impact our individual worlds in the name of Jesus. Father, we thank you for every single
Amen.
speaker. And we declare that your wisdom and your knowledge is going to flow through them like never before in the name of Jesus. Thank you, Lord, because
Amen.
this conference is going to be a reference conference in the name of Jesus because of its
Amen.
marvelous impact and the ripple effects that is going to cause all throughout the entire world in the name of Jesus. Be that glorified in our lives for
Amen.
Jesus' name we've prayed. Amen. Amen. Thank you so much.
Amen. And thank you so much, Emil, for that wonderful session of prayers. And so, like I said, our first speaker is here, but before he comes on, I would just like us to take a quick poll to know how we're feeling yet again. So, I would like you to indulge me. Sorry, the poll should come up on your screen in a bit. So, yeah, I want to know how you're feeling today. I mean, yesterday was amazing, and you're set for yet another amazing time today. So, let me know. Excited to learn. Okay, I love it. Super energized. Yes, yes, yes. uh, please more responses. Okay. I mean, most of us are excited to learn, and I'm so happy. I'm still waiting for more responses. And please invite your friends that are not here. We're meant to be more than this, so I'm guessing some people are doing one thing or the other. But please call their attention. Tell them we've started. Okay. So yes, we're all excited to learn. No one is just waking up or energized or excited to learn. That's based on the result I'm seeing here. So okay, I will just close the poll now. Okay, yeah, you can see the results. So thank you for indulging me. And okay, sorry. So yesterday was amazing. Before Dr. Fataki comes in, would anyone just like to share briefly how it was for them? If not, our speaker will just come right. Let me check. If you'd like to speak, please raise your hands. Also, yeah, so if you'd like to speak at any point during the session, please raise your hand and we'll give you the opportunity to speak. Would anyone like to share how yesterday was for them? Any new learnings, whatever it is? You can raise your hand and then, okay, Emil would like to share. All right, please go ahead, Emil.
Yeah, I had to just start first. I had to go first because of how yesterday was for
Like,
me. I mean, I think yesterday was remarkable. I was looking through some of the reactions and I saw so many people say so many beautiful things about what they learned. For me, I think that all the other speakers were just extraordinary in the things that they shared with us. And I remember how one of the speaker had actually, shared with us that mental health is something that we have to take seriously and especially in the Christian communities, right? And then she also brought some light into the fact that, well, in as much as there are certain cases where it could be demonic attacks, but it is always important for us to consider the fact that it might not be. So we can put in some of those, basic practices and all the necessary things that we're supposed to do to ensure that people are helped. I think that that was one of the things that stood out for me. Now, the final thing that so many things, of course, but one of the things, and this is the final one, that stood out for me was the what one of the speakers actually shared about the necessity for parents in some of the practical ways that parents can be able to ensure that they attend to the needs of their children so that they can, be prevented from probably drug abuse and some other vices are out there in the world. So to me, I think I would say that this is a place for everyone to be. It's an environment for learning. I'm really looking
yeah.
forward to today. Thank you so much.
Thank you so much for sharing, Emil. You took those words right out of my mouth. Yesterday was so amazing, and I mean, we'll be taking it up a notch today, right? And yeah, thank you. Would anyone like to share? Please don't be shy. Would like to hear you talk to us. But if there is no one, I will just go ahead to introduce our next speaker. Okay, sorry, there is a comment here. Oh, hello, Jill. Can you move closer to Dr. Fatoki so that you can be seen in the frame? Yeah. All right. Thank you so much. So I will just play an introduction video so we get to know Dr. Fatoki a bit better before he comes up. So, okay, let's have it. Sorry. All right.
At Breaking Barriers 2025, we're honored to have a respected voice in the field of addiction recovery, dual board certified in family medicine, addiction medicine, with over 30 years of hands-on experience helping people heal. He currently leads a private practice focused on addiction and obesity treatment and serves as a medical director for 2 opioid treatment programs where he supports thousands on their recovery journey. With master's degree in both public health and addiction studies and additional training in psychiatry, he brings a 360-degree view to healing, blending medical science with heart. He's also a fierce advocate for medication-assisted treatment, MAT, working tirelessly to reduce stigma and make recovery more accessible and sustainable for all. His message is simple but powerful. Recovery is possible and medication can be a life-saving part of the journey. Ladies and gentlemen, please welcome Dr. Adeyemi Fatoki.
Thank you. All right, Dr. Fatoki, you have the floor.
Good morning, and thank you for the honor to be here. So I have a special guest with me today. Her name is Jill, and she's one of my patients. I tell people she's the worst case of addiction that I've ever seen in my life, and it's still the worst case that I've seen. So I wanted her to share her story, and we'll interweave it with the science and my presentation. So I need to share my screen. Do I have permission to share the slides? Yeah.
Yeah, you do. Let me see.
Okay, I think I do.
Yes,
So
you have permission to share. Yeah.
I just can't share my screen. Sorry. Okay, can you guys see my screen now?
Yes, I can.
Okay.
Sorry, Dr. Fatoki, if you need anyone to speak, they can raise their hands and then I'll give them permission to speak.
Okay. So
Yeah.
can we see the slide? So, okay, great.
Yeah.
It's an honor to be here, and I think you guys are very blessed to have Professor Sanders. He was one of my mentors, and he's become a very good friend. But hearing him speak, being in his class was a big inspiration for me. And every time I heard him speak, it's always an inspiration. So thank you for being here, and thank you, Mark, for being a part of this. So we are going to talk about the science of addiction and interweave it with faith, along with Jill's personal experience. So I want us to know that addiction is a chronic, complex, and treatable disease that affects brain function and behavior. It's a compulsion, and the way I look at it is that once the drugs hijack the brain, nothing else feels good. I'm going to have Jill tell us about her family, how she got into addiction, and then we'll just go on between her and I talking and trying to tell a story. So I'll let Jill take over from now. If you can introduce yourself, tell us how you got to the point of addiction, and then we'll move on to where you are today.
Thank you for having me. My name is Jill. I'm 45. And my addiction started right out of high school. In high school, I was very active. I had a high school sweetheart that I started dating my freshman year of high school. I was a cheerleader. I grew up in a home that was not, there was no alcohol or drugs, a family that worked hard, and I had one sister. And so when I graduated high school, before I graduated, the only thing that I had ever really tried was, you know, maybe a beer or a drink at a party, but drugs were never a thing in high school when I was attending. It wasn't until I got out of high school, I had smoked weed and you know, tried that. And I was in college by that point, and my high school boyfriend, he was in college with me. And right when I turned 21, he was in a car accident. Him and another friend of mine were in a car accident, and it killed my boyfriend instantly. And that's where my trauma really started from. I would leave work and go to bars by myself. I was smoking weed all the time. I had to have friends drop me off, and I never really got the proper help or counseling, other than seeing a doctor and getting put on an antidepressant. And when I was on that antidepressant, I was on it for about a year and thought that my life was turning around, and it did, because then I had met my husband, who I'm married to still today. When I met my husband, he comes from a family of pharmacists and money. And even though he was never a drug user as well, we were still, other than my antidepressants and alcohol and marijuana, I was never still at that time doing drugs. I got pregnant with my first daughter, and we were renting a home at the time. And my father-in-law had shut down, he used to own a pharmacy, and he had shut that pharmacy down. And when he shut that pharmacy down, he boxed up all of the goods and stored them in his garage. My husband and I, one day, we were out in the garage and we were cleaning up for my in-laws, and we came across these totes, boxes of all the old pharmaceutical drugs. They were all expired, but as we were looking up things that stood out on bottles would be alcohol may intensify, do not, you know, operate heavy machinery. We knew that those types of medications were going to alter how we felt. And so I had my daughter, she was about 1. I had a C-section, and that's where I had ever really tried pain pills, because I was prescribed them at the time. So being familiar with Vicodin or Tylenol 3 with codeine from my surgery, we knew what to kind of look for. I was prescribed Demerol when I was in the hospital having a C-section, and we came across all these expired bottles of Demerol for IVs and all these old pills. But we decided to test them out and see if they were still good. And lo and behold, we were taking liquid Demerol that would go into IVs, and we would put them in a water bottle, and we would just chase liquid Demerol that in water just to get this buzz. And after experimenting with all these expired medications, we had run out of it all. And that's when I started to feel really horrible. And I thought, could this be addiction, or could this be withdrawal? But never in my mind did I think that that's where we were going. And it wasn't until a little bit later that I would know what withdrawal really felt like. So we're renting a house across the street from my family, and we're in the process of building our future home. We've got this amazing business. I'm now getting ready to have my second daughter, and life is really good. And we're working hard, and we've got this income coming in, and I have my second daughter, and I have another C-section, and now I have Demerol that they were giving me in the hospital, and painkillers, and not really fixating on that, not knowing that I even had a slight tendency to even want to take narcotics or any type of pain pill to get high from it. I was still taking those Vicodin because my doctor prescribed them to me. And so in my mind, I thought that that was okay. I come home from the hospital with my second daughter, and my parents, again, they live across the street from us, and they decide to watch our daughters for the night so that my husband and I could go out for the first time since having our daughter. And we go out, we run into some friends from high school. And they come back to our house. We've had some wine, and against our better judgment, he pulls out these little tin foils, and inside these tin foils is a white powder. And he says, this is Dilaudid. They give this to cancer patients, and it's just a very strong painkiller like Oxycontin. And because we were under the influence of alcohol, and again, against our better judgment, we decided to snort this. And he left the house that night, leaving some of these foils that had this powder. And by day 2, when the powder ran out, my husband was in the bathroom throwing up violently. At this time, I thought, okay, something's definitely wrong. And then we started to feel agitated, and we were both sick. So I decided to call this man that these little foils came from, that my friend had gotten them from. And he says, what do you think that you're snorting? And I said, well, my friend told me it was Dilaudid. And he says, no, you're snorting heroin. And just having my second daughter, I remember dropping to my knees thinking, you know, I would have never had snorted heroin had I known what it really was. But again, I wasn't ready to call myself an addict either. I didn't think that I had an addiction going on. I didn't put together all the things that I had done over the years. You know, there was no way that I was an addict. So my husband and I were closet using heroin for about a year, and we moved into our new home. We tried to keep up with our business. And when the heroin wasn't coming in steadily, or we didn't have the money, we started to see dirty doctors. Dirty doctors meaning doctors that would take cash for you to walk in, and they would give you prescriptions with no need for them whatsoever. So I would walk in, I'd pay $100, and this doctor would turn around and give me Somas, which people say Soma comas for they're muscle relaxers. They would give you Vicodin, or they would give you Norco. They would give you Xanax, Valium, and I really became fixated on the Somas. My daughters are downstairs. I've got my little girl and her walker, my then 3-year-old. I was babysitting my nephew, who is 3 days younger than my youngest daughter. And my sister had called to go through the run through of the week. But, you know, this was on a Sunday evening, and SpongeBob's on the TV. My husband's upstairs on his computer. And since we didn't have heroin, I had popped 10 Somas. And before I knew it, I didn't realize that I had overdosed. And when my sister called, my daughter answered the phone, and she basically said, TT, I can't wake up mommy. And so they called the ambulance comes, I get taken to the hospital, and they pump my stomach because I was overdosed. And that was when I came to, they wanted to check me in, and I saw my prescription bottle sitting there. I had my husband check me out. I grabbed that bottle of Soma that I had just overdosed on, got into the car in the parking lot, and I overdosed again from taking 12 more. I hadn't been to a rehab yet. I hadn't seeked out help yet because, again, I didn't think that I still had a problem. But when my husband got me home that night, after seeing the hospital putting all these tubes into my throat to pump my stomach, my husband went into the garage, took a PVC plastic pipe from his job, and after thinking that he could shove it down my throat while I was overdosed, he then again shoved the pipe down my throat, and it caused me to come to, and I was bleeding because he had torn up my esophagus. I couldn't talk for a few days, and that's when our family realized that something was going on. I had to finally tell my parents that I had tried heroin, and that's what my husband and I were hooked on. That's when I went into treatment for the very first time. Going into rehab, it was 10 days inpatient, and then it was 10 days outpatient. And there was no medicated assisted treatment. This was, you go into you have to detox upstairs and then you go into treatment. And I remember thinking that this was the end of my life. And that particular treatment center that I went into the first time ended up being a revolving door for me. Every time that I ended up going into treatment, I would gather little pieces of information, and I would always think, when will my aha moment come? Just like these people talk about, where, you know, a light bulb went off, and they were able to make it click where treatment worked for them. But treatment was not working for me. I wasn't even getting a sponsor, at reading literature, doing the steps. I had tried all of it, and I had been in and out of a few treatment centers by this time. My family no longer wanted me to stay with them. So when I stepped out, they stepped in to take care of my children. I ended up losing our home, our business, our vehicles. We ended up pawning things. But again, I had never tried medicated assisted treatment. I was still trying to do rehabs, and every time I went into a new one, a little bit more information I would, you know, store in my mind, thinking, you know, at some point I was going to get it.
So Jill, I have a question. When did you start injecting?
Injecting drugs ended up starting when I left rehab, probably the second or third time, and I wasn't allowed to return home. And the option was either get clean or you have to get out. And that's just what I did. Even when it wasn't something that was forced on me, I chose my drug and drug using, because it had such a hold of me and my husband, that I chose to go on the streets of Chicago. And that's when we started to inject. And we would get so high. We were using close to $300 to $400 of heroin a day, that we would get so high and not out that the heroin wasn't even going into our veins. It was just floating to the top of the skin, and then our skin started to die. And this is my arm after probably a year. But every time I started to inject, I had no more veins, that the heroin would just shoot out of my skin and onto the ground. I had to have skin grafts done from all over my body. They used shark skin to try and clear up the wounds.
So we know from what Jill is saying, right? If we go through the science of it, she meets the criteria for severe opioid use disorder. Like, once she got addicted, she started using more. She tried to stop, she couldn't. She spent a great deal of time doctor shopping, trying to find a way to use drugs. She had a craving and a strong urge that made it impossible for her to function or to stop using. And even though she had negative consequences, we can see what her hand looks like, she still couldn't stop using. You know, so when we look at the whole thing, she meets the criteria for severe opioid use disorder. So Jill, even though your arm looked like this, you still didn't stop using?
No.
Okay,
No.
so what happened then? Let's share another slide.
So after being on the streets in Chicago, homeless, seeing, you know, people all around me in the homeless camps overdosed on, you know, the sidewalks. Some had, you know, died. By this time I had overdosed probably a good 4 or 5 times. I've been Narcaned. I had to come home because my grandmother had passed away. Now, by this point, I had bone that was showing, muscle. I was injecting all over my body, and I had to come home and travel for 6 hours with my kids and my sister to my grandmother's funeral. And my skin was rotting so bad that it smelled, and I had to hang my arm out of my sister's window. And knowing when I came back from that funeral, I was going to be staying at my parents' for a night, and I went into my bathroom and I shot up. And when I shot up, the heroin shot straight through my arm and onto my sink. And my dad had come in and he says, "Jill, I have to take you to the hospital." Now, I had prepared for this because I knew that there was a good chance that I was going to end up having to go to the hospital. So I brought 30 bags of heroin home from Chicago with me, just so that I could medicate myself in the hospital the way I knew I needed to be, because there was nothing that the hospital could give me that was going to that was going to be high enough in dosage. So I went to the hospital. I had my 30 bags of heroin. I go into the bathroom in the hospital and I shoot up, and I left the tie around my arm. I get back into my hospital bed and I nod out. And the nurses and doctors come in and they see this. So when I came to, I had the police department in my room. I had the DA. I had all these, the authority, and I should have been going to prison. Like, the doctor was telling them, you can't take her out of here. She's about to have her arm amputated. And, you know, they're passing around my driver's license, looking at it, thinking there's no way that this girl is the girl that's sitting in this bed because of how different I looked. I had no color to me. All my skin on my legs, everything was rotting. And I ended up getting the surgery. They ended up having a cop that was camped out outside my hospital room. And instead of taking me to prison, they gave me an opportunity to fix myself, to make myself better. And again, I got back on a train, went back to the city and went to another rehab. But before I went to that rehab, I had a wound vac on one arm, a freshly amputated arm on the other. I went and got more heroin, and then I went to the Walmart and I ended up overdosing in the bathroom, fresh from the hospital, fresh from the surgery, and I overdosed again. But again, I tried more rehabs, just different ones.
So we can see, even though she's got the negative consequences, she couldn't stop. And that's one of the things that got me to addiction treatment, is that why would someone choose to do this to themselves? You know, but from listening to her story, you know that she didn't choose to do that to herself. It's just the nature of the disease, you know, with the addiction. And once it takes over, it's almost impossible to stop without help. You know, the thing I want to differentiate is between the physical dependence and addiction. Addiction is that compulsion. If you listen to Jill's story, she had all these negative consequences. She had this craving. She goes through withdrawal. But sometimes people get dependent on medication without being addicted to it. You know, there are medications like antidepressants that if you try to stop cold turkey, you're going to have withdrawal from it. So again, remember, the addiction is that compulsion. It's even though there are negative consequences, her arm was infected, she still couldn't stop. Ended up being amputated, multiple overdoses, she couldn't stop. The way it affected her life, she couldn't take care of her children, she couldn't keep up with her business, you know, so ended up losing almost everything she had, so except her life. So there's a difference between physical dependence. So the question that I often ask myself is, why do we treat addiction different from other illnesses? You know, she told you she was in rehab and they just let her withdraw and that she'll be okay. And that's the same way when I worked in the prison system that we looked at opioid addiction. It's it's just like having a bad case of the flu, they'll be fine. So we didn't treat it. But again, if you look at other chronic illnesses like diabetes, the relapse rate is like 30 to 50%. Addiction relapse is 40 to 60%. For hypertension is 50 to 70%. And asthma is again 50 to 70%. Basically, if someone has hypertension or diabetes, we know that there's no cure. They might be able to do well by changing their lifestyle, taking their medications, but if they stop taking it, then they relapse. Addiction is the same thing, but we just look at it different. You know, addiction cannot be cured, but it can be managed. If you don't treat it, it can lead to increased morbidity or mortality, just like diabetes or hypertension. If you have a patient who isn't following the diet that the doctor prescribes, or they are not exercising, we still don't treat them different. But when it comes to addiction, we're looking at it like, oh, it's something that they should be able to control that they cannot control. So again, let's think about the stigma. Like Jill, she mentioned how bad her arm looked, and that's the way we look at drug addicts. Like, you see someone who is addicted, the first thing is, oh, they're so unclean, you don't want to be bothered with them. But no one really wants to listen to their story, you know. But we need to be compassionate and look at where they're coming from. When I met Jill, I didn't know her story. You know, the only thing that I saw in front of me was this person who had these wounds, and we'll get to that, but she just didn't look like someone that came from a respectable family, and she's mentioned that too. But when you look at where she came from, you know, you start wondering, how did she end up here? Well, again, we have to have an open mind when we are treating our patients and understand that they've been traumatized and they've been stigmatized. And we as providers need to just look at them like we would look at anyone with any chronic illness. So why do people get addicted? Like, there are some risk factors. Some of it could be genetic. We know that addiction tends to run in families. Trauma is a big factor. Jill mentioned how after her boyfriend died tragically in an accident, that traumatized her, but it was really never addressed. A lot of patients that I see have had some kind of trauma, whether as a child or in adulthood, that was never addressed. Jill went through the environmental influences. You know, her father-in-law was a retired pharmacist. He had the medications at home. They got into it to experiment with it, and it turned into something else after that. Oops, sorry, went too far. Mental illness is also a big factor when it comes to addiction. A lot of people have unblocked diagnoses. It could be depression, it could be schizophrenia, anxiety, just things that are not treated. And if you don't treat those, it's also going to be difficult to treat the addiction. And then the one thing that we should realize too is that once people get addicted, the drug that they're addicted to causes some structural changes in the brain, which makes it even more difficult to improve. So why can't people stop using? This is one of my favorite quotes from the Bible. It's from Romans 7:18-19. And it says, "The evil I do not want is what I keep doing." You know, so for me, the people who are addicted, they want to stop doing drugs, but they just can't help it. And I have the desire to do what is right, but not the ability to carry it out. You know, so the way I interpret that is we all have demons. You know, it could be drugs, it could be gambling, it could be shopping, it could be anything. But it's just that desire, like, you know what your demon is, you try to stop, but it's just difficult to stop. And that's why I try not to judge people, because again, you don't know that they are not trying. You see what you see, but you don't see what's going on inside them. So when it comes to addiction, we need to understand that there is no one size that fits all. So I'm going to talk briefly about how I met Jill. So I was working in my other clinic, which is like 90 miles away from where Jill lives. So the one clinic is like 10 miles from them. The other clinic is about 90 miles away. So we get this call in the middle of clinic. It's maybe like 4 o'clock in the afternoon that it was her parents who called that their daughter was just leaving rehab in Chicago, and they were going to bring her to the clinic. And I told them I'm in my Ottawa clinic, it's 90 miles away. Now I'll be back in the clinic that's close to you on Tuesday. So this was a Wednesday, so about a week, and they're like, no, we can't wait. We need to bring her in tonight. So they went, picked up from Chicago, then drove 90 miles to my office. By the time they got there, it was about 5:30 at night. I was almost done with clinic, but you know, so my staff left, they got her ready, did her vital signs, did her urine drug test, got her ready for me, and then we are there working, trying to, I'm looking at Jill, like talking to her. First, I'll tell you what I said she was the worst case. Like, the right arm was already amputated. The left arm was badly infected. She had sores on her thighs and her legs, and they stunk really, really bad. The smell was horrible, but I tried not to judge, not to stigmatize her. I sat down and we listened. So she's telling me that, well, our parents told me they picked her up from rehab, but I'm looking at her drug test and she had all kinds of illicit substances in there. So I'm thinking to myself, this does not make any sense to me. Like, if you just left rehab, why is your urine like this? So I'm looking at Jill. I'm like, okay, Jill, something doesn't make sense to me. So what happened after that, Jill?
Well, after trying to run him a story, Clearly he called me out, and it was the first time that I actually had to get honest and speak it out, you know, and out loud. And so I asked him if he could have my parents step out, and he did just that and came back in, and he says, okay, what drugs have you used? And sure enough, I was snorting heroin on my way to, you know, see him at his office. And I had just smoked a crack pipe right before my parents had, you know, picked me up. And I had to get honest with him for the very first time. And that's when I knew that this time, this go about at trying to change myself, change for a better life to live, I had to change so many different things.
But something else you told me too, right? Because you told your parents you were in treatment, that you went to
Yes.
rehab, but you told me that it was really your ex-husband or your husband who was going into rehab.
Yes,
So you just went to go party with him
Yes.
before he went to rehab.
yes,
You know, so again, like she wasn't really getting treated, but her parents got her thinking that she was drug free, so we could get her in treatment right away. So she gets there, and her parents, because I was really, really nervous, and I'm just thinking the way her father was looking at me, he sat down like, okay, we've been through everything. So what do you have that's different that we've never heard before? And I'm just so nervous. I'm praying. I'm like, God, I just can't fail. We can't fail with this. We can't fail, you know, but I was really nervous, especially just the look on her father's face. It's like, you know, you see a parent who is at their wits' end. They've tried everything and nothing is working. And here I am under pressure. I don't know what to do. It's like, I mean, I have the science, but at the same time, when I'm in difficult situations, I pray for some kind of divine help. So I tell Jill, because of how severe your case is, I think we need to do methadone. Okay, with methadone, you have to come in every day, you know, because so that way you're having the counseling, you're having the contact with the provider, it's a daily thing. And, you know, then she tells me that wasn't going to work because why wasn't it going to work for you?
you know, I had seen so many other addicts on methadone, and they were all nodding out. They were still in that phase where they wanted to receive the high from the methadone. So they obviously had told their doctor that they needed the highest of, you know, what they could get. But when I was in meetings, I would see all of these addicts that were so-called in recovery nodded out at the table. And I didn't want that. I mean, I wanted to change my life, and I did not want to be that. I didn't want those temptations. I didn't want to lie to my doctor and tell him, hey, I need a stronger dose of methadone, because, you know, then I'm cheating myself. I'm still chasing that high. So we had to get my family involved.
So yeah, the treatment has to be individualized, even though I felt that this is what was good for her. She decided it wasn't going to work for her for whatever reason. The other alternative we have is a medication called buprenorphine, which is both an agonist and an antagonist. But also knowing Jill's history, I knew she probably wasn't going to take it. I was worried that if she didn't take it, then we'll be in the same predicament. But if there was a way to get her to take it on a regular basis, then I knew that we at least had some chance to make it work. So we brought her parents back in, and then the agreement we had is, okay, Jill, for me to prescribe this medication for you, you're going to have to take it. And then her mother agreed that she was going to make sure that she took it every day. But again, from me working in corrections, I know what tricks people can play, because just how strong addiction can be. You know, she could put the medication under her tongue like she's supposed to, and then spit it out later or hide it on the roof of her mouth, you know, without her mother seeing it and all that. So we went through all that. I told the mom, you have to check her mouth. Jill, you have to let them check your mouth, and you have to show up in the clinic, you know, in 2 days. So her mom agreed to that. That was the treatment plan, and that she had to do counseling, and that will go from there. So again, mentioned the childhood trauma, the PTSD, the depression. So those are factors that need to be put into play when you're treating. So we have to treat the depression and treat everything for it to work. So we are going to talk about Jill's starting point, but before then, I'm going to mention something else. So by the time they left my office that night, it was about 10 o'clock at night, and then I still had to drive about 80 miles back to my house, So when they are leaving, I'm still thinking to myself that I know the medication helps, but it's not enough. So I'm like, what else can I do that can help Jill? Like I said, I was praying, and then I got a revelation. It's like called Jamelia. So that's what came. That this was 10 o'clock at night. So you ask, who is Jamelia? Jamelia is one of my friends, and she's also like a very strong treatment advocate. I met her when I first started prescribing on the buprenorphine. She was working for the company at the time. So I knew she does consulting and she had a lot of connections. She knew a lot of people. So I figured that if we got Jill telling her story, that might help. So I called Jamelia, like, Jamelia, I have this lady that I just saw and I just can't feel, you have to help me. I don't know how you can help me, but I think if you can get her speaking about her addiction and her health, we might be able to do something for her. So it's like, okay, let me see what I can do. But I was so desperate. Normally, I wouldn't call her that late at night. So it's like, let me see what I can do. So Jill, why did this treatment work for you this time? What happened this time around?
I wanted to live, and when I left that city and went to Ottawa and had my appointment with Dr. Patoki, and we figured out a treatment plan, I ended up moving back home with my parents. And that first year of treatment, I set a lot of boundaries for myself. I wanted to live. I wanted to be there for my children. I wanted to be a mother again. And I didn't own a cell phone for the first year. I barely, I got so involved with my kids' schools, their activities, their sports. I put this bubble up, and I stuck to a strict guideline in order to save myself. All the things that I had tried in the past did not work. Dr. Patoki and Jamelia, meeting them and coming in contact with them, I share my story, and I speak to schools now. I speak to police departments. Some of the police that I had interactions with that were, trying to take me to jail have now reached out to me after hearing my story, and they're like, wow, you've changed your entire life around. And it's just this huge turning point in my life where I am a mother, a daughter. I am respected. I have trust again. My parents used to lock their doors, and now they leave me at home, and they go on vacations, and we have this full circle moment where it's like, where they were helping me, I'm now helping them with their health issues. And I speak to other addicts, other youth kids, and I try to get my message out to let them know that, you don't have to come from a bad background. You don't have to come from the streets, or you don't have to come from, a broken home for addiction to affect your life. And but getting treatment for myself, it took my entire family. It took my doctor, it took my mom and dad, it took my kids. We all had to be in agreement on what we can do to keep me sober and keep me on the right path to where I am now able to help others.
So the one thing that I say when it comes to success with treatment, it's three factors. I tell all my patients, if the treatment isn't working, it's one of three things. Either you're not doing what you're supposed to do, I'm not doing what I'm supposed to be doing to help you, or we're both not doing what we are supposed to be doing. So all those three things have to be in play to be successful. So I look at it as a collaborative therapeutic alliance. And again, as a clinician, I have to show empathy. I have to show that I'm really genuine, that I'm trying to listen and trying to help. I'm not trying to judge or stigmatize anyone, you know. And I mentioned too, like when I first met Jill, our left arm, the bone was infected. It stunk real bad. Both legs were full of wounds that really stunk. So she had been in treatment with a surgical group. They were going to do a screen graft and a bone graft on the arm so that she wouldn't lose the right arm, I mean the left arm. But they actually refused to do it because of how many times she had refused to show up for treatment. So once she started in treatment and started doing better, we had to write letters and had to send her back and write a letter that, okay, she's really changed this time and she's going to stick with the treatment. So that's what it took for her to be able to save her left arm. Again, developing a treatment plan, it has to be a partnership. There has to be some expectations. You know, I told Jill, you have to take your medication. Your mom has to give it to you. You have to come to the clinic. You know, and I had to agree to prescribe the medicine too. So it has to be a collaboration. She's talked about the role of her family and how the support of the family played a role. So Jill, I know you burned a lot of bridges. How long has it taken you to be able to start mending those fences in your family? I know you said they trust you now, they go on vacation.
Yes.
And we talked recently about you finally being able to help write the checks to pay the bills at the house. How long did that take?
I'm going to be coming up on 9 years of sobriety this November. And due to my father's health issues and everything, we've got this huge safe, and all of these things that they kept hidden away from me, locked up, I would try to get in that safe and, you know, always wanted. Here we are, almost 9 years in recovery and sobriety, and my father sits me down and opens up all the bank accounts and shows me how to pay all the bills, shows me how to open the safe. That safe that held everything that they wanted to keep from me is now the safe that has the will and all the important documents. That was a huge turning point for me. And this just happened within the last month. So almost 9 years later, a point where I thought was never going to happen again did.
So sometimes treatment has to be mandated. So I want us to also know that treatment does not have to be voluntary to be effective. Sometimes the justice system might be a way to get people into care. You know, that might be a turning point for some people. This is Jill's left arm when we finally got her back into treatment.
Mm-hmm.
Can you show what it looks like today?
So I have it's not a graft. It's not a graft.
It's a graft.
Is it?
Yeah.
They took skin
A flap.
and yes, a skin flap. They took skin and muscle and from my back. It was a 13-hour surgery, and they had to connect it to my left arm. Now they wanted to take my left arm as well, and I begged them, and I promised that I would do the right thing, even though I didn't at first. And they wanted to take my left arm as well, and so we got this flap, and they wanted to give me pain medication in my IV at the hospital. That terrified me. And I opted out of pain medication for a 13-hour surgery.
So what's the significance of the tattoo?
So the tattoos, honestly, I have a diary that I have sketched out of all of the transitions, the things that I've gone through, sayings, things that are personal to me that kind of tell my story. And it's taking a while to get there. But you know, I'm slowly covering up these scars, and not to so much hide them away from the world, because it shows all the living that I've done, all the bad, the good, and how I'm still alive today to be able to tell, you know, my story. So
we're almost at the end. I know we are running short on time, but one thing that I hear from a lot of patients and families is that when someone is in medication-assisted recovery, that is just substituting one drug for another, you know, but we know that facts and evidence supports medication in recovery. And what I generally I would ask the family or the patient is, if that's the same thing, then why aren't you doing the same thing that you were doing when you were using drugs? Like, why isn't Jill doing the same thing that she was doing on heroin? If it's the same thing, there shouldn't be a difference. Or, okay, I've been on this medication for 2 years, I need to stop now. The first thing I'll ask is, why don't you stop your diabetes medication? Why don't you stop your hypertension, your medication for hypertension? Again, that's just part of the way that we stigmatize addiction. I wouldn't tell someone with congestive heart failure to stop their medication. So why would I tell someone with addiction to stop their medication? And we need to look at the whole picture. And that's what I tell my patients. You're doing well now. It's everything that you're doing. It's your medication, it's your family support, it's your job, it's your hobby, whatever you enjoy doing. And I make sure that the patients have a hobby, that they have something that they like to do. So it's all that's what's keeping you healthy. It's everything that you're doing. And you can't just stop it right away. You have to find something else to do. Whichever way we look at it, people that are addicted to drugs, they are getting, at the time they are addicted, they are getting some kind of benefit of the drug. It's doing something good for them or they wouldn't be doing it. We see that the negative outweighs the positive consequences, but there is some benefit to it. So again, when I talk to the patients, I used to enjoy fishing, I used to enjoy running, I used to enjoy like hanging out with my friends who didn't use drugs. But again, once the drugs took over, you start doing the drugs and everything else that I used to enjoy goes to the side. You have to go back to things that are pleasurable without the drugs in there. So Jill, she's mentioned how her life is today, how she's regained control, deal with challenges. So even though you're in recovery, you still deal with the things that normal people deal with. You still have to deal with your teenage kids. You have to deal with taking care of your parents and helping your parents. So it's still a regular life, but she still has the challenges. But on top of that, she knows that she has this chronic illness that she has to manage and continue to do what she's doing to help her in recovery. So, what does it take for you to stay in recovery?
I stick to a strict routine, to be honest. I had to get rid of people, places, and things. Those are things that they talk about in rehabs. I had to drop a lot of friends that were near and dear to me, but because, they may choose to, do other things or drink or, bars or whatever, I had to remove myself from that. And I had to know, what were red flags for me. I had to recognize a lot of things. And I didn't own a phone for my first year of recovery because I didn't trust myself. I had to relearn and figure out who I was going forward with this new life. And, I'm very proud of that today. But all of the things that, people, and I don't say in general, I'm basically saying those that don't have an addiction, the things that you guys all face on a day-to-day basis, I'm facing today, and it's just, I'm learning how to do it, sober for the first time. And
so again, it just takes whatever it takes, whether going to church, going to the mosque, being accountable. You look at Jill today, right? This is someone like telling her story, but at the same time, I wasn't worried or I didn't panic. It's 7 o'clock here. She's not paid to do this. It's just her volunteering to do this. But I wasn't worried about her not showing up at 7 in the morning. I told her she'll be here at 6:45. She was. So she's accountable, and we just have to look at the whole picture. If you look at it, this is the same person 10 years ago. And fast forward 10 years later, this is her today. So we can see that treatment does work. Again, in closing, addiction is a treatable illness. Faith and evidence must work together to break barriers. We just can't live on faith and discount the science. We just can't say it's science and discount the faith either. Like I said, I did pray that God help me with her. I can't fail with her because I think it's a divine moment that God told me to call Jamilia. And that's how we are here today, so we have to look at everything. And for me, it's whatever works when it comes to treating a patient. I have one last slide to show. So this actually was a coincidence on Tuesday. Jamilia came to meet with me and I didn't know Jill had an appointment at the same time. So we took a picture and decided to add it here. So this is Jamilia and this is Jill today. So this picture was just taken 3 days ago. So thank you for listening. We'll be glad to take questions. Let me stop sharing.
That is amazing. Oh my goodness. Thank you so much, Jill.
Thank you.
Oh, we're so grateful for your recovery. So good to, wow. Thank you. And thank you for sharing. Thank you for being vulnerable and sharing.
Yeah.
Appreciate it. Thank you so much. So sorry.
All right.
Go ahead.
Okay, thank you so much for sharing. I see Jamelia is here. I don't know if you'd like to speak. I can see her as part of the attendees. But if you'd like to speak, please raise a hand so that I think I would like to hear from you actually. But thanks for being here. Thanks for joining us. So I have some questions here. I think this is coming from those tuned in on YouTube, but I have about 3 here on the Google form. So I'll just, okay. So in your experience, it was asked anonymously. In your experience, what factors help determine whether a person needs medication assisted treatment or not?
So basically, again, if they've been trying to stop and they can't stop using, and you say she met the DSM-5 criteria, every single aspect, and we've tried everything else. She's willing to try medication. I know medication works because I believe in the science, but again, it's not everything that we have medications to help with. Like, there's no medication to help with stimulant use. It's mostly counseling. But at the same time, you can't discount the medication. The medication alone is not going to do it. You just can't prescribe someone medication for hypertension without them changing their lifestyle. But if there's a medication available, yes, I will use medication. Look at it the same way. Like I'm not going to ask you what makes me decide to treat someone who has hypertension. What makes me decide to prescribe medication for someone who has diabetes? If someone has addiction and there's medication that can help them, I will offer it to them.
Okay. All right. Thank you so much, sir. Another question here that I have. Okay, someone would like to speak. Sorry. Oh, yes, Jamelia would like to speak. So before I continue with the questions, I'll just allow her to speak. Yes. Okay.
Hello.
Hi.
Celia.
Hi. Good morning. Good morning. I apologize for the delay. I'm actually at a medical appointment with my grandmother this morning, so I had to step away. And I've been in and out of this conversation, but I'm really grateful to have had. What was that?
Oh, sorry, it was breaking. We couldn't hear you.
Oh, I'm sorry. I'm at a healthcare facility. But I was saying that I apologize for the delay. I'm at a medical appointment with my grandmother. So I've been in and out, but gratefully I've heard, I mean, we've done this presentation together. I've heard the stories, I've had the phone calls, and I just wanted to say I'm so grateful to Jill and Dr. Fatoki for their teamwork and their advocacy, their partnership, their friendship. This, in my opinion, is what quality and value-based addiction care is all about. And I know that every provider, and I don't know who's on this call this morning, but I know that every provider may not have the capacity to do this. So if there was one thing that any of us could do, especially if you're a provider, is just to learn how to ask good quality questions. And for me, watching Dr. Fatoki do that over the years has been the key to uncovering the information that's needed to actually help people get on the path that they deserve. So outside of that, I'm just grateful. I stepped away for a minute to cry, as I always do, when I hear some of the story. And every time I hear it, it's like hearing it for the first time. I've had an opportunity to get to know Jill's parents and to see them restore their hope in her in real time has been gratifying, to say the least. So just thank you all. Thank you for what you're doing. Thank you for your vulnerability. Again, thank you for your partnership. Thank you for understanding that this is bigger than us. And thank you for enlisting me in this walk. I couldn't be more honored to be with you two and with all of you on the call today. Thank you.
Thank you, Jemiah.
Thank you so much. All right. So if anyone would like to ask a live question that you'd like to speak, please, you can, raise your hand. So I'll just continue with the questions here. Before I go to the anonymous question, there is one here from Ayobami. Okay, so to Jill, thank you for your courage. I would like to ask, what helped you stay consistent with recovery, even when it got hard?
Replaying the awful outcomes that I had experienced over and over and over again, realizing and knowing that I am honestly just one small step away from complete and total destruction again. One shot, one snort, one smoke away from becoming a full-blown addict again. It's that simple. It's that easy. It's replaying all of the years that I was in active addiction, replaying that over and over. And there's times where I still will remember something that I hadn't thought of in years, something that I might have seen, witnessed, experienced. And that's what trauma is. It's like compartmentalizing things and then trying to place them in the back of my mind where I feel like I've gotten better, but then something will come up where something just kind of like releases and makes me remember something horrible that I went through. There's been a lot of things that I could never unsee, a lot of things that I went through and experienced that I have kids that I talk to in grade school and they gasp when I tell them, but yeah, it's constantly reminding myself that I'm just one step away from, making a bad choice, bad decision. I've got to constantly always, keep my recovery at the forefront of my mind and remind myself how grateful and blessed I am that I'm here today. Because there's not a lot of addicts that reach this side of addiction, recovery. I've seen too many pass away. So thank you.
All right. Thank you so much. Okay, thank you. So another question is, sorry, let me read through that. You mentioned, I think this is to Dr. Fatoki, you mentioned something around justice stepping in. How can that process be mediated? Yeah. How can we, or when is there a need for that? That's what the question is.
So,
yeah.
I worked in corrections for years, and people, they didn't look at the system doesn't look at addiction as an illness, because I've seen someone who went to jail for 6 months. I actually met her in jail when she was pregnant, and what she did was steal like $20 worth of costume jewelry at Walmart. But here's the crazy thing: between like the $20 and $499, it would have been the same sentence. So why would you steal something for $20 when you could have stolen something for $499 to get the same punishment? But people like that, that someone in their right mind would not do something that stupid. But they throw them in jail and just lock out for the 6 months. But like now you have judges who are more empathetic when they are looking at that. It's like, okay, it's because of their addiction, they were not acting in their right mind. So let's get them into treatment. So that's where the treatment could help. Like when I started working in corrections, we did not treat addiction at all. By the time I left, a lot of the jails and prisons were starting to incorporate medication-assisted treatment, which I'm very proud of. So at least it's a gateway, realizing that just locking them up for 6 months and then letting them back out, you're not helping them. But while we're in here and they're doing well, let's try and get to the root of what happened. Was it childhood trauma? Is it depression? Is it bipolar disorder? And they were manic when they were doing those things, so that we can try to help. That's where treatment can help. I saw an anonymous question that I would like to answer, about someone talking about pornography and stuff like that, or to food. Can I answer real
Yes.
quick?
All
Okay,
right.
so that's one of the favorite things that I like to talk about. Not the pornography, but that we all have demons. Everyone has a demon. So the demon might be pornography, the demon might be food. So I can tell you, my demon used to be crazy women. Like I used to like to deal with women that were crazy. I like to get into crazy relationships. I already knew how I was going to end up before it even happened. I already knew that I was going to end up losing everything that I have and I'm going to start all over again. But I still couldn't stop. My mother used to tell me all the time that she couldn't understand how I could be so smart and dumb at the same time. Smart when it came to my career, everything was going well, but dumb when it came to getting into relationships. So I'm going to tell until I realized that I was behaving like a drug addict, I was not able to get my life together. And how was I behaving like a drug addict? After I lost everything, I would go back home. My mom and my siblings, they were there with open arms, right? At the time, my brother didn't understand. He used to tell me that I was morally bankrupt. That, why would you just do he didn't understand what was going on. And I told him, it's like, my brother and I are extremely close. We talk 2, 3, 4 times every day. And I told him, I said, do you think that I really want to keep losing everything I have and starting over? Look at it. Does it make any sense to you? That why do you think I want to keep doing this to myself? But every time I will run back, then if I'm back in the relationship when they are calling me, I'm going to the bathroom to go hide and answer the phone, so that they don't hear me. But I thought I was fooling them, but I wasn't. I was fooling myself. But until I realized that I was behaving like a drug addict, I could not get my life together. I saw a therapist and it's like, okay, tell me about yourself. So I'm telling him about my childhood and everything was fine. I grew up, upper middle class family. My family is very well connected in Ibadan. I had a good life growing up, went to good schools, came to the US on a scholarship, but while I'm telling my story, I'm thinking it's the first time I ever heard my own story. And all I can say is, I'm really screwed up in the head. I'm screwed up in the head. So after that, I started getting my life together. So yes, doing this is part of my own treatment. I tell my wife all the time she's my buprenorphine, that she's my Suboxone. So again, I believe in God. And one of the things that helps me is that anything that, a lot of people, we hide things, right? We say we believe in God. If God sees what you're hiding, but then when you come to tell it to a man, you start lying and hiding about it. So I'm telling my patients, I'm just a human being. If God sees what you're doing, you don't have any reason to lie to me, because God already sees you. And if you fear God more than you fear man, you shouldn't be afraid to do whatever you're doing in the dark to do it in public. But yeah, so this for me is therapy also. That's why I said we all have demons. Everyone has a demon. It's just realizing what your demon is, believing that that's what it is, and finding a way to deal with it.
Yeah. All right. Thank you so much, Dr. Fatoki. So another question here: how can families support a loved one who is recovering and on medication? And I think this question is so beautiful because Jill has such a wonderful family. So how can families here in Nigeria, especially with the whole stigma, so how can families support a loved one who is recovering and on medication?
So the first thing is to have an open mind and not to be judgmental. Be honest, realize that they are dealing with a chronic illness and that it's not that they are really trying to do this or to be difficult. Yes, they've burned a lot of bridges, but you have to start trusting them back. You have to start believing in them. Like when they tell you, so give them the benefit of the doubt and don't keep throwing it back in their face. I know we Africans like to do that, where you ruined your life, you did this, you shouldn't have done that. So we have to control ourselves and just keep an open mind, and again, the bottom line is understand that the person is trying. Don't be judgmental. Like Jill just said, it took her 9 years to build your parents' trust. What else? I'll let you talk. What else have they done, to support you, to help?
The encouragement. It's the, when they speak with family, it's the nice things that they say now and talk about the things that I'm doing and the things that I do to help my recovery, whether that's speak to churches or speak to schools. It's like bragging almost, things that that they used to be hush-hush about because, again, the stigma that addiction has, nobody wants to talk about it. But now they're full of just being proud, just being, the fact that I've come this far and I've changed my life around. And they talk about Dr. Patoki and Jamelia all the time. My mom and dad just absolutely, love the people that have gotten me here and has helped me along the way, that gave me the chance. But yeah, it's just a lot of support, and you have to have a support circle. I tell everybody that, people that ask me, all the time, what can you do? I have a husband that got on, in recovery, but he didn't have the support. Things were so much harder for him. And to where I'm thankful for all those that have been in my corner. So.
All right. Thank you so much for that. Okay, Jamelia has given a shout out to Mrs. Fatoki. Because of who she is, Dr. Fatoki can be the type of provider he is. So yeah, thank you. Shout out to her. We're so grateful. I wish we had her on this call, but it's okay.
So my slides for me.
Wow, thank you so much, Ma. We're really grateful. Okay, thank you. We still have some more questions, and I'm glad that we don't have like so many anonymous questions like you are stepping out. So this is from Michelle. I'm so happy for you, Jill, and thank you for sharing your experience. I've learned a ton from this. My question is, how do you prepare your patients who are in recovery from social harshness and glares, knowing she was an addict before? Also, how can she shield her emotion while in treatment from the negative reactions she will get from people around her? Or it's better to stay away totally for a long time? Or is it better to stay away totally for a long time? Yeah.
Well, so again, you can't control what people do or how people tell or people's feelings. If you look at Jill, you can't tell that she's been addicted to anything. And that's what I tell my patients. Like, you cannot tell, it's not written all over your face. If you have diabetes, if someone doesn't tell you that they have diabetes, you don't know. No one knew what my demons were until I told you guys now. But again, I'm not ashamed. I'm not, I have someone who makes me feel confident, who tells me, who makes me feel proud. So I don't think about all that. I know, again, I believe in God, I fear God. So you can judge me all you want, but it's not taken away from who I am. So that's the first thing. You have to regain that confidence in yourself. You also have to understand that addiction is not written on your face. So once you've gone past that stage in your life, you don't let people keep bringing you back to that path. That's why I said you can't keep throwing things back in people's face. If all Jill hears about is her addiction, she's not going to be where she is today. It's like she's a changed person. And again, if you believe in the Bible, it says that when you believe in Christ, you're a new creature. You're changed. Once you're in recovery, you're a new person. So all those old things are gone away. You cannot let that dictate your life. The past trauma, everything has to be treated. You have to look at the whole picture. So again, the ASAM dimensions, it talks about the withdrawal potential. It talks about the medical issues, the psychological issues, the other issues like social issues, things to maintain recovery, relapse potential. So staying away from the wrong people, making sure that you have something that keeps you occupied. You have to have a hobby, something that brings you joy and pleasure. If they have legal issues, it has to be addressed, and also the patient's preference has to be addressed. If it's religion, that's what it's. They have a strong faith. Incorporate that into the treatment. If it's whatever it is that they prefer to do. Okay, I want this medication, or I don't want this medication anymore, or I want to stay on medication until I decide I don't want it anymore. You have to incorporate it and look at the whole picture.
Yeah. All right. Thank you so much, sir. Michelle, I'm guessing answered your question. I believe that answered your question. But if you still have some more concerns, you can always share. So I'm moving on to the next question. If you could speak to someone at this conference battling addiction, what would you say to them?
That there is hope, and you should seek treatment. You don't need to be ashamed. You don't need to be embarrassed. It's a chronic brain disease. Understand that whatever the addiction is, like whether it's pornography, whether it's drugs, once it hijacks your brain, nothing else feels good. Nothing else feels good unless it's that thing. And that's why the treatment helps. I tell the patients all the time, the medication, all it does is calm your brain down to make the decisions you need to make. I spoke about 7, 18, 19. Okay, the people in addiction, they know what they need to do. They just don't have the ability to carry it out. And that's where we come in with that support, with medication, with counseling, addressing the past trauma, anything that we can do to help them. Just know that there is hope. And for families, again, look at it this way: the families that oppose treatment, that try to hide the mental illness, would you rather have your child alive or your child dead? And that's what I tell people all the time. Look at the benefit. I know one of the hardest things for any parent is to lose a child. And so even for me as a provider, I've lost patients. Every time I lose a patient, it just hurts me so bad. It's like, what could I have done different? That's what I keep replaying in my mind. What could I have done different to help this person?
Yeah. All right. Thank you so much, sir, for that. Another question here from Victory. For someone suffering from a substance use addiction, which is linked to a past trauma, if the person heals from his past, can the addiction stop with time, or does something else need to be done?
Well, again, addiction is a chronic illness. So the trauma is part of it. You have to look, there might be genetic factors, there might be other things involved. You are never cured from addiction. So it's something that you're going to have to deal with for the rest of your life. Like Jill said, she has to make sure that she continues to do what she's doing, involved with her family, speaking, engaging with her children, taking her medication. So you have to continue doing all that. For me, like I said, I have to continue doing the things that I do. I'm very honest with my wife. I don't lock my phone. She sees my calls. I don't hide anything. I don't lie about where I'm going. I play table tennis. I play volleyball. I go to work. I speak. So those are the things that are helping me to live a normal life. And I keep doing that. So you cannot stop doing the things that are helping me.
Okay. Right. All right. Thank you so much, sir. Victory, you can always give a feedback if you need more clarification. But we still have some more questions here on this form that I shared. I think it's from those on YouTube. I'm not quite sure because I shared the link there. So the question here: what signs do you watch? What signs do you watch for that indicate medication is working or not working in a patient's recovery journey?
What signs do you want that the treatment is working? So, the one thing that I say, like most of my patients in treatment, like when I did family medicine, people would not show up for their appointment. But when it comes to addiction, I'll tell you that almost all my patients show up for their appointment. So for me, as long as they are taking the time to show up, they are trying. So that's one thing that I always look for. They always come to the clinic, they are trying. But again, you can see the changes. They are more honest. They are not lying to you. And, I can talk to them like I'm talking to a normal person, just like we are having a conversation now. You can tell, you can just tell. They are more honest. They are showing off. You can see a difference in their appearance. You can see, in the accountability, So sometimes if I have a patient who is always late, we make that part of the treatment plan, is that you're going to be on time for your appointment. If they don't have a hobby, get a hobby. So we set small goals that they can accomplish within a week or two or within a very short time. So that encourages people to keep making small progresses. So it's baby steps. When you look at the whole picture, it gets very overwhelming. But the addiction did not happen in one day. It's going to take a long time to get someone back into a recovery process that, you can tell. But again, just the fact that people show up for their appointments, to me, it's a blessing. And that they're sharing their story openly.
Right. All right. Thank you so much, sir. Okay, we still have more questions here. I think, this is to Jill. Thank you so much for sharing your story. I'd like to find out what your biggest fear about going on medication was and how did that fear shift over time?
Was that the question?
Or no, what was your biggest fear with starting medication and how did
Oh.
it change over time?
Let's see. Sticking with it, knowing in the back of my mind that I could never get high again, that the medication that I'm taking is going to make sure that I don't ever get high again. That was very scary for me because coming from years of addiction and using multiple times a day to knowing I'm going to and wanting, I mean, of course, I want to stop using. I want to, live. But there's always that fear in the back of my mind that something that I've been so used to, that I gave everything up for, the fact that I can no longer do that again, that was very scary. But I mean, when you're just done and you're sick and tired and you're just, at you're rock bottom. You don't care what you have to do to change that and to change your life around. So.
All right. Thank you so much, sir. Thank you so much, Jill, for that. So would you like to add anything? Well, I think that question was just specific to Jill. So yeah, there's another one here. Can you share a moment in your work that deeply moved or changed you? I think this person is in awe of all that you do. So
Is that for Jill or for me?
I think that's for you, Dr. Fatoki. Can you share a moment in your work that deeply moved or changed you?
I can tell you, for me, it's just seeing that people can actually get better. That's what moves me on a regular basis. I high-five my patients all the time, when they get a promotion, but just looking at people from where they were at the rock bottom to where they are today, there's nothing more satisfying to me than that. Again, I remember Jill coming in, the wounds were smelling so bad. I'm trying not to gag and not to stigmatize her, not to, just to keep her and still be able to be open with her, and then to see how she is today. Actually, the first time we did a presentation together, I think it was with Jamila, she put it together. It was just awesome to see that we can get to that point, to see that I can trust her to show up on time, for a talk. And, I told her this when Sophie told me, that, okay, we are going to do this. I still don't have it together, but we'll do. I want us to weave your story into the medical treatment. And just to see this happens, it's amazing. People do get better. Lives do get changed. Jamila mentioned my history taking. Again, I'm going to talk about Mark Sanders. Listening to him, watching him in class, and the way he just brought this, that's really part of what changed my mind with addiction. When I took the master's program, so again, I was stigmatizing people. I just couldn't believe people did that. But listening to a professional, I just like, oh wow, it just made everything come alive for me. And again, I can't thank him enough. He's been a mentor and a great teacher. So
what a beautiful presentation today that spoke to my soul. Thank the two of you so much.
Yes. Okay, kudos to Mark too. Yes, Dream Team. Thank you so much. Thank you so much. This has been so insightful. Okay, I think this was a follow-up to the last question that I asked. What really motivates you in your work, like the ability to stick with your patients, the recovery, in spite of the relapses? I think it's just more of you seeing them better. Or would you like to add to that? Because this came in while you were responding.
In addiction, I see people get better. I'm not listening to the same diabetes, hypertensive story all the time and, begging people to go get their tests done and stuff. People in addiction, in recovery, they want to get better and they actually do get better. I see the results of the work that I do. I see the results. It's obvious. It's just satisfying to see someone that they are thrown in jail and now they've got a great job. They've got a family. I have patients who have very good jobs like plant managers. I have nurses, just people that you could, all walks of life, that you could never know they ever had a problem with addiction. It's just so rewarding.
Mm-hmm. Yeah, thank you. I think that's all we have. Someone would like to speak. All right. Yes, please go ahead, sir.
No, sorry, that's our next speaker. Sorry.
Okay. So again, sorry, I know we took off more time than you guys allotted us, but it's been a pleasure. Thank you very much
Thank you.
for the opportunity.
Yeah, thank you so much, sir. Thank you, Jill. It's
Thank
been
you.
such a pleasure having you join us. Yeah.
Thank you so much. Thank you so much. I really do appreciate it. Thank you so much for that. All right. Sophie, over to you.
All right. So our next speaker is here. Sorry. Welcome, Ambassador Kenneth. So good to have you here. I'm guessing you're ready for us. I believe you're ready for us. So yes, that was such a wonderful session. Thanks to Dr. Fatoki, to Jill, to Jamilia. Thank you. Okay. Yeah, sorry, I just wanted to check and make sure that I wasn't missing anybody's question. So all questions have been answered. And so I'll just quickly introduce our next speaker. So give me a moment, please. Okay. So we'll be hearing from Ambassador Kenneth now, and yeah, let's know a bit about him before he starts to speak. Okay.
We can't hear the video. We can't hear. Yeah. No, we can't hear the.
I'm not sure why that's the case. I apologize. Okay, I would sort it out. But yeah, Ambassador Kenneth is here.
Okay. If we
Yes,
try one more time.
Okay. I'm really sorry about that. Let me try again.
Okay. That's okay. We can't hear. Are you sure you did you didn't
So I'll just read his bio out then. I'm so sorry. I really don't know what the issue is, but yes, I will just read his introduction so you know a bit about him before he starts. Yeah. Because it's quite unstable. I don't know. Okay, we'll sort it out. So Ambassador Kenneth is a respected voice in faith, integrated mental health, and addiction recovery. As executive director of a New Thing International Foundation, he champions community healing through education, advocacy, and trauma-informed support. His mission is clear: to merge faith and science in overcoming barriers to mental wellness. A seasoned speaker and advocate, Kenneth's influence spans professional and spiritual spaces. As vice chairman of ASHAN, he contributes to leadership and social impact initiatives. With personal and professional insight, he inspires hope, resilience, and purpose in those navigating addiction and trauma. So, Ambassador Kenneth, you have the floor. So happy to have you here.
It's a pleasure to be here. I don't take it for granted. Thank you. Can you see me?
No, we can't see you.
Okay, let me work on that. How do I work on that so you can see me? Okay. Can you see me now?
We can.
Okay. So it's Casual Friday. Good afternoon, good evening, good morning from wherever you're watching. My name is Kenneth Aneto, and I am thrilled to be here today. It's been a whirlwind of activities. I'm actually working out of the office because today is International Girlfriends Day. So at our wellness place, we are inviting young ladies to the office, and we're sharing cupcakes and talking to them about their mental health in the office today. So it's a women-focused meeting. So all the men have been asked all the men have been asked to step out of the office. So they're talking to the girls about their mental health, about relationships, about taking care of themselves, about different things that are important to women. So I saw it as important that even if I'm the head of the organization, I shouldn't say I'm breaking the rules. So we wanted the women to feel comfortable in the space. So thank you again for this opportunity. And very shortly, in a few minutes, we'll be discussing about breaking the chains, overcoming addiction through faith and resilience. So first of all, I'll just give a brief introduction of myself. My name is Kenneth Neto. For the past 10 years, I've been opportune to speak to youths on the dangers of substance abuse. What started off as a Youth in International Foundation was a direction I got from God and inspiration I got from Him. And it was just to talk to my peers about the dangers of substance abuse. And as we moved, the vision kept growing. What started up as my parents and siblings called it a pet project. It has grown into a movement that has influenced policies in Nigeria, has led to different initiatives, worked with different government bodies in different capacities. And even today, being consulted with INGOs, consulting for INGOs, consulting for government agencies, and still hoping to do more as the Lord directs. I would just like to thank the management, the staff of Living Vines Mental Health Foundation for this opportunity, because the work that you're doing is phenomenal. It is beyond borders and the reach is exceptional. And I pray that God that inspired this idea continues to provide all you need for life, godliness, and for purpose in Jesus' name. So the theme of my meeting, the title of this presentation is Breaking the Chains, Overcoming Addiction Through Faith and Resilience. This is not just a lecture, it's a conversation about liberation, about healing, and about hope. First of all, I know that a lot of people have given their own opinion about addiction, so I'll just like to maybe brush through it a bit. Addiction, what is addiction? Addiction is a chronic relapsing brain disease characterized by a person going after a particular drug of choice, regardless of how it affects him, how it affects his family, and how it affects the society. There are different types of addiction to actually talk about it. There's substance abuse. That's a type of addiction. There's gambling addiction. There's porn addiction. There are different types of addiction that people might be going through. Some common roots of addiction include trauma, isolation, pain, peer pressure, identity crisis, trying to cope with different things that may be going through. And there are invisible chains that might keep people bound to addiction. That's when we talk about stigma, people suffering in silence. I know I've been opportune to talk to people, and I know people that would just be in silence, just holding on. I was a research paper that I read about someone that the wife was someone that the wife had a particular disease, and after from the wife he contracted that disease, and he just went into opioid use because he felt like, if the person I meant to trust the most can put me in this situation, and he was just in silence, he never let anyone know what was going through. So there are a lot of people living in silence. In Nigeria, statistics show that for For the statistics taken in 2019, that was the last general survey, National Drug Use Survey. It showed that for every 7 persons in Nigeria, one has used substance in the last 1 year. For every 4 persons that is using substances, that one has a substance use disorder. And for every 4 persons that has a substance use disorder, 1 is a woman. And women go faster from casual drug usage to problematic drug usage, because when women use drugs, they usually use it with multiple partners, especially when they inject those drugs. But in terms of the treatment statistics in Nigeria, for every 20 persons that is treated, this was a study done in 2020 by the Nuendo. It was a Nuendo study. It showed that for every 20 persons that is treated for substance use disorder, only 1 is a woman. And why is that? Stigma. There are a lot of invisible chains, and I call these invisible chains, examples are stigma. Women face stigma from caregivers. Women face stigma from fellow drug users. Women face stigma from even the community members doing reintegration back into society. And these invisible chains, they are part of they just put people in a vicious cycle. They put people in a vicious cycle. So I've learned to understand that our culture, our religion, and our community can unintentionally enable or ignore addiction because of the statistics that I just mentioned. That's why I really appreciate the organization for putting this together, because we're actually opening the mind of people, we're breaking the barriers of culture, we're bridging the gaps in religion, and we're building bridges through our different communities, wherever people are joining from. So I am personally, when I look at the topic of addiction, I said that it's something about hope for me, because I see the way that people can live and grow, and although they grow up in the best circumstance, they can later find themselves in a wonderful situation. And I have heard different people talk about their addiction journey. But as somebody that has personally had an addiction journey, I would like to share my own personal story, because it has become, I've been taught in ministry that personal dealings might not always be a template to give to people. But I've learned that we can overcome by the blood of the Lamb and by the word of our testimony. And I've seen sharing my testimony with people that are having challenges with substance use has been a strong power, a strong tool in helping people through that journey. And I'll briefly just talk about my own testimony. My journey of substance use would have started in high school. I think in high school that year, when we had a couple of young graduates, we just went into our SS1 in formal Nigerian high school, secondary school system. And throughout my stay in school, from GS1 to GS3, I had been one of the prefects, one of the leaders in school. And when I just came back from the UK that time, I think I came back like a week or 2 weeks late. And the next thing, after 2 weeks in school, they now announced new prefects. There was no formal meeting telling me that I wouldn't be a prefect. And I felt like, my whole life I've been this guy that has been upstanding. My whole life I've been this guy that is upstanding. I've been this guy that has been always meeting all the rules, being a good boy, so to say. And I felt like, is this now the reward I get for all my loyalty? So I decided that instead of being the good boy as I had been all my life, this time I will try to see and be the bad boy. So I began to intentionally seek out everything that will make me bad. I decided that I wanted that if you entered into a room and said, who is this guy? They'll say, no, 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 that's the bad guy. So everything that embodied being bad, I was going after it. What are the characters? How do they dress? How do they behave? Who are the people that are bad already? Let me be that friend. And I intentionally went after that. And in that time in our school, there was an Italian that just came into school. He was expelled from his own school and came into our school. And I was like, yes, this is the person I want to be my friend. And I became friends with this person. And in becoming friends with this person, everything the person did, I began to intentionally go after those things. Okay, Bilal said he drinks. I'm going to learn how to drink. Bilal said he does this. I'm going to learn how to do this. And I started doing that. And that was the first time. That was the first time that I had encounters with such substance. And the particular one, I'm coming, hold on, I think there is. Hello, can you hear me?
Yes, we can.
Okay. So in that time in secondary school, there were different people doing so many things, and it first started off with what was it? I think marijuana. Then yes, it started with marijuana. After from marijuana, there were other substances. There was codeine, cough mixture, different things, and it was a slippery slope. And before I knew it, I was having a disciplinary meeting, and the school was like, oh, they can't handle this anymore. And it just took off from there. I got expelled from my first secondary school. My parents were disappointed. I wasn't moved. I went to my second secondary school, and while I was there, I continued to just glide along because I think I got expelled in SS2. From there, I went to the second school and I continued to glide along. And life was just passing by. But there was always something about me. I always had this talent. I was good with the creative arts. So in my high school, every competition that they will have, I would be the one that represent the school. And even when I had left there, I continued with the arts, continued to develop my capacity in the arts. And it went on. So I went to my first university after graduation. It was a breeze. It was in Adamawa in Yola. It was owned by a very big It was owned by the then vice president of Nigeria. But the drugs didn't let me study, and I ended up leaving that school. After leaving that school, my parents were disappointed, but it was a journey. And I just continued on that slippery slope. But there was this light that God left in me, the talent. So I kept getting invited for different competitions by big companies, Multina, Globalcom, and I would go, I would win. There were cameras in the house. There were always, I used to think that you could not express yourself artistically without the use of substance. So you know that when we talk about different stages in substance use, there's experimental stage, there's now the casual usage stage, then there's now a stage that a person ties particular activities to the substance use. Sometimes someone will say, they only take substance because they want to be in the party. If they don't take the substance during the party, they can't enjoy themselves. Some people will tie that, they take substances because they want to be brave enough to talk to women. I've seen examples like that. Some people say, okay, they take substances because if they don't take substances before they go to play football, they will not be energetic. Or even in my travels to the north, I realized that a lot of aphrodisiacs are being sold in the north, and a lot of men, when you ask them questions, a lot of women, they say, they can't perform in the other room except they use substances. So that time I was feeling like I could not express myself as an artist without using substances and things like that. And so it went on, the substance use went on for a while. I went to my second school. I wasn't really serious. I flunked out. When I flunked out of my second school, then there was this program. So Disney, the company, Walt Disney Company, they came to Nigeria because they needed more they were doing like recruitments. So they came to Nigeria to recruit talents. And I auditioned. And when I auditioned, it was perfect. I got picked. I was like, what I've been waiting for my whole life has happened. All this, my dancing, my talent, everything, the singing, everything has accumulated to this point in time. And my parents refused. My parents like, nah, they're not gonna let me go abroad. With Disney, where I'll be. I was so angry. I felt disappointed. And immediately after that, they sent me to my third university, and I started going. When I went to that university, I was sad. I was just like, but I continued singing, continued rapping, I reduced my dancing. I was just, all I was doing, I was just had my yogurt and my cough syrup, and that's all I was just doing. Then one day, one of my friends that I met there, his dad, their family were billionaires, and the dad got really sick, and we're praying for the dad, going to mass for the dad back then, and the dad passed away. And once the dad passed away, I was like, he's not gonna go to school again. He called some of us and said, look, that he's already a billionaire. What do we need to go to school again for? That we should all leave school and just go home. And that's what we did. We all left school and just went home. We just went home. While we're home, it was like, you're already a star, Kenneth. We'll pay for, I'm just remembering those things. So like, we'll pay for, you're the artist, you triple threat, sing, dance, act, rap. We're going to pay for studios, pay for everything. You just sing, we invest in you. But we never did any of those stuff. All we did was drugs and drugs and drugs. Drugs, parties, girls, started buying more cars in the house, started buying more dogs in the house. We had like 2 houses in one compound all to ourselves. And it was a roller coaster. It was a roller coaster. And the only singing we would do is when we would have our parties. Games and just going on in circles. No actual songs were actually recorded. Just fun and games, just going in circles. Then they started buying guns because my friend's brother started getting paranoid, feeling like, man, because of all this money, somebody might be trying to kill us. Started buying guns in the house. And when you have money, when you have plenty cars, have plenty guns, have plenty friends, and you felt that trouble was coming for you and trouble doesn't come, then you start going out to look for trouble because you got all those things because of trouble and you wanted to show off. And we began being so troublesome, getting into fights and different things. Then I remember on the 2nd of January, I think that would have been 2011, was New Year's, and we had not really like gone out to celebrate because every day was like celebration in the house. So I wanted to really go out. So my friend called all his sisters, we all got together, we got 2 cars, we went to a popular place in our state, in the FCT. And it was like it's like a mall, and it's a big mall. So many activities go around there. And we were like, okay, so we like put like 2 bags full of money in the boots, and we're like, we're gonna blow all this money. But when we got there, all there was to do on the place, it's like a popular place, but we now realize that it's more of a popular place for children. There were a lot of they watch movies there. There are like eateries there, and there are now a couple of places. The higher thing we could buy there was popcorn and ice cream. Nothing really to really do. So we now said, okay, we're going to go and drop all the ladies in the house, and we are going to go out somewhere and just paint the town red. Only little did we know that red we wanted to paint the town with would be with blood. So when we came out of the cinema, we're now going out. As we were going out, the other car overtook us And we're like, wow, it's like these guys want to race. So the person that was driving was like, okay, let him switch seats with the passenger because he could drive faster. So as he switched the seats, he forgot to put on a seat belt. As we were going, with the road we were meant to go back home, and we were racing on the highway, and the other car was going straight, and there was a sharp curve. So we're thinking, are we going straight? Are we taking the sharp curve? Are we going straight? Are we taking the sharp curve? And at a split turn, we're like, we're going home. So we now took the sharp curve, and the car just slipped, just scratched and hit off the pavement, and the car began to roll. Poop, 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 poop. I still have those, I still have those, those. I still remember the song that was playing when the car was rolling. There was this popular artist back then. Oh yeah, come around. I like the way you roll. I never forget that song. Anytime I hear that song, I just remember. And the car kept flipping, and we're in the car. We're about five guys in the car, and it just kept flipping, and it finally stopped. When I think about the story, I think that I was waiting for the car to stop. So when it stopped, I jumped out. But when people tell us the story, they said that when the car stopped flipping and it landed, that people had to come and stop, like hit on the car, bah. That was when we started coming out that we were unconscious. And you can imagine this was like beside a very popular place in our city. And it was on the 2nd of January in the evening on a major highway. So a lot of cars stopped. People were coming like, are they alive? Are they alive? I remember I remember that one of my friend's sister, she came with like a bag of there are these packs of handkerchief, and she had a lot on her, and she kept giving me, and I would just soak my face because there was blood all over my face. I would soak my face in it, and I would squeeze it, look at it. The blood would still be coming. I kept soaking it and soaking it. She was just seeing her. She was just everyone was so scared. While we're still trying to get our acts together, that's when we now realize that where's the driver? Where is the driver? That's when we realized the driver had flown out of the car. So we started looking for the driver around, and the driver, his name was Somo. Somo was about 6 foot something, very, very tall, big, buff individual. It was not easy to lift Somo up, and we had to work hard to lift Somo up. And we lifted Somo up. After lifting him up, we got him into the car. We got him into the car. I was the one that actually was able to carry Somo. So we got Somo into the car, lifted him, put him in the car, and we're rushed to the closest hospital. While we're in the hospital, they had to take people in one by one because they had to bring in stretchers, wheelchairs, and different things for people. What an experience. And when they came to get me, I remember as I was going into the hospital, I saw, because the hospitals in Nigeria are very interesting. If you don't have health insurance, you have to pay before you're attended to. And I remember them bringing out the cash we had put in the boot, and that we're like, we're going to paint the town red today. We're literally painting it red with our blood. And I remember seeing the mint 500 naira notes being put on the table, saying, count it, just treat them. I was immediately put in the emergency ward. I had stitches done on me. This my ear that literally Nigerians have this thing that they say in laid back Nigerian slang, you no go hear word. You no go hear word. So if you look at my ear, there's a stitch. I think it's quite healed now. So there was like a lot like this, all the way like this. So, but these ones were like scratches. It was deep around here. It's quite deep around here. And very, like, the ear literally cut off. You know, when our African mothers would say that pulling your ear so you can hear, it was like literally God pulling my ear so hard. It literally cut off. And they were stitching me. I remember when I came out, they gave me morphine. I couldn't even walk because of the medication they put me on. And when I came out, they put me on a wheelchair to go do an x-ray for me because I couldn't walk at first. And I remember seeing all the people that were outside. Different people had heard the news. I will not say I was quite popular then, but I would say that well, we had a sort of reputation, and different people had heard the news, and the hospital was filled with well wishers. Ah, sorry, 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 and the hospital was filled, and I could not even talk because the medication I was on, I could not walk. I was in a wheelchair, and they were just pushing us. Remember people coming to hug me, people. Such an experience. And after that, my mom said that she had had enough. That I've tried, and they were like, they don't want me in the house again. That I need to move I need to move, and my dad advised that I stay with him in a project that I go with him for a project that he's doing out of town. It was a project for the National Primary Healthcare. Was building a couple of healthcare centers in eastern Nigeria. So we went after we inspected the project, started the project process. We now came to stay. I was now sent to stay in Edo State with my auntie. Her name is Reverend Pasi Aneto. So my auntie is an ordained minister. She was ordained by Archbishop Benson Idahosa. When I got to her house, contrary and different to things that I heard before, she never told me you're a bad boy, you do drugs, because everybody knew that I was this person. But my family tried to cope with me because although I was doing drugs, I was talented. There were cameras in the house, people coming, talent, bringing different things. So they were like, well, they're doing their best. But she never told me anything. But my mom told everyone, yo, this guy is doing drugs. Don't let your children come close to him. I appreciate what my mom did. She didn't try to hide it. She wanted people to know so that people as well. But my auntie, all she told me, like, okay, all we do in this house is that we go to church on Wednesdays, on Fridays, and on Sundays. I said, okay, that's fine. And I was there. I left after the accident. I was in Edo State, and I was just there. Nothing was happening. I didn't know anyone. I was just going to church. I would call my friends. That I thought my friends would be like, the life of the party, our artist, our this. Where is he? Where is that? But surprisingly, no one was calling me to check on me, and I was just like, what's really going on? And life was just going on. Well, life was literally just going on. Okay. So I started going to this church. I didn't know anyone. I was just going to the church, and I would see the pastor. The pastor would preach, would do all this drama, and I was like, what's all this drama for? Well, fast forward to a couple of another extra month of people not asking of me, and I was like, nothing is happening. No, let me even listen to what this church are saying. I would hear people would come, they would give testimonies in church. They'll say, I used to be out of work. One would say, I used to be in a wonderful situation. Next thing, I came to this church, I prayed, I saw pastor. Pastor appeared to me in a dream, opened the cage and gave me a suitcase. Before you know it, that same week, I got a job. People would shout like, hey. I was like, they brought me to where they're acting Nigerian movies. Great. Somebody will come again and say, my family was in a bondage. The next thing I saw, Pastor appeared to me. Opened the cage and gave me a sword. I came out of the sword. I started slicing people. Before you know it, all oppositions in my workplace, they went down, this thing. Someone was like, I'd not had a baby for so long. I saw Pastor appear to me in the dream and gave me a baby. After that, I took in. Now I'm here with the baby. I said, these are the things I hear about in Nigerian movies. I'm now living them. My God. And I was just in a wonderful situation, just breathing. But I realized that after 3 months being there, like nobody's asking of me what is really going on. And these people are always sharing testimonies every day. Even if they fake 2, fake 3, they can't fake everything that I've been watching. So like, okay, let me really listen to what they're doing there. So I spoke to my auntie. I said I would like to meet the pastor, and she worked that out, got me to meet the general overseer. And general overseer said, okay, your pastor's nephew. Oh, so what is it that you want? I said, I just want to be able to take care of myself. Like, that's literally all I wanted. I don't want to be a burden to anyone. I wanted to be able to do my own thing by myself. And they're like, okay, that's fine. That's
And I saw it was 52 seconds, but he thought it was 53. But I said I looked at it, but he didn't agree. He said it was 53. So but he said
sorry.
hello? Hello?
I'm so sorry. Sorry.
Okay, let me go on. So I was told that in this church we pray and we fast. So he said if I can join in prayer and fasting, that I would see what I want. So I started praying and fasting. While I was praying and fasting, I met while I was praying and fasting, I came out one day. I met my neighbor. My neighbor said, you're from where? I told him where I was from. He said, so what do you do? I told him that I'm an artist. I sing. Oh, he's like, oh, his brother is an artist too. His brother sings. It's like, okay, I should introduce me to his brother. So introduce me to his brother. His brother sings too. And we started singing, practicing songs together. There was this particular day we were practicing our songs outside, and someone heard us, and the person was like, oh, you don't sound like this Benin artist. I was like, no, I'm not Benin, I'm from here. Like, oh, okay, we have a studio, come do a song. I was like, yo, is that how easy it is? So I went, we recorded the song. I'm like, this is fabulous. You guys are a good duo. Can you guys put up an album together with us? I was like, free album. Like, yeah, we'll market it and sell it together. I was like, yo. So that's how I got a studio deal. And now every morning, instead of being at home jobless in the gym, after exercising for a bit, I would get dressed and head to the studio, record songs, come back. And that's how I was going every day, every single day, every single day. It was just going like that. On one occasion, when we're coming back, I said bye to my neighbor. He went into his compound. Someone met him and like, why are all you young boys just useless? Why don't you guys find something to do? Like, yo, that he's not useless. Like, no, you leave the house in the morning, come back late in the night. What do you do? Like, no, that he's an artist. He goes to see. Oh, the guy was like, oh, even him, he doesn't have a job. He just came back from the UK and he's just trying to settle in that. Can he be our manager? And that's how we got a manager. On one of those particular days while we're on this journey, I was praying. No, I was actually on Facebook and I slept off. And in that moment, I had like my first encounter. And in this encounter, the someone that was talking to me, God was talking to me. And he told me that he wants to make me so rich. But if he gives me this money, I'm gonna kill myself and I'm gonna kill like 3 people with me. I was like, how is that possible? And I remembered when my friend that was a billionaire, there was a time that he told us he started giving us money every morning. That you go get this particular thing, you go get this thing, I'm gonna buy it, I'll give you money. Then he told me I should go and get any land, any good land in the city. He's gonna buy it, pay me a commission that's fat for me. And I went to go look for a land. And that land I brought it for him and he didn't like it. And I didn't go out again. And God was telling me that if I had put more that he was the one that made that not work. Because if I had done that, I'd have gotten a new car, filled the car boots with some drugs, gone and rent out. This time, instead of renting a room, this time I would have rented out the whole floor of one hotel and would do a party, invite all our friends and say, today we'll kill ourselves. And someone actually died. And when I had that encounter, when I woke up, I was like, wow, is this what God really feels about me? That he cannot bless me because his blessings will be detrimental to me and to other people. That's why he's holding back on his blessings on my life because of my character, because of my habit, because of my substance use. And I was like, if God is meant to be able to bless me without compulsion, without reason, God doesn't need a reason to bless anybody. The Bible talks about the lilies on 1,000 hills are His, that the birds do not have care for anything, that who takes care of the birds, who takes care of other things, the cattle, talk less of us. So if God will feel that He will not be able to take care of me because His blessings on my life will be detrimental to me and others because of my habit, Kai, I need to work on myself. And that's how I know that it was the supreme wisdom, because all my life people been telling me stop drugs because of this, stop drugs because of that, stop drugs. And I didn't care until I received a superior wisdom, superior inspiration from the Most High. And after that, I was like, yo, thank you, Lord, for this wisdom. I need to cut down. And I didn't stop like everything one day. After this encounter, I was praying that period, I was fasting that period. After this encounter, I began to cut down one by one, step by step. I began to cut down. I began to cut down on the drugs. And I stopped taking all the other drugs, the syrups, the Rafinol, and for a while it was just marijuana. Then I cut down on that, and it was just the legal drugs, the cigarettes and the alcohol. And it was at that period we had a manager. So I only had cigarettes and alcohol. And anytime we'd have an event, we'd have a program, the manager that we had would take us. And I was like, yo, these prayers are actually working. And I'd only been praying them for a short while. So I cut down on cigarettes too. I stopped smoking entirely. All I would take was alcohol. And that was at the point that the manager now told us that the Oba of Benin, the city where we were, that the son, the king of the city, of the place, that the son wanted to open a record label, and he wanted someone to come from the UK to manage the record label. And the person that was coming was his friend. So he was going to give us a record deal. And I was just like, this is it. What we've been praying for. I went to meet my pastor. I was like, Pastor, the prayers have worked. Everything has worked. We just need it. Pastor was like, are you fasting? I'm like, I'm fasting. Like, are you praying? I'm praying. Like, don't worry, they'll give you a record deal. So at that point in time, when they came over to give us the record deal, they gave us a contract. This was, I think, 2011. It was that same 2011. They gave us a contract. We'd each have one cars. We would share one house. We'll be giving 1 million naira as a den, and there'll be other things that will unfold during the contract. And I was like, I'm signing this thing immediately. But my friend was already a graduate of business admin, and he was like, no, they cheated us here, they cheated us here. This contract is. I was like, I read this contract, like, you need to read it again. I read it again, like, yo, let's sign this thing. Like, he's not signing. He pointed out a couple of places. I showed it to my dad. My dad pointed out a couple of places. It was at that point I understood that if I'd been waiting for a record deal for like 3 years and 3 months of conscious prayers would get me a record deal, it means that the record deal was not actually my problem. I actually need to go back to school. So it was at that point that I went back to, I told my parents I wanted to go back to school. My mom was like, that she thought that I wanted to live anyhow life. I was like, no, I want to go back to school. At that point, I saw what God could do with intentionality. And I actually stopped the alcohol too. And I moved forward. I didn't really stop alcohol. I just cut down on taking excessive alcohol. At that point, there was no more of the drugs, no more codeine, no more Rafinol, no more marijuana, no more cannabis. It was just strictly alcohol at parties. And growing up in the north, I never really liked alcohol. So from there, I got admission in Accra, in Ghana, and I went to school. In my final year in school, that was when I came back to school. God was already ministering to me about helping people that have gone through, that are facing this type of challenge. When I was coming back from school, my work in Ghana was amazing. I had such an amazing time in Ghana. I found God. I walked with God. I was in the school fellowships. I was enjoying God. I was literally enjoying God. It was such an awesome time. It was such an awesome time to be alive. I was enjoying God, and And when I think about my time in Ghana, it was amazing because there was so much that was done. And when I was coming back to Nigeria, I was active. I was an active member. I stopped doing secular music. I started doing gospel music. I was an active member of the different groups in church. I was able to minister to thousands on altars, on stages where millions of people watched with Pastor Chris, with different ministers, and it was such a time in my life. So graduating and coming back to Ghana, coming back to Nigeria, there was this thing on my mind, like, see all the progress I've made in this journey. Some people say that recovery is a journey. It's the rest of every day is recovery after substance use. And I feel like every day is the help of God. But as a professional, people say that every day is recovery after substance use. And now coming back to Nigeria, I was like, yo, I don't want to go back. Like, I knew the audience, I knew the community I was coming back. I knew the influences. I knew the plans that my family had for me. My uncle was a PAMSEC of an agency. Another of my uncle was the director general of an agency that told me that when you come back from school, you're going to serve here, you're going to do this, you're going to do this. In 3 years, you're going to be here. 4 years, you're going to be here. After this, you're going to be this, and I was like, yo, these are man's plan for my life. These are man's, and I knew that if I get too comfortable, I can easily just sleep, because sometimes we tend to justify our actions because of our work ethic. That's why we have to be, in our organization, we talk about healthy forms of relaxation. A lot of people that work very hard in the weekend, they say, because I've worked for all the days, 9 to 5, I can do anything to relax. Talking about gambling, talking about substance use, talking about sex addiction. So many people don't have healthy forms of relaxation. And I knew that if I got too comfortable, I could. So I spent time in prayer and fasting, asking God, what do you want me to do? And in one of those days, God told me, go talk to people on the dangers of substance abuse and the importance of abstinence. And that's making, in July, last month, made it 10 years since God intervened in my life and advised me to move on this journey. And this journey that started off as a journey of my parents would call it a pet project because they didn't still understand that, but a pet project that's got recommendations from the vice presidency, pet project that has me flying across Nigeria, a pet project that is now paying, a pet project that's putting me. Before this meeting, I was in a meeting with Youth Rise, is an INGO across the world. I was with the Nigerian group, inviting me to be part of that planning committee for a program. This month just started. Last month, I was in Sokoto executing project for the Senate Committee on Drugs and Narcotics. As coincidentally, the clerk of the Senate Committee was the one trying to get my attention right now. I was put on a committee for. Huh? Okay.
I can hear you. Yeah.
Okay. The clerk of the Senate Committee has been trying to get my attention. I think that's what's switching the network. Okay. So what started off as my parents would say, a pet project has gone into a project that has not only changed my life, but has impacted so many people's life. And I began a journey with the United Nations Office on Drugs and Crime, learning, being taught, and being trained on how to implement substance abuse prevention programs. And as on the course of that journey, okay, let me just set this up again. And on the course of that journey, I a lot of people saw the stories and know about the journey because people knew me when I was using substances and they know me how my life is now, especially one of my mentors that I look up to. And she was like, Kenneth, I know you talk to people on danger of drug abuse, but God has helped you on this journey. And she said and because of, I would say because of the faith that she had in what God is doing in my life, she has gotten me into so many situations. There was this young lady that was having challenges with substance use. And she called me concerning that, said she wanted me to go talk to the lady. And while I was there, I had done a couple of missionary work because I'm also a clergy of my church. I'd been posted about 3 times to the southeast again for missionary work. And while I was there, I was mentored by a pastor on deliverance because I was taught that there's a synergy between challenges that people face and the physical and the spiritual are two sides of the same coin. So I was taught on deliverance prayers, on how to have interventions, and we created a methodology. I wouldn't say we created, I learned a methodology on spiritual interventions in different matters, bridging that knowledge with the knowledge I had about substance use, with the knowledge I had about addiction, to say. I started talking to some of my friends, started reaching out to me on Instagram, like, Kenneth, we see the journey you're making. I don't know, there was this person that reached out to me, one of the first, said, I have this challenge with substance use and it's really messing with my family, my relationship. And I was like, yo, my story is purely, I didn't go to any rehabilitation center. My story is purely the intervention of God. I was like, okay, that doesn't mean that we have to pray to get. I was like, yeah, we could pray, but you have to know that I'm not a magician. I'm just a young man that believes in God and have seen God do mighty things. I was like, okay, let's do that. And that's how we started praying. We set up a prayer regiment, put him on a diet. Every day he's meant to read 2 chapters of the Bible. Every midnight by 12, we have some particular set of prayers that we'll take. Then on Thursdays and Fridays, we would all fast together. In the ministry I came for, we have a habit of fasting for 3 days, Thursdays, Fridays, and Saturdays, break on Saturdays. So he started joining me for 2 days, Friday and for Thursdays and Fridays, and we'll fast. By midnight, we would pray. I would be on the altar in church, and I would pray with him. And by the intervention and the mercy of God, his addiction just stopped. And he was like, wow, Kenneth, he doesn't know what happened. I was like, God happened. Trust in the Lord with all your heart, lean on your own understanding. All you always acknowledge me will make your path straight. We trusted, we didn't lean in conventional science or understanding. We just trusted that the mighty arm, the outstretched arm of God is able to pull people out. And that's just what happened. And after that, we was like, okay, thank you for this. I'm having challenges with my relationship. I don't know who I'm going to marry. I'm like, pastors don't give marriage advice. So they just get you spiritually seated up to a point where God will reveal things to you. Like, if you'd like us to pray concerning that, it would happen. And we started praying and God helped him. Before you know it, someone asked me, recommended another lady to me. The lady was preparing to go to the UK. She had a substance use challenge on using crack cocaine, crystal meth, methamphetamines. And we started praying and God showed up again. My mentor called me again from Abuja, said there's this young lady. That was a case. That was a wonderful case. There was this young lady, she's emaciated, this, that. And I told her that, Ma, I don't have any power of my own. I'm a young man that prays. And she was like, okay, just come and pray with the family. I met with the family. The mother was a district head of a particular church fellowship. She was district head of the fellowships in that area, and she strongly felt like this was the attack of God. That was a case that really grew me in capacity. And I sat down with her. I spoke with her. I shared my testimony with her. And before I left, I shared my testimony praying that God will bring her to a place of sober reflection, because that's what I pray. I say, God, as I speak to these people using the substances, when I share my testimony, my prayer is that you bring them to a place of sober reflection. And bringing them to a place of sober reflection, after a while, when I spoke to her, she got sober. I could see the sobriety in her eyes, and I asked her, would she like God to help her the way God helped me? She said yes, and I led her to Christ, as I've always done in the past with every other person that I've worked with. And after then, I put her on a prayer regimen. Said that this is what we're going to do. And this time, I saw the role of the family and support systems in this, because the mom was a prayer warrior. The dad, I'll not say the dad was a prayer warrior, but the dad was interested. Some of the siblings were nonchalant, but as long as I had a family member, it was good, because I had someone that could hold their hand. She would hold their hand too. So there was a certain level of accountability, and there's a certain level of discipline that would go on. So we started the journey. As we started the journey of prayer, some of the characteristics of group prayers is revelation. One of the characteristics is revelation and direction. When you have group prayers, among the members in the group, God will be giving revelation and direction. So as we're praying the prayer, we would get revelation on this particular matter. And that was one of the situations that opened me to the serious spirituality of substance abuse. So I was praying with them. I was expecting them to give me information, and they spoke about the background that their family came from. The dad's family is a family of a lot of occultic practices and things like that. And okay, I now knew that this is what we're dealing with. I was dealing with a family that there were a lot of idolatry in the family. Even in the family house, it's beside a river, and they make offerings to there, and all of them have their houses there. I'm like, okay. So I knew what I was doing, and we looked at prayers that would attack that particular thing. And when we started to attack in prayer, one of the characteristics of prayer in general is that when you attack, there will be a reaction. When we started praying, the girl ran out of the house. Oh, my God. It was such a case. She ran out. This is the person we're praying with. The person ran away. And it had been in her character to the past to run to some bunks, and she'll be missing for some days. And I was under a lot of pressure. I was like, God, I've boasted with your name. My mentor was calling me, Ken, what's happening? The person you're praying with. And I turned to God for prayers. And God gave me a prayer on how to call somebody from wherever they are. God taught me things, how to call somebody's spirit, call the person from wherever they are. And I started praying the prayers. And before you know it, she came back. They found her. I said, God, you are dangerous. A journey. And we continued the prayers. We continued. As we're praying, we'll be getting different type of revelation. We'll be praying, we would see things. Our spiritual organs were activated. We would see things. And when we see things, we'll change the dimension of the prayer until God gave us a tool for victory. And this was now the scripture we now stood on. And the tool we used was the blood. So we now understood that God, and the scripture we got was that no more would they say the fathers have eaten sour grapes and the children's teeth are set on edge, but now the soul that sinneth will die. So whatever attack was coming from the foundation and was trying to manifest. So we understood that sometimes if there's an arrow shot into a family, it could try to affect the weakest link. And when it's trying to affect the weakest link, it could manifest in different types of ways. I'm not saying that all addictions have spiritual foundations, but I'm saying that it is worth looking into. And it can try to affect or manifest in a person's life. It can affect in a child's life as waywardness. That's why we pray against spirits of waywardness for our children. And when it's trying to manifest, it can manifest in maybe sexual promiscuity, can manifest as maybe stubbornness or dullness in school, or it can manifest as an addictive behavior in that child's life, in which this case, it manifested in the daughter's life as an addictive behavior. So when we're praying, we're getting revelations, and we're praying with this. And he said that no more would they say that the father of eating sour grapes and children's teeth are set on edge. Now the soul that sinneth will die. So no more old foundation. So now the new foundation we set up was the foundation of Christ. and founded on the blood, the sacrifice of our Lord Jesus Christ. So we began to engage with the communion. So midnight, we put on the diet of scriptures. The mom was in on it, the dad was in on it, the daughter was praying with us, and we were on a diet of scriptures. So this diet of scriptures was in such a manner that 2 chapters a day, then midnight prayers on Wednesdays, Thursdays, and Fridays. And the girl was actively engaged. The mom was holding her hand through the process, and we're having revelations. Every time the mom would send the revelations, we'll change our prayers to attack these revelations. There were times that we'd see a tree rise up in the middle of the prayer. I would ask, did you have that type of dream? Say, yes, okay, we're changing it. Uprooting the tree of negativity, uprooting the tree of addiction, uprooting every evil weapon fashion. We're going in that direction. One time, the mother called me, said that she was sitting in her parlor. She saw a man appear in the room. I was warning her. I said, okay, strong man. We changed the dimension of the prayer to strong man. And as we were addressing it, surprisingly, not surprisingly, the lady got missing again. Oh, Lord. Someone that was praying with us got missing again. We went back to those prayers that God gave through revelation, praying for her, pulling her spirit back, pulling her back wherever she is, and she came back. Very good. Oh, no, this time she was found. I remember getting the call when she was found. I think that was on evangelism on a Friday. I just remember because I was like, God, I don't know what to do. God, you have God. I'm not even the one that put myself in this situation. It was my mentor, someone that is mentoring me, came and put me inside fire and said, okay, Kenneth, off the fire. And I was like, God, I don't know what to do. And I remember being on evangelism and I got the call, like, Pastor, guess what? I said, what is it? Pastor, the prayers at work. I said, what? He said, well, I found her. Very good. She came back. We continued the prayers. And as we continued like that, the addiction dried up. She told me she doesn't have those urges again. But being an intelligent person that has gone through training with the United Nations Office on Drugs and Crime, I've been trained with the Harvard Medical School. I said that in as much as we address the spiritual part of it, since we understand that substance is a chronic relapsing brain disease characterized by a person going after a particular drug of choice, regardless of what affects him, his family, and the environment, there might be some damages that have been done to the brain. So in as much as there has been an uprooting of the challenge in the spirit, let us address anything that could have been done in the brain so that there's no relapse. So I advise them to get some form of treatment. So to just address it. So we got a particular hospital in Calabar and they put her on some drugs. She didn't like the medication. She said it makes her always sleep. She's tired of it. But she went through it and today she's clean and sober. I had some other people reach out to me on Facebook with this. So it presents as a model. I would just call it a model, the breakthrough model. Let me say that. BREAK model. The first B being in God's belief, B for belief in God's power and in your own recovery. So when we share testimony with people, we bring them to a place of sober reflection so that they can start. Because if a person doesn't come to point zero and know that he needs help, his recovery journey starts with him. It's not about the family saying, no. The person has to come to a point of sober reflection first and be like, okay, this thing isn't working good on my family. I need help. So that's what we always plan to do first. Then replace destructive habits with productive habits. So we give them scriptures. Okay, we're putting you on a diet of scriptures. Every day, you must read these particular scriptures. Every day, you must particularly, every week, you're fasting on so days. So we're replacing those habits, destructive habits with productive habits, with purpose. Every day you're going to be doing this, you're going to be doing that. Every week you're doing this, we're setting tasks for them. Then we engage them, engage the family members. As the prayers are going on, we'll be engaging them to find out, okay, how is this going? How is this going? This. So engaging them actively to find out like when we pray group prayers, there are always revelations. So the revelations will be coming. As revelations are coming, by changing the dimensions of the prayer, God can give a tool. Say, okay, use the mantle. I've been in situations where we're praying and God did not give a tool because it was an easy case. There are people that we prayed like 3 times, they stopped. We didn't even hear from them again. But there was a family that I think someone that was in the Eastern countries, in the Asian countries, reached out to me, said they would like me to meet one of their mom's friend, that the dad just passed away. The dad was a PDP chairman. He died in an accident. The mom was alone. The students were in uni. She didn't even know the son was using substance, and she got the girl. So I went through the same model. B for belief, shared my story with him, brought the person to a place. God used my story to bring the person to a place of sober reflection. The person broke down, said he wants to give his life to Christ. After that, put them on a diet, scriptures, and a diet of prayer and fasting. Then we'll continue to engage. As we're engaging with them, we engaged like 3 times, the mother and the son, for the prayers. After that, they never reached back to us. I was like, I can't force your recovery journey. I can't force your recovery journey on you. The family has to be actively engaged. It's not like sometimes it's like they drop the patient for the for the doctor and say, it's now your problem. No, everybody has to be involved in the process. Then A for acts, we take different acts towards healing daily. We're having ministrations, we're interacting. And K for keep going. Even though whenever the person is free from this challenge that they have to keep going with the scriptures, keep going with your walk with God, keep going with your fasting, keep going with all those things that you have been doing, so that you'll never go back to that. So even this particular situation I shared, I thought that they had left. I didn't know that the boy God had actually healed the boy. But how I now found out that the boy had actually healed was that the mom got back to me, and she was like, she just discovered that the younger brother is using. I said, ma, I've been trying to reach you. You're not picking my call. She's like, well, after the prayers, the boy stopped doing drugs. In fact, the school did a drug test for them last week, and they found out that the boy is drug free, but they just discovered that the junior brother is now doing drugs. And in my mind, I'm like, ma, we're praying, we're working together. You got your testimony. You didn't even come and give glory to God. It's well. So we use I think this model that we use, called the break model: break, belief, replace, engage, act, and keep going. That is BREAK model. It has been something that we've worked with God, and inspired by God, inspired as a faith-based approach to substance use. In my other years, I've also been trained by different organizations. There's this organization in the UK, in the UK, part of the ISAC, National Substance Prevention Association. It's a group of Christian-based substance abuse professionals. Christian substance abuse professionals. There was a training they did for us on a model, an 18-phase model for handling addiction cases. So also work with that too. So as I'm closing, I would, whoever is there and whoever is listening to me, I would like you to know that chains break when we rise and we believe. And I would like to encourage participants that you could be that outstretched arm of God to people to help them out of addiction. You could be the hope. And I would like to pray for you. I would like to pray for 2 sets of people. If you're there dealing with a substance abuse challenge as you're listening to me, and if you're there wanting to be someone that God can use to help others, I'll pray for the first people. If you're listening to me and you know that you're dealing with a substance use challenge, you've heard my story. I do not boast in my strength, my power, and my ability. For if any man think he stand, let him watch lest he fall. My strength is purely from God. God has helped me. God has made me an example. God has put burdens in my heart. I know God wants me to do more. It is well with me. I'm helped daily. I'm working on clearing my schedules to be able to do more, and God has helped me mightily. And I believe that God has a plan for your life, because the Bible says God is not slack as man counts slackness, but he's long suffering, not wanting that any should perish. God doesn't want you to perish. He's long suffering. His arm is long, but how much longer will you hold that arm? How much longer will you let him keep stretching his arm? I want to give you this opportunity to come to this side. because love is available. And I pray for you. I know you already believe in, if you believe in Jesus, He's the author and finisher of faith. He came and He died for us. I'd like you to say this prayer with me. Lord Jesus, today I come to you just as I am. I believe you are the Son of God and you died for my sins. Today, I invite you to come into my life, to be the Lord of my life and the shepherd of my soul. From today, every chapter of addiction, every chapter of destruction, every chapter of sickness, of delay, of rising and falling, of lack is closed. Lord, lift them up that they will not dash their foot upon any stone of bad friends, upon any stone of risk factors that can lead them into substance use or into relapse. I pray that you that keep Israel, that neither sleeps nor slumber, you continue to keep them in Jesus' name. Amen. Hallelujah. Congratulations. Congratulations. And if you're listening to me right there and you're feeling like, I like what Kenneth is doing, I would like to engage with Kenneth, and I would like to be on this journey. I would like to just give you maybe 5 things I would like you to be doing so that you can maybe work like me. Look at the model, the break model. I would also like you to engage in intercessory prayers. I've been given some burdens that God has mandated that I should pray for every night before I pray for myself, before I pray for my family, before I pray for anything, my business. So every night, I would want you to pray first. We pray for those that use substances, that the God that gives encounters to various men, because He gave me an encounter, the God that interrupted the journey of Saul and an encounter that turned him into Paul, the God that is constantly giving men encounters, the God that gave an encounter to Samuel to go and anoint David, the God that interrupts the activities of men with encounter. I'd like you to pray for that God will continue to give encounters to people that are using substances. Pray for people in particular that use that substance. God, give this one an encounter by the agency of your mercy. Pray for the person. That's 1. 2, I'd like you to pray. The Bible says that we should pray to the Lord of the harvest, that He might send forth laborers that will go into the labor field. Say that the harvest is plenty, but the laborers are few. I believe that there are laborers that have the specific word of salvation. There are laborers that are gifted with the word of salvation for a particular person. There are people you will meet that you will not be able to tell them about Christ. You'll not be able to tell them about the addiction journey or this thing, but you can say, Lord of the harvest, send for that laborer that has that word in his mouth, that when this person speaks, that this one would listen to it. 3, I'd like you to pray that after you pray, I'd like you to pray that Lord of the harvest, send forth laborers that will push them up, that they will not drown in addiction. Pray, Lord of the harvest, send forth laborers that will push these ones using substance, that they will not drown in risk factors, but they will meet laborers that have that word of salvation, laborers that will hold their hand, that will pray with them, that will love them, that will understand them, that will be there for them throughout that journey. Thirdly, I'd like you to pray that whatever power that says that the youth, that particular person, or the youth of our generation in general, or the youth of your community, or the youth of your family will be useless, you bind those powers and you cast them into the bottomless pit of hell, wherever those youths, whatever that person, wherever the youth of your family, wherever the youth of your community have been bound, they are loose, they arise, and they fulfill purpose in Jesus' name. Fourthly, I'd like you to pray that as the north is separated from the south, as the east is separated from the west, by the outstretched arm of God, by His mighty arm, that we separate these ones from addiction and every form of influence in Jesus' name. And fifthly, you pray that He that keepeth Israel, He neither sleeps nor slumber, that you keep those ones safe in His arms. Safe in His arms. Where would substance use find them? Where would substance use find us when we are safe in God's arms? Hallelujah. And as you're studying on this journey, as you're being inspired by the story, by the testimony, and by this prayer, and you want to be going on this journey with this 5 prayer points I've spoken about, I also pray that God will keep you, God will strengthen you, God will give you grace to carry burdens.
Amen.
God will give you grace to carry burdens. God will give you grace to carry burdens. God will give you grace to carry burdens. God will give you strength to carry burdens. And I pray that Papa would say that the proof of the pudding is in the eating. I pray that you make full proof of your ministry. Your ministry will not lose, your ministry will not fall. You fulfill the purpose of God in your life. That's the passions that God has put inside of you, that they will materialize. The visions that God has shown to you in the secret place, that they will manifest, that you will not be a non-entity, that you will be a resource to your generation in Jesus' name. God bless you. God bless you. We have 13 more minutes. Thank you so much.
Fantastic. I want to ask, we're going to ask if we can get maybe like a slide or with those prayers. If you can send it to us, like just the is it the confession, the prayer? If you can send it to us, and so we can share it with our team, share it, and we can share it.
Yes, I would work on getting those prayer points. Work on getting the prayer points specifically for those that want to go into faith-based intervention, those that want to go into faith-based intercession for something, because we need more people praying on this.
Yes. So yes, please, if you can have that would be fantastic. We have a group where people meet, and they can definitely pray those prayer points, so specific prayer points. That would be fantastic. Thank you so much.
Yes, and please pray for those that are in the field. In the
Yes.
last years, I've been to everywhere, apart from southern Nigeria. I'm believing God for more opportunities there. But we have been to Sokoto, Maiduguri, Bauchi, Kebbi. I was in Kebbi for 2 weeks. Even last month, I was in Sokoto for a full week. And we know that God is going to, because we're His outstretched arm. We know that God, the nations are ours. Nations are ours. So.
Thank you for all that you do. We appreciate you. Thank you for coming. Thank you so much.
It's a pleasure. It's a pleasure.
We have questions and answers, right?
Okay. How about
yes,
12
we
minutes?
have questions. Thank you so much once again, Ambassador Kenneth. That was such a beautiful
I thank
session.
God.
I mean, I love the believe, replace, engage, act, and keep going. I had to write it down so that I don't forget. So thank you. So we have about 6 questions here. I think I'll take them. Okay, we have 5 actually. Okay, but I'll take 2 at once just so we're quick. Yeah. So you spoke about intentionality. How was it for you to be intentional about doing better? What advice would you give someone who seems to experience relapse quite frequently? And then the second one, what advice would you give family members or loved ones trying to support someone battling addiction?
Okay. So for me, let me use myself as a case study. The first question, what advice would you give with someone that is having challenges with relapse, right?
Yes.
That was it. Okay. Does the person have a Bible study life? And does the person have a prayer life? That's the right thing, because if you have a Bible study life and a prayer life, it would help to a degree. And also, you need to find out what situations you need to find out what are your triggers. Are you still putting yourself in those situations? When I spoke about my story, I said that when I was coming back to Abuja, I was like thinking that those my friends, those my friends, and God has helped me to avoid those my friends. There was one of my friends that was actually really using substances. He later, when he stopped, he later developed a brain challenge. He was using crack. Then fluid started. They were selling fake crack to him, and fluid started being captured somewhere under his brain in his skull. So when the thing was diagnosed, they had to drain those fluids from him, and the painkillers they were using for it was making him. So I had to avoid a lot of my friends because my friends were triggers. when we go out, all they want to do is smoke. And I was like, no, I'm not doing this anymore, because you won't be in the midst of them smoking and you just be watching. But I don't know what God did for me. I won't lie to you, because I stay down in the midst of those people and I don't feel those things. But it does not mean I should continually put myself there. Continually put your hand inside fire, feeling that because you have gloves, it will not burn. Your hand will not burn. But what about if the glove melts? May your glove not melt in Jesus' name. Amen. So he has to understand his triggers. What are the things? What type of situation is it that makes those things want to come up and this thing? And the lastly, pray. Just pray to God. Pray to God. Just ask God, I'm tired of this. Tired of this. I was watching a video the other day and somebody was talking about, when last did you have those talks with the Holy Ghost? When last did you have those meetings? Those your prayer. Just say, Holy Ghost, I miss you. Holy Ghost, I miss those days. Just consciously build a relationship with Holy Ghost, and don't be scared to ask for help. As I am here, I'm never scared to ask for help. Like, God, this matter is turning into something else. This relationship is turning into something else. Lord, help me. Help me. Okay, can you repeat the second question?
What advice would you give family members or loved ones trying to support someone battling addiction?
Seek the help of a professional. Do it immediately.
Okay.
Do it immediately. Just seek the help of a professional within your budget range, whether it's a purely residential facility, whether it's counseling, but don't feel like, we'll handle this matter, this. There's some people that are pastors. Some pastors are psychologists too. Those ones are psychologists. But even if you want to take it to your pastor, just know the capacity. You can know the capacity of individuals. That's why I just said seek the help of a professional.
All right. Thank you, sir. Another question here. Okay, they seem a bit intertwined. So, what practical steps will you say you took that helped you overcome substance use? And then, would you say your method of treatment is purely faith-based, no medication, no rehab use whatsoever?
I would actually say my method of treatment was purely faith-based. There was no medication. There was nothing like that. In terms of my own treatment, of course, I moved away from the triggers. I moved away from the triggers. I was actually relocated from Abuja to Edo State, and all the triggers that I had were no more there. I was staying in a place where I was secluded to myself, so it's probably like an inner residential treatment because I wasn't doing anything at that point. But if you think about it, practical. The question was, what practical steps did you take, right?
Yes.
I cultivated a good Christian life. I took God seriously. I've been going to churches all my life, and no pastor ever gave me a deadline. When I met my pastor said she gives me 3 months. Same 3 months that some treatment professionals will give people. She said she gives me 3 months. If my life doesn't change, I can leave the church. I should forget about God. There's no God. I was like, yo, all my life I've been going to church. Ain't nobody ever giving me no deadline. You give me a deadline. Oh yeah, now let's take it off. So for 3 months, I was intentional. For 3 months, I studied my Bible. For 3 months, I fasted. For 3 months, I prayed. That 3 months has been years now. Has been years. It's been over like 20 years. It's been over a couple of years now. Yeah, it's been years now. It has been years. So practical steps: separate yourself from the triggers. Move out of that situation, that type of situation. Change the friends, change the environments, change the distance. If you can't move from the state to another state, stop meeting with those people that put you in that position. That's why we need to start teaching people how to say no. Teach people how to say no without feeling guilty. Secondly, cultivate a good Christian habit. See, there's no way that you can turn on the fire and the snake will not jump out. Do you hear me? There's no way that you put the fire on and the snake will not jump out. So you need to turn on the fire in your word study, in your prayer life, in fasting and prayer. Those were some practical steps that I took. Thank you.
All right, thank you so much, sir. Let me just run through this remaining question. Okay, there's an appreciation message for you here from Councilor Tululope. So thank you, Mr. Kenneth. Then, okay, someone here. Thank you for being a voice, sir. Okay, I don't think this is a question, but let me just read it out. Just like you, I would also like to make my voice heard because I know that there are a lot of people that need help but don't know how to get it. So you can reach out and then we would, connect you to Mr. Kenneth. So yeah. Then Barrister Scholastica. Okay, well done, sir. Please, can you expatiate on the break model? I don't think our time will permit us for that, but maybe we can organize a session with with Ambassador Kenneth. Or sorry, if you can run through that quickly, but I know you spoke a bit about it during your session. And then the last question here. Thanks a lot for your presentation. If I have a relative involved in substance abuse, I know I have to intercede for him continuously, but how do I convince him to seek medical attention too?
So it's I would like you to, first of all, it's not there are people that have models. I don't know about other models where someone does it isolatedly. I would not say that I've had other models that I've explored. I've prayed with other people where the person using the substance use particular was not involved. And to the best of my knowledge, they were not all successful. There was a late friend, there's a late individual. The individual was late. The mom and the dad were elders in my former church. The dad is a politician. And the mom approached me and said, okay, let's work together to address this challenge. I said, okay, I'm looking at the time. Said, okay, let's work together. And we started praying and we're getting revelations. And the parents started making confessions about that was their first son. That there were different things that this. But the boy was not at home. Thus, we did not have a direct connection with him, and it was not part of the prayers. And although we prayed and I will not say I said God had his will. Just say that it's well. The boy was involved in a case. He comes from a very rich family, but he got involved with bad gangs. They went to rob a place, and as they were escaping in laid back Nigerian slang, we call it Okada. As they're escaping in the Okada, the boy fell off the Okada and he was hit on the head and he was lynched. I was actually the officiating minister at the burial. So I believe that what you can do is to try to get, I don't know how God is going to do it, but God is going to help you. You need to get the person involved. You need to get the person to see that, you need to pray that God should use you to bring that person to a place of sober reflection. Because when that person comes to a place of sober reflection, person can give his life to Christ. And you can also say, let us pray concerning this. As long as the person agrees with you for whatsoever we agree on earth, it should be established in heaven. As long as the person can join and agree with you and say, let us start this prayer, then from there you can take it up. If the person say later, I don't want to pray, say, oh God, we don't agree. Until we don't agree, we'll pray and just keep moving there, and God will give you victory. But it's important that the individual in the addiction is involved. You get someone you yourself, you're involved as a family member or as a concerned person, and someone with Holy Ghost. Someone with high spiritual understanding, high spiritual standing that can guide the process, that understands dimensions of prayers, that understands characteristics of group prayers, that understands scripture intervention tools, things like that. It's maybe I'll say faith-based professional or deliverance pastor, someone like that involved in it. But I would like to let you know that we are available. We can see how we can work together. Yeah. That.
All right, thank you so much. Okay, she has a follow-up. We don't have much time, sorry, but does that mean it's only God that can help prevent someone from falling back into substance use? And then one final.
No, okay. It's not only God, because you know that God has given the wisdom to doctors to be able to treat. So we don't act like naive people. We are faith-based individuals, but we are also intelligent human beings. So we understand what God is doing in our generation. It is God that made the plants of the earth. most chemicals, most items that are used for medicines are actually derived from these plants and different things. And it's God that created all these things. And it's God that gave the wisdom, the inspiration, and the direction to the doctors for them to be able to create these things for them to be used for us. So I'm not saying, it's only God. Even when the doctors work, the doctors are being used by God. Without God, no man can succeed. Do you understand?
Thank you so much. Thank you so much. It just shows that addiction that's why we're bringing so many perspective into here, into the training, because it shows that there are so many perspective. And, the most important thing is you are asking God to lead you and direct you in the aspect that you're in. And so I am booking in advance. Our counselors you're going to come and train our counselors. Is it the model? What's the model again?
Break model.
Break model. They are going to come and teach us. So we are booking in advance. All right. Thank you so much, Kenneth. Really appreciate it. Thank you so much.
Thank you so much for this opportunity. I don't take it for granted. Thank you.
All right. Thank you so much. Okay. So next speaker is ready for us, and I will just play an introduction. Sorry, just give me a moment. Okay. Yeah.
And do more than just automate. Can it?
We can't hear, Sophie. If we could hear, then it went off.
Oh, goodness. I don't know. Okay, seems like it still hasn't been resolved. So sorry, everyone. I'm really sorry. So I think I'm just going to have to read it. Yeah. I'm not sure why that's the case, but we'll try to resolve it. I sincerely apologize. Okay. Please give me a moment. Okay.
That's okay.
Yeah.
Dr. Fola, your video is not on. We can't see you.
Okay, so all right, we can see you now. So let me just read her bio quickly. So Dr. Fola Olatunde is a researcher and evaluator with over a decade of experience in enhancing social impact programs in both Nigeria and the United States. She specializes in integrating mixed methods and AI to drive evidence-based solutions. Holding a PhD in communication, rhetoric, and digital media, Dr. Olatunde's work focuses on bridging the gap between technology, research, and social change. Dr. Fola, we're so privileged and happy to have you here. Thank you for joining us. So you have the floor.
Good morning, good afternoon, good evening, good day, wherever we all are. I've been privileged to join the last session and it's been amazing. I'm so excited to be here.
Sorry, can you increase the volume?
Oh, my volume, the volume of my, hey.
Better.
Is it better now? Okay, so I said good morning, good afternoon, good day, wherever we all are. I'm so excited to be here. I joined more than half of the last session and I'm like, God is working. I'm a researcher, but I'm also a faith person. And I'm happy that we are in a space where we can share not just our intellectual prowess, but we can also share our faith alongside. So I'm excited to be here. I'm going to have my slides. That's how I know how to present. So I'm going to be sharing my slides and I hope that we can have an amazing conversation and we get to learn one or two things from this session as well. Okay. Let's share entire screen. Can you all see my screen? Hello?
Yes.
Okay. So today I will be talking about leveraging AI for research in mental health outreach and program evaluation. I would be prefacing understanding research a lot just because I know that we have diverse audience here. So I'm going to go as elementary as possible, and feel free to cut in to ask me questions. You can drop your questions in the Q&A. I would read them as we go alongside the slides. So what will I be covering? I would like to know who is in the room. I'll also, say a little about myself. We'll talk about what research is, and then what do we seek to know when we do research, particularly in the mental health literacy, prevention, and advocacy space. Then what do you do with what you know? What do you do with the data that you get from the research that you do? And what are the things you should know when you're doing research? Then we'll do some exercise. We'll get into my class. We'll do some lab work, if that's okay. So the first thing we are covering is who is in the room. So where are you joining us from is our first question. If you would drop in the chat, wherever it is that is possible, I would like to know where you are joining the session from. Where are we joining from? Sophie, is there a way to get feedback?
Yeah. You're receiving responses already.
Okay. I can't see the responses.
Oh, sorry. I thought you could. So I'll just read them out. So we have Ayobami from Lagos. We have Mrs. Prudencia from Cameroon. We have Fortune from Accra, Ghana. Those are the responses we have for now.
That's
yeah.
amazing. Okay. So we have people from all around. That's good to know. The next question is, are you a mental health program specialist or a non-program specialist? Are you someone who is in the world of advocacy for mental health? Are you doing intervention work, or you're just someone who wants to learn more about mental health? I'd like to know who my audience is so that I know how we carry on the conversation. Please, this particular question is very important. It would frame, the course of the conversation.
Okay, so Fortune says advocacy.
Good.
Yeah. Waiting for more responses.
Get the responses in. This is a classroom now. Let's get the responses in. I want to start calling out names. I'm a trained teacher. I'm allowed to do this.
Okay.
Oh, raise their hand so they can talk. So you can give them the option to talk.
Oh yes, you can raise your hand if you'd like to speak as well. But I'll just read the responses that we have. So Ayobami thinks she's someone who's passionate about mental health, advocacy, and she's basically here to learn. Then Victory is from Cameroon. She wishes to join the advocacy team, mental health in the future. She's a student dentist for now. Yeah.
Welcome, Victory. Amazing. Let's see if I can get one more person to tell me why they are here and if they are a program specialist or non-program specialist. One more person. One more person.
Okay, gotten one more from Mrs. Prudencia. She's getting started with advocacy and have been working with children, young girls, and women. and wishes to advance. I can't hear you anymore. Okay.
I like an engaged class, so thank you so much for responding. It's important to me that I get feedback. This is going to be a conversation. It's going to be a lot of back and forth, and I'm hoping that at the end of the day, we leave this conversation with something in our toolbox. Whether we're a program specialist that needs to understand what do I do with research, or you are just someone who is passionate for your own mental health or for the mental health of your family or a loved one, and you want to be able to leave here with information. I'm hoping that we're able to achieve that today. My final question: if you are not a program specialist, what's your current role today? What do you do in your day-to-day life? I think it's important that we premise this because every single one of us, we have networks of people in our lives that we either need to support, or in the roles that we play. Some of us could be teachers. As a teacher, you have students in your classroom. As a leader at the workplace, you have people that you work with that have challenges that they go through with their mental health. And, mental health in the workplace is a big conversation because, if mental health is an issue, it reduces productivity and people are unable to function well, they will not be able to do their jobs well. Also, as a teacher, I know that the idea of corporal punishment is becoming a thing of the past in most African countries now, and that's great. So that child that seemed like, oh, is this child picking up in school, and then we keep hitting the child with cane, it might be some other things that this child is going through. So it's very important that we are mental health literate. No one is exempt, regardless of the role that we are currently occupying in life. You have somebody in your network that you have influence on. And it's important that you are equipped with the right information, you're equipped with the right knowledge to be able to discharge your role and to be able to support others, whether you're a program specialist or you're just someone who is passionate about supporting people. I'm going to go back to sharing my screen, if that's okay. I hope what?
The comment here for you. So, based on the question that you asked. So she's an accountant by profession, but passionate about people. Since I've been working with children for about 20 years. This is what these children go through at home. Yeah.
That's great. That's my favorite group to work with. I know that in my life, if I'm not doing something that has to do with children, I'm not happy. So I'm happy to hear that even though you're an accountant, there is still that connection with supporting, the next generation. And, a lot of people do not realize that a lot of young people from the age of 5 that battle whether it's childhood trauma later in the future, depression, all of these mental health challenges get introduced at a very young age, the formative years of a child. So thank you for the work that you do. I'm going to keep sharing my slide. Please feel free to interrupt me, Sophie. I think I see another comment. So if you see a comment, interrupt me.
We have 2 more comments. So this is from Ayobami. She's in the customer service space. She loves relating with people and making them feel seen and heard. Then Fortune, he says, I am originally in the IT space. At the moment, I leverage my social media platforms to share content addressing conversations around mental health for the purpose of awareness.
That's good, Fortune. There's something in here for you in this conversation. Content creators and when they share mental health information online. I got you. Okay. So I'm going to go back to sharing my screen and say a little about myself. How did I come into this space of talking and advocating about mental health? So my name is Fola, like Elia said. My core background, I have my degrees in communication, and I've worked in the communication space, in the education space, health space, particularly in the mental health space. And I currently serve as program evaluation and program evaluator. And in these roles, I definitely use research methods, whether it's quantitative, whether it's qualitative, or emerging approaches to research to help programs to help programs improve their interventions. I also make sure that when I research, I'm doing research that are important to everyday use. We'll talk a little about my research work, how and young people learning about mental health, like I said earlier, people are picking up information from different channels. We'll talk a little more about that. Over the last 13 years of my career, I've supported organizations that are both local in Nigeria, in the US, and even organizations that have presence across different continents. And the crux of my work is how do we make people use information and data to make good decisions, whether for program or for personal use. So that's what I bring into the conversation today. And I also say very importantly, I am a lover of reality TV show, and I don't mean Big Naija. I don't know if anyone on the call knows the Great British Baking Show. It's one of my favorite shows. And one of the reasons why I really love reality TV shows that are educative is that it brings us into the world of the human mind, and we're able to learn a lot from people. So moving on from me, I'm going to be asking more questions. How many of you have ever Googled your symptom? Like maybe you have a headache and you go on Google and you're like, why do I have a headache? How many? What have you Googled recently? I can see thumbs up. Amazing. Amazing. What's something you've Googled recently? What's a health issue you've Googled recently? What's a health issue you've Googled recently? Google has become a verb, by the way. We don't even say search on Google anymore. We just say Googled.
Okay, and anonymous attendee, the sore I had on my mouth.
Amazing. How many of us are familiar with ChatGPT? It's probably the most known AI tool right now. How many of us are familiar with ChatGPT? Okay, so how many of us have used ChatGPT as a search engine for a health issue, whether it's physical or mental distress? And if you have, can you type in the chat what you've searched on Google and ChatGPT? Sophie, do we have responses?
Yes, we have. From Councillor Joanne said, why do I have pain on the lower right side of my abdomen?
Whoa, Dr. Google.
Then was attendee symptoms of anxiety. So Fortune is saying he does that from time to time when he doesn't want to share with anyone to raise concern.
Cool. So safe to say that most of us, if not every single one of us in this room, have had to use a search engine to Google our.
Yeah, and there's so many responses already.
Whether it's mental health symptom or it's a physical health symptom, so many of us have had to use search engines to Google something, which means right? It means we want some sort of knowledge to be able to navigate this distress that we are going through, right? That is research at the basic form. That's a simple research. When you go online to search for something, to know more, you're researching. So when we hear research, particularly as non-researchers, it's almost as if, it's one thing some select people with PhDs do. Nope. You do research in your everyday to-day life. When you go on ChatGPT and say symptoms of anxiety, it's a form of research, right? I'm struggling between sharing my screen consistently and not seeing anybody's face versus being able to connect. I love to connect. That's a strength of mine. I'm going to try and go back to the slides. I'll be going in and out of the slides if that's fine. So when you've searched something, or when you've Googled something, or when you GPT'd something, you have engaged in some form of research. That's research too, like I said earlier. So you've done what we call informal research. And informal research is for quick insight. It's usually flexible and unstructured. So as soon as you're saying, I can see a bump on my hand, what does this mean? It's you want a quick reaction. You want a quick information. You don't know how to describe this bump. You don't even know if it is reddish, brownish, but at least you are searching for something. But a formal research is usually more structured, more methodical. Informal research is very casual, no formal scrutiny. Nobody's saying, oh, you're not asking that question the right way. But when we do formal research, we are using established instruments to solicit information and make decisions. And when you're doing informal research, you're possibly not documenting it. Like I remember, I think it's Fortune that said in the group, oh, when I don't want to talk to somebody, when I don't want to have this conversation, I just go online and search it. So you are using these platforms to make internal decisions for yourself. But when we do formal research, we are making sure that there's an audience who needs the information, and we have to thoroughly document our steps, So, but whether you are doing informal research or you're doing informal research, the goal is to know more. And when you're doing this in the mental health space, you want to know more about your health. So whether you're searching Google or GPT to know more, to make your own decisions, to say, do I have anxiety? Am I struggling from this? Or whether there is a clinical scientist that is doing a procedural research to say, okay, what are the symptoms of this particular ailment? Everyone is doing some form of research. Okay. Do we have questions, feedback, anything I need to attend to before we move on to the next portion of this conversation? Okay.
We just have the responses from the text with respect to what they said.
Okay, I think I can definitely move on. So I have a next question. What have you searched? Well, what do you think you want to know, or people generally want to know, particularly about mental health in your community? Whether you're from Cameroon, you're from Lagos, Nigeria, what do you think? Why are you here? What are the things that we are looking at to know? Again, the premise of this conversation is on mental health information. What do you think people are looking to know? What information are people looking to find? Or have you found yourself looking to know as a person? About mental health in specific is my question now. In specific.
Sorry, as a host, I'm not allowed to type, so I'm trying to put things and I can't put it into the chat. But I don't know how. But for me, one of the things that I feel like finding out, I want to know what people are thinking, why they are thinking what they're thinking, right?
So you are talking from a mental health program specialist perspective, right? Yes, good. We are going to get there. For non-program specialists, what are you looking to know about mental health, particularly about mental health? You on this call, or let me even direct it to you. You on this call who is a non-program specialist who's just curious about mental health. What are you searching for? What are you looking to know?
We have a comment here. The symptoms of some mental health conditions and
symptoms. Symptoms is very, 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 very important. When we talk about mental health literacy, there are things we are looking to know. First, very importantly, we are looking to recognize symptoms. Second, we are looking to know how do we get help. Third, we are looking to know how can we support people. just like the last session that we just concluded, people were asking questions. I know somebody who is struggling. How can I get them help if they are not willing to take help? So we are looking to know symptoms, knowledge, to know more about mental health conditions, either to support ourselves or either to support people in our community, or where is help, particularly in countries where we do not have enough help. I did a study that I'm going to talk a little more about in the course of this conversation. In Nigeria, we have less than one psychiatrist or mental health practitioner to over 100,000 people. So where's the help? And we know with the prevailing economic situations, people are distressed mentally. People are constantly going through mental health struggles. So where do we get help? How do we even know that we've not degenerated into mental health struggle, even by ourselves? How do we know that that tiredness, that laziness, that lethargic feeling is not depression? As non-clinical specialists, those are some of the information that we see that people are looking to know. I'm going to share my slides. Go ahead, Sophie.
There are more people. Okay. So, from Ayobami, do people ever fully recover, or do people ever recover fully, or are they on medications for life? I think this is respectful questions that are going through people's mind. Then, this is from Mrs. Prudencia. How mental health affects Christian? That may be one of the reasons for the chaotic situation in church and the society at large. Then from Fortune, he says, in the conversation with my friend yesterday, we talked about this conference I posted about. And funny enough, he asked, do these things really work? He said some people are far gone, they can't come back. People really far gone in addiction beyond recovery. And how can I play that role with limited resources? Yeah.
Amazing contribution. Thank you so much. So people are even looking to know the efficacy of intervention. You know, I'm going to leave that to the clinical specialists that are in the room. We have able hands. So, if this is even question that we want to talk about later, if we have some time at the end of this. So people are looking for information. People are looking to know whether even if interventions are useful. Have some people a lost cause? Should we forget about them? Or, can I even come out of this? What's even the cause of this? What's the symptom of this? How do I know that this is even this and not something else? I'm going to keep sharing my slide and share some of the research that I did last year. The result of the research came out last year, and the research project itself was done in 2023, I believe. So I was in Nigeria specifically. I went to talk to young people about mental health. I wanted to know, how are they using mental health information, particularly in the digital space, and how do they go about, looking for this information, and what does the information that they get online in particular, how do this information shape their mental health literacy? Literacy is it's word for knowledge, ability to use information, right? So I went talking to young Nigerians, and some of the things I found out is that, a lot of people are like, these are quotes from my research participants. Like, oh, you can't control mental health, but there are things that you can do to give yourself a better and stronger mental health. So, I don't know that there is anything that I can do. I don't know that there is any, I don't have the agency as a person to navigate mental health. Some people are saying, oh, the root cause of mental health conditions for a lot of young Nigerians is black tax. Some of us might be familiar with what black tax means. Black tax is simply the money you pay or you give to your family when you start being well off. They've sent you to school. So when you're done, it's expected of you to just support the family. And in the Nigerian I'm sorry I'm mentioning Nigeria a lot. I know that we have people from other part of the world here, but mostly we see that this happens, especially in the African community. You're expected to then start supporting the family when you start working. Say, oh, this is a root cause of the distress that people experience, especially in an economy where the money, the income is barely enough. It says, oh, we don't even seek help for mental health in Nigeria. We just live in denial. I mean, because it's easy to do that. Every day in Nigeria, you're going through different type of shege. Shege means it's a colloquial for problems in Nigeria, But very importantly, people say faith is a way to cope with mental health distress. A huge majority of the people that I spoke to said is a way to cope. Someone says, I'm a Muslim. So most of the time, I just do my ablution with my praying mats. I go down on my knees, and that is the way I get out of such stuff. I usually do more talking to God. I hold on to my prayers a lot. And someone says, gratitude is very important for me. That's how I cope when I have distress. Some people say, somebody also said, you just need to carry your Bible and read, and you'll be okay. So people are finding information, they are sharing information, they are learning about how to cope, they are learning about what the root cause of mental health is, how Nigerians are coping, how young people in general are coping and navigating spaces. So also we've also shared in the chat that we've had to seek information to know how to cope. So very similar to the result of this research I did, we are also in that space looking for information. So how do they learn about mental health is the next thing I want to talk about. What channels do they go to learn? A vast majority of young people are likely to go online. They are likely to go online to learn about mental health. I'm going to go a little nerdy real quickly. This matrix that I designed for the information curve, and if you are in a program specialist, this is a very important thing for you to pay attention to. So I designed this information discovery matrix that talked about sometimes people accidentally discover mental health information. They just stumble on it. Sometimes it's a sequential discovery. After stumbling on information accidentally, then they go into a deep hole of searching, whether they're using GPT now or they're using Google. They just Google and use one hyperlink to the other. Sometimes it's intentional discovery. Some people are genuinely searching, whether it's because they have, personal struggles or they have a family member that have struggles. I want to read one of those quotes, and this will premise some of the other things we'll talk about in this conversation. Someone said, I will use myself as an example. I just recently realized from TikTok that I have ADHD. And with that self-awareness came with, now I understand a lot of the things that makes me act the way that I do. I'm going to stop here and ask, I'm going to put you on the spot, Edie. Is it possible to diagnose yourself of ADHD from TikTok?
Well, we shouldn't. We shouldn't. But we all do because, like you said, well, a lot of people do. Not we all do. A lot of people do because there is that. Like you said, that's where most people get their information from, right? So people go there and they can identify with somebody that says, "Oh, I was diagnosed with ADHD. These are my symptoms," and then you start to think, "Oh my goodness, those are the symptoms that I am currently having." So it's not the ideal. You should go through proper channels, go through a counselor and all of that to get, a right diagnosis. But yeah, TikTok is, yeah.
So thank you so much for bringing that perspective. If anything, this points out to the fact that people are needing help. People are looking for information. And like I shared, the statistics I shared earlier, in a country that barely has professionals, people will use whatever it is that they would use to be able to cope. So while I don't sit here and say, oh, this is not, don't do this, there is hardly enough professionals, right? But then the onus is on us as practitioners, as content creators. I remember someone said they want to start creating content, to be very, very conscientious about the kinds of information that we put out there, because people are diagnosing themselves, even if they don't have the expertise from just information that content creators put on social media, from the information that is available on the web, from the information that is available through ChatGPT or other AI platforms. So we cannot discount the effects of information available online in how people navigate their mental health situations and the information that they have. So, two things. Whether you're somebody who is not a specialist, who is looking for this information, how do you know that you're even finding the right information? So you don't make attributions that are wrong about yourself. Misinformation is online, it's everywhere online. How do you know that this thing that this person has said is actually true of my situation? Or I could take this, then find a clinical specialist to talk to, So information online, they are not innocent. They are not just information. They shape our thinking. They shape the way we show up to the world. So they are important, basically. I'm going to keep sharing my slides. Oh no. Can you guys see my screen? Not yet.
Not yet.
I do not like having to go in and out, but we'll make do. So, one of my respondents said, I feel nobody knows you as yourself. They would never be able to find out what's going on. So I really don't think it's going to be accurate in the first place. And even if it is, I will sort out my own life. So it's different from having to treat infection. I'm never going to pay for mental health information. That's another extreme of someone who is saying, I don't care what's out there. I'm just going to do me. How do we even support this kind of person with the right information? How do we make sure that we permit their apathy towards mental health information? As program specialists, we have responsibilities. I'm going to move to program specialists real quickly. I also want to be mindful of my time. So for the program specialist in the house, what do you think the people you serve want to know? What do you know the people you serve? As a program specialist, what do you know the people you want to serve? And what do you want to know? And what do you want to know about your programs? The programs that you're doing, and what do you want to know about the people that you serve? And I think Edie mentioned one earlier. If you can state that point you mentioned earlier again, Edie. As a program specialist, what do you want to know about the people you serve? And what do you want to know about the programs, the hard work you're doing, one of which is this kind of conference? And this is not just for ED alone. Every program specialist in the mental health program specialist in the house, please feel free to answer.
Well, we definitely want to know how people are getting their information, like you said, and how we can give them the right information so that they can have access to better services.
Good. Do we have any program specialists with adding to what she just said? Okay, so quickly, we are looking to know where are they finding information from? How can we support them with accurate information? How can we meet them in the channel that they are? And when we are doing that as program specialists, what we are doing is we are conducting research, right? And there is difference between what we call research and evaluation. Research, you are looking to publish the content of your work. Evaluation, you are looking to be able to improve your program. And I'll say quickly, if you're a program specialist, let's pay attention. Whether we are doing a prevention work or we are doing intervention work or a postvention work, we are looking to know how what knowledge my population gaining, my clients, the people I'm serving, what knowledge of mental health are they getting? So when you are doing that training, I don't know if some of the coordinators are on the group on this call. So when you go to that secondary school and you have your training manual, at the end of the 1 hour session, the 2 hour sessions that you've done for the last 2-3 months in mental health clubs, you definitely want to know that your population, your clients, the people you're serving, they know more about mental health, right? They don't see it as, it's not a big deal. It's just part of life. Then what skills are they gaining also? You want to know what skills are they gaining to be able to cope? What skills are they gaining to be able to navigate supporting others in their family. Also, behavioral change. I know we've talked a lot about addiction and substance use on this call. What you want to know is that when I'm doing my intervention, whether it's clinical, whether it's awareness, whether it's training, are there behavioral change? Are there attitude change? And is their conditions improving? And all those things that we are measuring when we are doing research for program, we can do it at any stage of our intervention. We can do it when we are doing prevention work. We can do this when we are doing intervention work and supporting people with, clinical support. And we can do it at postvention when people are out of this situation. How do we know that they are keeping up with healthy practice and healthy behavior? Like Ambassador Kenneth said earlier, he said it's been 20 years. That's a testament to a life that has consistently been able to change behavior and remain in that behavior. And that's our prayer, that's our wish, that when we do this good work that is being done, people don't relapse, right? So those are the kinds of things that research will help us know when we design the appropriate material. So how do you learn? There are a lot of instruments that we can use to learn. Needs assessment. Before you go into a community as a program specialist, please don't assume that you know what people need. Don't assume that you know the best way to reach out to them. And how can you know what exactly they need? So you can look at the community and say, there is addiction in this community, and then the addiction is because of X, Y, and Z. No, you don't know. Research will help you know that maybe the basis of this issue is because maybe there's this place is a sham, is a shanty that has water that is not flowing, and then somehow this water impacts sleep condition, and because of this sleep condition it makes people tired. I don't know. So you can't go into a community and just say you understand what it is that they need. We do needs assessment, and some of the instruments that we use is interviews. You talk to key stakeholders in that community. So when you are a program specialist and you want to support youth, or you want to support teenagers in a school, don't just go to a school and say, I've been doing this for the last 10 years, I know what I'm doing. Ask them to know what the root cause of the situation is. What you will find out will and should inform the way you would go about your intervention as a program specialist. These are other technical terms that I know that some of us are familiar with. And if it's conversation you ever want to be able to have with me, I'm always available. And when we start also doing intervention, it's important that we know how many people are participating. That child that has been coming to club, all of a sudden stopped coming. If you're not doing research, you would not know. If you're not keeping track of how they're participating, you will not know that, oh, this child has stopped coming. Why did they stop coming? Did they have new responsibilities at home? Did they get withdrawn from school? What exactly is happening? And when you are done, you want to get feedback from the people that you're training. You want to know that, have I done a good job? What could I have done better? Could I have been more engaging? Could I have used more real life examples? I hope I'm not just reading to them and talking to them. I hope I've been able to help them get the skills and the knowledge that they need. Also, we do outcome evaluation, we do surveys, we do focus group. There's something called cost benefit analysis. So when you are saying it costs you 20,000 naira, 20,000 naira to train a student to be more informed about mental health, what behavioral change would you see that would justify that money that is being spent, especially when you're talking to funders, which is going to be the next thing I'll talk about. No, it's not the next thing, it's second to the next thing. So how can you leverage AI to support yourself? I think I'm going to stop here. I think I've been doing a lot of talking. How many of us as program specialists have been in spaces where we have had to leverage research for any reason whatsoever in the work that we do? And then I'll talk about AI and how we can use that real quickly. Have you ever had to leverage AI research for the work that you do as a program specialist? Research. Have you ever had to leverage research for anything at all? And if you have ever had to, what have you used research for? How has research helped you? Somebody said, as teachers, something I'm not uncomfortable with is awkward silence. I could sit here all day. Okay, I won't make us do that. As anyone, a program specialist particularly, I know we have two audience and I'm trying to make sure that the content of this caters to both audience, program specialists and non-program specialists. So as a program specialist, have you ever had to leverage research for any reason? If you have, what? If you have not, also say no. No is a fine, is a full sentence. It's an appropriate answer. Go for it. Bail us out.
Yes, I've definitely research. We need to do more of it, and get more, but we definitely use research. We have a mental health club. We try to do research to help with that. Scholastica is raising her hand.
Please, if you can unmute her, it would be great.
Please, ma, you can speak.
Okay, yes, thank you so much. Good afternoon. Yes, I've been involved in research work when I did my PhD. Yes, and I worked on two strategies in helping children in knowing or rather understanding reading habits. So I am in basic schools. So I went to schools, I did my research, I wrote my proposal, I did my background, and then research objectives and research questions, hypotheses, and all whatnot. Let me not start naming them.
I love it. We can geek out on research right now. I love it. Thank you so much. So research is applicable in different fields, like she said, in the field of education where she did her research, also in the space of mental health. When you do research as a program specialist, you don't get burnt out and wondering, why am I doing the same thing over and over and over and I'm not seeing a change? Like Edie also said, research will help you see, okay, maybe my approach to teaching is not, or to training is not doing the work that I want it to do. Maybe there's something else that I can do better, right? Or how do I improve the content of my material? How do I improve my programming? So that's essentially what research will help you get to. I'm going to talk a little quickly about how do we then leverage all these tools that we are seeing that are springing up everywhere, apart from, you know, traditional research. How do I know? I'm not a trained researcher like you, Fola. How do I leverage tools? One of the things you can do is use prompts. I don't know if any one of us is familiar with prompt. Prompt is simply question. How do you ask a tool like ChatGPT questions and it's able to support you? We still have some time. I hope we're able to do some lab work. So you can use ChatGPT to ask, if you're going for outreach and it's taking you time, how do I put together my material? You can use ChatGPT to find outreach content that will be rich, that will be very, very useful, So maybe you want to come up with a model for how to relieve your stress, how young people can relieve their stress, for instance. Okay, I have the idea, but GPT, if you prompt it well, I am looking to do this. I'm looking to train students ages 12 to 17 about how to cope with stress. How do I outline this? What materials can I put together that will be age accessible, that will be useful for their reading level, and all of that. So you can prompt, but the way you prompt, the GPT is garbage in, garbage out. If you prompt anyhow, you will receive any response. So you have to be able to prompt well. I hope we still have time. I'll show us some example. If you say, okay, I'm not a researcher, but I think I do need research, you can ask GPT and say, I'm going for a 3 days training. I'll be teaching these models. Can you design a survey for me? It will design a good survey for you. Maybe not perfect, but it will design something and it's somewhere to start with. When you have data, you can also analyze your data using GPT, but it's not responsible nor ethical to share personally identifiable information of your participants. What do I mean by personally identifiable information? Don't go and share the names of your participants on GPT. That's not fair. Don't go and share their age, their school, and other information that are personal to them. But you can share, frequency data, and I'll show you what I mean by frequency data. There's also creating chatbots. You can have frequently asked questions about your program or about mental health. You can use it to generate search and make it available to the population, to the student that you're serving or to the youth that you're serving. And just make sure that you're not sharing data or information that is proprietary data. And what do I mean by that? Data that is an intellectual property of your organization. Don't share with GPT. GPT is open access. A lot of these AI tools are open access, which means anybody can use your information, which also means that this tool, this AI, they're using your information to retrain that machine. And then it means that your data or your personal data for your organization is already in the cloud. You can also use it for plain language. So if you design a content outreach material and it's looking like, this language is too hard for these children, you can say, please, can you make this content a grade 8 or a basic 5 or a basic 10 or a GSS 1 or GSS 2 reading level, and it will do that for you. It will make that language accessible. Let me bust your bubble. You can tell ChatGPT, translate this to Yoruba for me, and it will write Yoruba. How many of us know that that's possible? It can also generate reports and chat using ChatGPT. So there's so much you can do with the use of AI. Because of our time, I'm going to help us go quickly to lab. How many of us can still see my screen? Can we still see my screen?
Yes.
So I'm going to do a quick, not too intense data analysis for us. So I have this data set. It has students and it has frequency. This data set is the data for the student that attended my workshop, my training, right? So I have Awa, I have Bimpe James, Gigi, Ayo, all of them. I had 15 sessions in total. Awa I have attended 10 times. This is their participation log. I want to analyze this. I don't know how to analyze this. I can simply take this data as it is, copy it, and take it to GPT. So I paste it. Remember that I said something. What kind of data is Awa? What kind of data is being paid? The kinds of, when I put their names on ChatGPT, am I supposed to put their names on ChatGPT? They are personally identifiable information. I can't put it on ChatGPT, so I can go ahead and change the names.
Mm-hmm.
Were you responding? Was someone saying something?
Yeah, Barrister Paul was agreeing with you about changing their names.
Yes. So I will go there and say, I do not want to put Awa because Awa is somebody's personally identifiable information, and that could be age, that could be school, that could be date of birth. So I can change Awa to students 1, Bimpe to students 2, James to student 3, Ladi student 4. Thank you. Gigi student 5 and Ayo student 6. If I give this data to GPT, it says it looks like you just provided a list of students, blah, 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 blah. And it gives me the frequency of the data. And it says, oh, this data is missing. Okay, then I'm like, oh, student 6 is 8. And student 7 is 10. Can you see what's able to do for me? It populates back my frequency. And it says, what would you like me to calculate? Do you understand? It says, what do I like? I said, well, I want to know if I have 7 students on an average, how many times did all of these students come for club or did they come for my function? So I say that, okay, maybe I don't even know the meaning of mean. What does mean mean? It's a mean is a type of average. It tells you this, that. I can even say, explain mean to a 6 or let's say 7-year-old. And it breaks it down. It breaks it down. It uses candies. I said, oh, okay. So calculate the mean of the data set I provided. So it says to me that, oh, the mean is 9.86. So I can see on an average of the 7 students that came for my club meeting on mental health literacy, I had 15 meetings. They came at least 9.8 times. So I can go back and tell my funder and say, on an average, my students will come 10 out of 15 times. So it is worth doing this thing, right? It is worth doing this club meeting. So as a program specialist, as little as knowing little tiny details, to be fair, there is more to this, but these are the kind of things that even GPT, Claude AI, co-pilots can help us find about, information about the population that we're serving. I know we're almost out of time. I will say the things that we should be mindful of, whether you're a program specialist or you are just an individual looking to learn more about mental health. You need to be mindful of certain things. Be careful when you are using information online. Be careful because some platforms, some authors cannot be trusted. There was a time there was an epidemic of misinformation on mental health on TikTok. I don't know if you all can see this, my screenshots. More than half of top mental health TikToks contain misinformation. Most of this content, some content creator, not all of them, they're just doing what it is that they can to be able to make money. So we have to make sure that we are careful of the kinds of information that we expose ourselves to as individuals looking for mental health information online, and also as program specialist, you need to do your due diligence. So when you use ChatGPT to generate outreach content, take it with, scrutinize it and make sure that you have the right information. You are spotting biases in it. You are questioning AI generated content. Don't just take it as, oh yes, AI is perfect. AI is not perfect. AI has hallucinations. It hallucinates. Hallucination means it gets confused. Remember that the data on AI is a accumulation of all information that are available online. So AI is pulling from this misinformation of TikTok. So if misinformation is on TikTok and AI is also pulling from every information, it means that AI could also contain misinformation. So when you use this tool, be very, very careful. Look over your content. Like I said earlier, don't share personally identifiable information of your population with AI. And also when you are looking to use AI to search for information, especially as users of mental health information, cross-check with specialists. You can't diagnose yourself of any health condition, mental health condition through the internet. It takes a specialist to diagnose. It takes a specialist to give recommendations of how to cope. You can learn 1 or 2 things, but it takes a specialist. And there are some websites that are certified. There's a website we call Psychology Today. They get double checked. You will see You will see 2 clinicians authenticate the content. So those are the kinds of sites you should look at getting your information from. If you are in the States, CDC's websites, those kinds of sites that are institutional sites. I know we have equivalent of this also in Nigeria and in most countries of the world. So you can look at official websites of the government and also website that you will see names and credentials of clinical experts appending their information on. Also, if you ever want to use TikTok or all of those other platforms for your information, look for platforms where the content creator is saying, I am a clinical psychologist, I'm a licensed therapist, I'm a licensed counselor. Those kinds of information, they can still to a great extent be trusted, not just average information. So whether you are a non-program specialist or you're a program specialist, it's important that we learn tools and we use these tools ethically and appropriately to be able to get mental health information and also to be able to get information to serve the population that we work with and serve them effectively. The reason why this is important is funders need this information. If you need to go for more funding, they need to know the work that you have done. How much intervention have you done and how much behavior, how much knowledge, how much skills have your population gained. Also for yourself, when there's result, you're happy, you don't feel burn out. So
it's not, there's no distance.
Okay, and I think that's going to mark the end of my presentation. If we do have questions, I'm happy to take them now.
Yay. Okay, we have some reactions. Thank you so much, Dr. Fala.
Thank you
we
so
have
much.
some questions here. Okay. The first one here by an anonymous attendee. How accurate or reliable are AI tools when it comes to diagnosing or flagging mental health symptoms? Or can it be used to make diagnosis at all?
I will let the clinical specialist present answer. No, you can. You can learn coping skills as far as I know, but diagnosis is going to be done by a specialist. That's why people go to schools for several years to be able to learn this thing, right? So I don't know if any of the clinical specialists present has anything to say. ED or any other person who is a trained mental health specialist has something to say to that. But my position is that you don't receive the same way you would not receive I don't know. I don't want to call out any ailments. The same way anyone will not get a cancer diagnosis from social media, from AI, from Google. You need a specialist as a doctor, an oncologist in this case, to be able to make such diagnosis. It's the same way you shouldn't get diagnosed of mental health condition from any online platform. It takes a specialist to declare a diagnosis.
All right. Thank you so much. Would you like to add anything to that? Okay, let me just move on to the next one. Can you share a recent, this is from IFAM, can you share a recent or ongoing project where AI is being used to improve mental health outcomes?
Oh, several interventions. There is no part of my life that AI is not permeating right now. More and more tools are being used. Even when you go on, even just ChatGPT, there are AI mental health literacy bots that people are creating, and there are also specific tools. I don't want to encroach into the part where clinical specialists will talk about, but the original Bible for diagnosing mental health is the DSM-5. A lot of the information they are constantly being used to train AI tools and so that they can improve. But I still strongly believe at this point where we are at in terms of advancement of technology, we still rely on the expertise of trained humans to be able to make informed decision on diagnosis. But yes, there are a lot of advances that's been done in the digital health space every single day. there are tools that you can use to monitor your moods, to see how your moods are improving, and a lot of other things. I mean, therapy is being done online. Some of us are familiar with BetterHelp. What's the name of this? Talkspace, I think that's what's called. There are a lot of things that, whether it's software as a solution or AI is permeating even in this time.
All right, thank you, Dr. Fola. Hi, Mommy. I hope I believe this answers your question, but if you have like a follow-up, you can feel free to share. Okay, moving on to the next one. Sorry. Okay, you mentioned using AI in program evaluation. How reliable is it measuring impact when so many mental health outcomes are qualitative or personal?
Can you say that again? I think that your screen got frozen a bit.
Oh, sorry about that. I'm guessing it's better now. So you mentioned using AI in program evaluation. How reliable is it in measuring impact when so many mental health outcomes are qualitative or personal?
So when you're doing programs, you can have quantitative and qualitative measures. I agree with you when you say most of the outcomes are qualitative. But even as simple as the small lab work I did earlier, just measuring whether attendance log or participation log, that's a quantitative, is a descriptive start work. So I have 10 children in my club, in my mental health literacy club. Out of this 10, I know from research that you need to be exposed to at least 70% of my training for you to be able to gain knowledge and skills. Those are still quantitative measures, right? So how many of these 10 students are returning for at least 70% of the time? AI can help you do that. You can simply ask, this is my situation. What tool do I need? How do I make sure? So there are different outcomes you're measuring. So just on the quantitative checklist scale, you can do that. And when you even have qualitative outcomes to data, AI can help you synthesize it. Just make sure you take out personally identifiable information. Like can trace back to your population, take out the name of the program, take out their names, take out their age, and all of those things. Don't include those. So it can help you with qualitative data analysis as well. So yes, I agree that most of the outcomes we measure are qualitative. Their behavior change, their skills gained, but there are also quantitative measures that we can get. And when we do focus group, when we use qualitative methods to collect data, we can also analyze those using AI tools.
Okay. All right. Thank you so much. So what kind of data? Oh, sorry, questions are increasing, so I'll just run through them. Okay. What kinds of data are most useful for AI to work with in mental health research? Is it text, speech, behavior tracking, and how do we collect that safely? And then another question here is what inspired you to start exploring the artificial intelligence and mental health in your research?
What kind of data can we use? We can use any data, but again, let's be careful. When you the most accessible tool to us right now would lend itself to more textual data than speech. The free version of GPT, you can't analyze speech from it. So if you have an organization that has a large enterprise that has the money to design their own AI tool, organizations are designing their AI tools every day. It's possible to be able to use any form of data. But when you are relying on open source, I would say be careful of uploading speech, uploading things that are, could be a bit more, ethically unsafe on those platforms. But if you have an organization that is willing and has the ability to pay for more advanced tool or even design their own AI tool, it's possible to analyze any kind of tool. Then the other question, I hope I answered that question.
Yeah.
The other question is on what inspired me.
Yeah. Yes.
I'm catching up with the times. I don't want FOMO. I don't want to miss out. AI is permeating every part of our world, and as a researcher, I am convinced that it's not here to take away my job. It's here for me to leverage as a tool to be able to be more productive and efficient. So it's important that I leverage it. I use it as a tool that it is, just the way a calculator came in and we no longer, and the computers came in and we, it changed from, we no longer needed human computers like they used to be called. We then needed data scientists, data analysts. So I'm changing with the times. I'm using AI as a tool. I'm not missing out. I'm learning, I'm growing, I'm evolving. So you all should consider using AI as a tool for your work.
Yes. Thank you, Dr. Fola. Okay, this is another person. In your year of research, has there been a significant number of people that has overcome addiction or trauma? I think this is like a context. I had a professor once that is of the school of thought that mental illness cannot be cured, only managed.
Again, I always like to stay clear of clinical questions. I am not a mental health clinical specialist, but I have done some reading, and I know that there are different etiology of mental health. There are different perspectives to mental health, and I don't want us to bore us with the philosophical perspective of mental health. Some people believe in a lot of ways that societal, systemic issues are the precursors to mental illness. Some people believe it's chemical reactions in the brain. So whichever school of thought you belong to would influence your perspective towards healing. And there's also the faith belief. Those of us on this group have talked a lot about people being delivered, people being set free. So I don't want to go too philosophical. I'll leave it to the clinical experts to answer that. Yeah, but as a researcher, I sit comfortably in understanding every single etiology of mental illness.
Thank you. And then the last one, I'm not so tech savvy. Could you please, hey, another question has come in, so I'll just take both of them at the same time. I'm not so tech savvy. Could you please break it down? What exactly it means to leverage AI in mental health care? And then the last one, what role do you think AI will play in the future of therapy or counseling? Will it replace human therapists or support them? Can you paint a picture?
I'll answer the first one. Leverage is it just means to use AI, leverage. The meaning of use is being able to use it as a tool. Yes, there's going to be need for some AI fluency, some AI literacy as we continue. So you don't have to be ultimately tech savvy, but if you're willing and ready to learn, there are a lot of avenues to be able to do that and see how this can help your work. What role will AI play in the future of therapy? AI is already playing and will play roles in helping practitioners, mental health practitioners in the house, hopefully can speak more to that, but it's already playing roles, whether it's in taking notes. I know therapists, counselors have to take a lot of notes, so maybe they can better listen while AI takes the note for them. And, AI can synthesize conversations and help them get to the diagnosis really quickly. Like I said, DSM-5 is being trained into AI, so it will just make them more efficient. People still crave connections with humans. I do not personally believe that AI is here to take away the work of therapists. People still crave connection with humans. At the end of the day, God created us for connection. We're made to connect. So I don't see it. Some school of thought will tell you, oh, for some reason, some people like to talk to, there are a lot of thought, but personally, that's my opinion. I want to do one last thing before I leave. As a true researcher, I would like some feedback. So the presentation today. So if you have your phones, if you're not using your phones, I have a quick survey here. So please just scan this. Can you see my screen? I believe you should be able to. If you can scan this and answer the questions I have real quickly. It's just 3 short questions. I would appreciate your help in doing that. I'll leave this on for the next 5 seconds.
And Dr.
Olatunde, I think you do as great a job as anybody at sharing complex information in a clear manner. Thank you so much for your presentation.
I appreciate that. Thank you so very much. Thank you. Okay, that's it for me.
All right. Thank you so much, Dr. Kola. I have scanned the code and I'll share the link with everyone in a
Thank you.
bit. Just some persons were unable to scan the code. Yeah, thank you very much. We're so grateful that you joined us today, and we look forward to having you another time. Yeah. Okay, so we'll be going on a break now. Our next speaker is here. Hello, Kelly. It's so good to have you here. I will be going on a 15-minute break and then we'll come back. Yeah. So get up, take a walk, stretch if you need to, take some water, grab a snack, whatever it is, really. And then please be back here in 15 minutes. I'll put up a timer now. Thank you very much. Okay, welcome back, everyone. Welcome back from the short break. Guessing we're all pumped afresh and ready to learn. Welcome, welcome. Please send a message to those that are not here yet. Tell them we are back. Our break is over and our speaker is ready for us. So I'll just wait for about a minute just so some more persons join before I introduce our speaker.
Thank you. I'm trying to unmute or undo my video. Let's see what's going on here. Start my video. Okay. Oh, that's weird. I do Zoom all the time. Hey, Mark.
How are you?
Good. How are you?
Wonderful. Thank you so much.
Good. Thank you again for the invite and speaking my name. Hello, Sophie.
Hi, Harry. It's so good to see you finally.
I've sent you a million emails.
Hey, welcome back. Okay. So I would our number has increased a bit, but we can do better. So please tell your friends that might have left because of the break. I mean, we're back, we're live. And yeah, okay. So I'll just introduce our speaker. So we've been having some technical issues with the introduction videos that were created for our speakers. For some reasons, the audios do not play. Right, I have tried to troubleshoot and it's not just working. And I really, really apologize. Would have loved for you to, see what we did, but it's fine. So I'm just going to read through your bio and then you jump right into it. So sorry, let me share that. Okay. All right, so Kelly is an ordained minister at Apostolic Faith Church, AFC in Chicago, serving under Bishop Horace Smith since 1990. She has contributed to several ministries, including Liturgical Dance, Ministerial Alliance, Armor Bearers, and currently leads the AFC Prayer Line. Kelly has over 34 years of experience in behavioral health, specializing in addictions and mental health. She's the program manager for gambling disorder services at the Illinois Department of Human Services. A Chicago native, she holds a BA in psychology and an MS in educational psychology from Eastern Illinois University. She's pursuing a PhD in counseling and psychological studies at Regent University. So please let's welcome Kelly as she takes the stage. So yeah, you have the floor. Thank you.
Thank you so much. Can you hear me okay? Okay, excellent.
Yes.
Thank you. So I'm going to share my slides momentarily here, but I just want to say thank you. I've been on all morning. I was on all day yesterday, and I have thoroughly enjoyed the conference. And right now, someone is mowing the grass right outside my window. They haven't been doing this all day, so they're there now. So I hope you can't hear it. But I'm just grateful to be here. I'm grateful for the opportunity to share the knowledge that God has blessed me with. I'm grateful to so many on this call, and I'll mention that more as I go forward. So let me actually share my slides with you all, and I'll go to my PowerPoint. All righty. Are you able to see my PowerPoint? You can? Okay. Okay, excellent. All right, so our topic today is actually going to be about trauma, addiction, and grace. It's been the theme of the last couple of days, so I want to make sure that I don't repeat everything that I heard because there was a lot of information that was shared, great information that was shared. And so I really, as I go into my conversation here this afternoon, I'm going to really focus in on grace. So just to give a couple disclaimers before I actually get into the slide presentation, of course, the topic, trauma, addiction, and grace, is a topic that could be a week-long topic for every single one of those topics, or trauma, addiction, and grace. They could be a day-long conference, a week-long conference in and of itself. So this is really just a bird's eye view as we go through the presentation. Also, I know this is a faith-based training that we're doing, and I will actually be coming from a Christian context. So I'll be referring to biblical scripture from the Christian Bible as we go forward. So before we get into our slides, I told myself I did not want to do the switching slide thing because it gets lost and sometimes, but I do want to play a song really quickly for 2 seconds. And I think, not 2 seconds, I'm sorry, 2 minutes. I think what I need to do is probably stop sharing so that I can share my sound. Give me 1 second. And I will come right back up to share that. I want to make sure I do this properly. But I want to be sure that you can actually hear this particular song on grace. And I'll have a question for you momentarily here. Let's see. Share my sound. Okay, and hopefully you can see it too. All right, so. Oops, it's not enabled, so I don't think I'll be able to share my sound. Give me 1 second. Audio. Okay, I'm going to try to share it here. It's not going to let me it's not going to let me be great today. All right. I think I'm going to have to bypass that. So I will drop the link in the chat for you all when I do have an opportunity to. Now it doesn't want to share. I am so sorry. Give me 1 second. See, this is the whole thing that happens when you try to switch off and be great. Let me find my slides again. It's flipping back on me. Here we go. All right. I'm not switching again. All right, so this song, I'll put the link in the chat for you, but it really just talks about when grace finds you. And I don't know how many of you have had the experience of trauma, mental health, or even substance use. This workshop, really, we've had a lot of information given to us as therapists, as teachers, as other professionals in the field. I really want to focus on us in this particular workshop. And what I mean by that is the word grace. It really, when you ask someone about the definition of grace, you hear it is unmerited favor from God. And so God has extended us grace, of course, through the death of his son who died for our salvation. So he's extended the gift of grace to us. So as we go through the slides, I want to really emphasize on the importance of us now being able to extend grace to those who come through our treatment agencies, our houses of worship. We encounter them on the streets. This is the grace that God has given to us that we should also give. So the song that I wanted to play was talking about when grace found me. So grace is actually not the absence of accountability. We're going to talk about that. It is the foundation of healing. So I want to also just talk about the thread of grace as it touches substance use, trauma, mental health. And I'm also going to talk about gambling disorder. When I did my little teaser, I shared a little bit about gambling. And so I want to emphasize a little bit more on that because I didn't introduce myself to say that that's what I do with the state of Illinois. I've been with the state of Illinois for 24 years this month in the field of substance use and mental health for 34 years. And I've known Mark since I've been in the field. So it's been just a pleasure to watch him and to grow under him with the work that I'm doing. But in the field of gambling disorder services, I work for the state of Illinois and I oversee gambling treatment services for individuals who are impacted by substance use, mental health, and gambling. And we you'll see more as I go further, because I did make sure to include some slides there about that. So just to kind of get back to the conversation related to the thread of grace through all of these particular areas. In Ephesians 2:8-9, God reminds us, or Paul reminds us, that for it is by grace that we ourselves have been saved. And I kind of said this early on a moment ago. It is through faith that, and this is not from ourselves. We didn't give ourselves grace. Grace is the gift of God. And it's not by works that we are granted grace. It is a gift, and we cannot boast about the grace that we have been given. God has given it to us for grace. So our goal is to establish the opportunity for grace to be given to others. Grace is the foundation of healing, is the foundation of recovery when we are interacting with individuals that come into our sphere of influence. Mental health, just to go around the sphere here, with mental health and grace, mental health is actually it's unprocessed trauma, which creates lasting impact on emotional regulation, relationships, and worldview. Trauma and addiction, or it could be addiction to substance use, it could be addiction to gambling. Substances and behaviors often serve as coping mechanisms for individuals who have been impacted by pain and trauma. Mental health and addiction cross paths. All of these cross paths, substance use, mental health, trauma, can impact one person. But trauma or mental health and addiction are co-occurring disorders that feed into each other's in a cycle. But with grace, grace threads through it all, as I indicated, and it provides hope, reduces shame, and creates a safe space for healing. So just to understand what I mean by that, and understanding trauma through a grace lens, we're going to break it out. We're going to talk about trauma, then we're going to talk about addictions and so forth. So with trauma, Psalm 34:18 reminds us that the Lord is close to the brokenhearted, and he saves those who are crushed in spirit. I don't know about you, but I've been crushed in spirit in my years of life. And it was by grace that that trauma and that impact of being crushed dissipated. And so the Lord desires for us to be able to be healed. And so through the emphasis of what God drawing us near to trauma, to those that are impacted by trauma, he draws us near. And so with that, again, as I stated earlier on, it is our responsibilities now that we're healed to be able to extend that same grace. So I want to talk a little bit about the definition of trauma, which has been defined already in several different settings already yesterday and today, but I'll just real quickly repeat it for maybe those who weren't here yesterday. So according to the American Psychological Association, or the APA, the DSM-5, I'm going to quote the definition from the Text Revised. It indicates that trauma is commonly defined as an emotional response to a terrible event, such as an accident, natural disaster, crime, abuse, both physical and emotional, witnessing violence, the death of a loved one, and experiences of war. There are other things that may also impact an individual. That's a type of, that can impact them with trauma, I should say. There are different types of trauma, and I'll just name a number of them. Complex trauma, which we heard Mark speak about yesterday, the compounding trauma that continues to happen to an individual. Community trauma. I grew up in the city of Chicago, west side of Chicago, and there were things that happened in our community that impacted us. And it wasn't just my family, it impacted our community, things that may have happened. Generational trauma, Mark did mention that yesterday, how it can be passed down from one individual of a generation to the next. Also, trauma in the church occurs. Yep. Trauma in the church can occur as well. And there is abuse that happens in the church, and individuals can be impacted right within their church settings. recognizing also that trauma there's PTSD, and Mark went into great detail yesterday talking about PTSD and the impact of trauma on PTSD. And I think what we are used to hearing is PTSD that impacts soldiers that return from war. But I had a client who indicated that she was diagnosed with PTSD at the very age of 5. She was in a situation where she was in a custody battle, and she was being abused. And she still, to this day, at the age of 35, is still impacted by much of what happened to her at the age of 5. So just in explaining the different types of trauma, I want to talk a little bit about faith-based understanding as it relates to trauma. There's a theological framework that states that trauma is part of the fallen world. Our world is impacted by trauma because of sin that entered the world. And it's not God's punishment, it's sin. It happened and the world has been impacted by that. A biblical example of trauma also is David's Psalms of lament and him crying out and the things that he experienced as one who had a heart for the Lord. He was still impacted by sin of the world, the sin of the world. Jesus's compassion for the hurting is also part of the faith-based understanding as it relates to trauma. The grace response to trauma, when we talk about the faith-based understanding, you're not broken, you are wounded and worthy of healing. You are not broken. That's what grace says to one who enters in with trauma that is impacted by trauma. A takeaway on faith-based understanding is that the church must be trauma-informed and grace-driven, not minimizing pain or spiritualizing suffering, but meeting people where they are. And again, that goes back to what I mentioned about being able to extend grace because grace has been extended to us. Community, we are a community of healing. We're a healing agent. The body of Christ has been placed as a safety and restoration. I heard someone say yesterday, and we often hear that the church is the hospital. But also in our communities should be safe havens. When I go back to my home where my parents are, I feel very safe there because it's a safe environment. There are some evidence-based trauma approaches that were mentioned already, and I'm going to actually just restate some of those. I won't go into detail on all of them, but trauma-informed care principles. When we talk about trauma-informed care principles, that means making someone feel safe, just like I mentioned a moment ago, going back into the community, going back into my family's home. Trustworthiness, that I can tell you something and you won't go and spread it across the community or spread it throughout the church, spread it throughout the school or community setting that I might be in. Collaboration, being able to collaborate with others, and then also having a choice. Trauma-informed language is knowing not to say what's wrong with you, except instead of saying what's wrong with you, we ask what happened to you. It's more inviting when you ask a person what happened to you as opposed to what's wrong with you. So these are just simple things that we can do within our church environment, our community environment, our homes, our schools. I mentioned PTSD already, being post-traumatic stress disorder, and there are different treatments that can be applied to individuals impacted by PTSD, one being cognitive processing therapy, pretty similar to cognitive behavioral therapy, helping the individual process their thoughts to help them change the way they think. And then there are some somatic approaches as well. We've heard individuals talk about doing mindfulness, breath work, breathing exercises. Some people are now getting into Christian yoga as well. So these are just some of the treatments that individuals can use as a evidence-based as well as a faith-based understanding. I'm going to have several books listed in my slides here. This is one of my favorite books that talks about mental illness and grace, and it is actually talks about severe mental illness and what churches can actually do. One of the things when I was writing my dissertation, a professor said to me, you know, she was a pastor herself, and she indicated, we want to be careful not to say to the church, you need to do mental health services, you need to do counseling, because especially for the pastors, they're pastoring, many of them do pastoral counseling, many of them don't have the clinical skills for the counseling work that a professional clinician can do. So we have to be careful, but awareness is for everyone. So this particular book speaks to that. And this research tells us that when most people suffer from mental illness, from many things, the first person they usually turn to or first place is usually not the physician or a psychiatrist, especially in my community, in America, in the Black community. They go to the church, they go to a pastor. Is that the same for you? Is that the same in your community as well? We, for centuries, African Americans, and I can only speak to African Americans because I'm not in Nigeria, but I would love to be, but we have gone to the church for our help. So this particular book, when we talk about deconstructing mental health, we want to talk about a grace framework. Mental health struggles are not a sign of weak faith. Grace says there is no shame in seeking help. I've often heard people say if they were stronger in their faith, they wouldn't be dealing with these issues. That is not the case. Faith practices, as it comes to mental health, say to us to embrace spiritual disciplines such as prayer, silence, worship. And these are legitimate ways that individuals impacted by mental health can use spiritual tools or faith-based tools. I've already mentioned some of the evidence-based integrations that an individual impacted by trauma as well as mental health could use, and that would be like cognitive behavioral therapy, holistic treatments, anything that is outside of the church that a clinician may impact or be helpful for is what would fall under evidence-based integrations. A takeaway for the mental health piece here is a flourishing life includes mental wellness. Let grace inform how we support others' journeys. I'm going to keep saying that. Let grace help us support others in their journeys. The next thing I want to mention is addiction as a disease, choice, and grace. So when we talk about addiction, we are talking about substance use. We are talking about gambling. Like I said, I'll get into that in a moment here. We're talking about food addiction, sex addiction, shopping addiction. Anyone can be impacted by addiction. Addiction is not just substance use. So when we talk here, though, I'm specifically speaking about addiction, the addiction of substance use. But the addiction of substance use is a disease, and it is a chronic relapsing brain disease that often affects how the brain processes rewards, stress, and decision-making. It changes brain chemistry and structure, and is recognized medically by what we know as the American Society of Addiction Medicine. It also can impact, it's not about willpower. Sometimes we may hear individuals, if you were strong enough, you just get off of those drugs. And a person impacted by addiction or has an addictive behavior, it's not just about willpower for them. They've tried and often tried, and we've heard the personal stories of many of our presenters here today that talked about the number of times they've attempted to get off of whatever substance it may be. What about chocolate cake? What about whatever it may be, that addiction? Substitute that for the substance use and think about our own journey. So this is where, again, we're extending the grace to those that are coming to us, and we're not necessarily saying you should just, have stronger willpower or have more faith. And then addiction involves choice also. And I want to be careful when I say that, because there are times that individuals have been impacted and drugs have been forced on them. I had a friend whose siblings impacted her at the age of 13 with drugs, and she used drugs for a number of years into her adult years. she didn't choose to go and use that drug. It was given to her by her elder siblings. And I'll share personally, when I was 17, I was working in a drugstore in my neighborhood, and I was probably the youngest one working in my neighborhood, working in my employer's place of employment. And I remember I was getting ready to leave for college, and the director of the program the department that I was working in, she wanted to give me a going away party for school. She's grown, I'm 17, and I will never forget her saying to me, when you come over, we're going to teach you how to use cocaine. And I'm like, what? What does that mean? I could have, if I had not had parents who taught me this is not what we do, or even my spiritual foundation, I could have easily been in that place as my friend. There's a saying that we often say, but for the grace of God, there go I. It could have been me. It could have been me, but God saw fit that I not go to that party that they were having. So I just wanted to share that some people don't have a choice, but many of us do. So with the choices, while addiction is a disease, it begins with choices for most people, like I indicated. And recovery also involves a series of new empowered choices. So we have choices. The initial use of a substance or behavior is usually just a choice to smoke a cigarette, or, hey, I'm going to try this marijuana, whatever it may be. But then there are individuals who may come from families that have an addictive gene where they will get involved in a substance and they continue on using that substance. Recovery involves daily decisions, seeking help, attending support groups. These are choices. And also avoiding triggers like we heard earlier, avoiding people, places, and things. We also want to be reminded that control can become impaired. Some people talk about you just need to control the gambling, you just need to control the substance use, but over time, control becomes impaired for that individual that is impacted by addiction. So it's neither here or there. It could be both as it relates to disease or choice. And then we'll talk about addiction as it relates to grace. Grace, again, is essential in how we view and respond to addiction in ourselves, our loved ones, and our community. Grace does not excuse harmful behavior, but it creates space for healing without shame. Grace also, God has said, you are not your addiction. We should say that to individuals. You are not your addiction. You are loved, capable, and worthy of recovery. Grace-centered support offers compassion and accountability and hope. So in summary, just to wrap up this last slide on addiction, addiction is a disease that affects the brain and body. It involves personal choices, and grace is the thread that allows us to love without enabling and to support without judging, to believe that no one is beyond redemption. So I realized I put another slide in here that has sound in it, and I'm not going to be able to share it, but I want to now kind of tilt a little bit to a different addiction, which is gambling. Gambling is known as the silent addiction, and I'll tell you why momentarily. I mentioned my work with the state of Illinois. I started 24 years ago this month, and we were just getting started in substance or gambling services for those impacted by gambling. Since that time, our program has grown immensely in terms of funding, in terms of reaching individuals. But what has not changed is the hidden disease of gambling. Individuals can be impacted by gambling, and their family members may never know that they are actually battling gambling addiction until it's too late. If I were to define gambling with the DSM-5 TR, that is the Diagnostic and Statistical Manual of Mental Health Disorders. And what it tells us is that gambling includes It's been included, I should say, in a chapter on substance-related and addictive disorders, reflecting its classification as a behavioral addiction. In the old DSM-5, which is like, or DSM statistical manual, it was classified as a compulsive disorder. But since this DSM-5 has been placed under this new description. But the definition of it for diagnosing gambling is an individual must exhibit a persistent and recurrent problematic gambling behavior, which leads to clinical significant impairment or distress, as indicated by 4 out of 9 different criteria. I'm not going to read all 9 of them because I'll just read a couple of them or a few of them. One would be need to gamble with increasing amounts of money to achieve a desired excitement. Another would be making attempted, repeated, unsuccessful efforts to control. I talked about control in the last slide, to cut back or to stop gambling. They're also preoccupied with gambling, reliving their past gambling. They may have had a big win and they just keep trying to get back to that big win, but it doesn't always happen like that. An individual that is impacted by gambling disorder would be mild, a 4 to 5. They would have to rate 4 of those 9 criteria that I mentioned. They would have a mild diagnosis. They would be looked at as having a mild case of gambling disorder. And then there's moderate, and then there's severe, where there's an individual who needs immediate treatment. Some may need just prevention or early intervention, I should say. There are co-occurring incidents that can happen, as I shared back earlier about how substance use, gambling can intermingle with mental health diagnoses as well. Many individuals that we see throughout the state may be impacted by mood disorders, anxiety, I mentioned substance use, as well as personality disorders. The different types of gambling that I looked up in Nigeria, as well as the ones that I know that exist in America, would be casino-based gambling, which are on land-based buildings. Another would be online casinos, which is happening quite frequently around the country in America. And I also saw that it happens in Nigeria. State and national lotteries. Now, national lotteries, we don't necessarily have. We do have some states that share lotteries. I did see national lotteries that were something in Nigeria, though. Video gaming terminals are big in Illinois. I live in Illinois. And just in our capital alone, when we first started tracking the gambling terminals, those are the little casino or slot machines that go in gas stations, restaurants, in so many different places. When we first started looking at how many VGTs is what we call them, there were about 12,000 in Springfield, Illinois, which is our capital. Today, and this was earlier this year when I tracked how many we had, there were 48,000 video gaming terminals listed in Springfield, our capital alone. There's also horse racing that still happens, cultural games such as Keno for our Asian population. Cockfights are primarily known in the Latino community. Sports gambling is big. I'm going to talk about that one in a moment. And then dog fights. And maybe I missed some. So if you know of some, I can't see the chat, but if you want to throw some in the chat that maybe I didn't mention, please feel free to. But these are just some of the many ways people can get involved in gambling. And then I also wanted to share that in America, based on the number of states that are currently impacted by gambling, there are only 2 states in the 40 out of the 48 states in the United States that do not allow gambling, and that would be Utah and Hawaii. But this is just a breakdown of how many casinos are in 35 states, or 35 states have casinos, I should say. Tribal casinos are those that are run on Indian reservations in the state of Illinois. And then there are state lotteries, the sports betting, which I mentioned, online casinos. There are 7 states that have online casinos. Illinois right now does not have iGaming. And then there's horse racing, and then also bingo and raffles. This is national numbers. This is not just Illinois. I wanted to share for the state, the division that I work in, back at the height of the pandemic, we were just getting started on our first prevalence study in the state of Illinois. That QR code will actually take you right to our website, and you can actually download the 200-page study that we have. We're actually preparing to do another one soon. But this one actually provided us some data that we have been using through trainings and are right now scrubbing the data to see what more we can get from that first study. It was a statewide study done, like I indicated, at the start of the pandemic, and it was released in June of 2022. Based on our screening or our assessment, we found that 9% of Illinoisans have or are at risk, and that was back in 21, or at risk of having a gambling problem. And the real number that made us alarmed, and we knew suicide is high among gamblers, but 30% of individuals that had responded to our study indicated that they had considered or attempted suicide due to their gambling. That was very scary for us. So immediately we began to, not that we weren't doing it, we have providers in our state who provide services to individuals impacted by gambling, and those individuals address issues such as the gambling itself, substance use, but also we screen for suicidal ideations when clients come into treatment. Some of the things that we also want to, just in terms of looking at sports betting, going back to that topic, sports betting started around the height of the pandemic, and for many, these are the states in red, are actually all the states that now have legalized sports betting. What we saw in the state of Illinois is an increase among young men, especially as it related to sports betting. When I looked at some research, and this was a video I was hoping to share from Nigeria, I'll drop it in the chat as well, but Nigeria is also having problems around sports betting around young individuals. But primarily what I saw from the video were young males. But in March of 2025, here in the States, we have a national screening or national awareness month called Problem Gambling Awareness Month, and that's every March. And it was purposely set for March over 20 years ago because in the States, we have what's known as March Madness. And that's when our college basketball teams come together to battle for who will win the championship. So during this past March 2025, it was estimated that there would be an expected expenditure of $3 billion in wagers in the states, the United States. The NCAA, which is the National College Association, Athletics Association, they are actually warning individuals, especially college basketball players, but people bet against them. Because sports betting is alive and legal, individuals are betting against our athletes, and there are some athletes who have gotten in trouble, not just in Illinois, but also on a professional level, because they've been involved in betting schemes. So, but for collegiates, there are safety guards that are going up to protect players from being harassed because someone lost money because they betted on them. So this is an impact not just in Illinois, not just in the United States, but it's been impacted around the world. And as I indicated, Nigeria also has been impacted. I wish I could share this video. I will put this link in the chat for us. I probably am running close to my time, so I don't want to take up too much time trying to explain what the video was about. I will share that with you all in the chat. But basically what the video, I'll give a few of the points that I was going to mention. Gambling in Nigeria, as I was reading about it, it said that gambling has always existed in Nigeria, but in the past it was more or less viewed as an antisocial activity, and it was discouraged by the church. And that's not any different from the United States as well. People were warned against the quest for quick wealth. And the most popular forms of gambling that I was able to read about, which again, very similar to the States, is online sports betting, football league promotions like I think it's called fantasy football, and then football pools that may go on as well as the lottery and slot machines. These are the common gambling games that have been noted in Nigeria. Maybe I'm missing some that you know of. I would love to see what the chat may say if you are adding those in there. But many Nigerians, it states in the report that I read, view gambling as a harmless leisure activity. And I would tell you, very similar to the state. And I want to say there are a number of people, there are more people who gamble recreationally than those who are actually impacted by gambling disorder. It's a personal choice, whether or not you choose to gamble or not. But that it is definitely seen as not so harmful by the majority of individuals. It has been, though, for us in the state of Illinois, we have attempted to make our state a gambling-informed state because of all the gambling opportunities that we're seeing throughout our state as it relates to casinos. When I first started, there were 9 casinos. Now we have 16 casinos. I mentioned Springfield, Illinois, which is our capital, where there are 48,000 early part of the year, 48,000 video gaming terminals alone. That's only in one part of the state. Throughout the state, there are others as well. It is definitely, as I come back to just talking about Nigeria, though, one of the things that I found also is that I couldn't find any treatment per se, and the research indicated that there weren't many treatment centers for pathological gambling in Nigeria. I do want to say for those clinicians and anyone that's on the call, the scan that I shared earlier from our study, and I'll go back and share that later before I jump off, it takes you to our website. We do free trainings online. You can be anywhere in the country, anywhere outside of the United States, and view that our trainings for free. So if you're ever interested in learning more about gambling, there's even a 30-hour training that you can take. It's not limited to a specific state, but you can take it for the knowledge base and be able to utilize the information if you're not already doing that with your family members, friends, whomever it may impact that you know. I wanted to kind of chat about just real quickly some of the differences, because people have asked me quite often, what's the difference between gaming? What's the difference between gambling? Gambling is, of course, the definition I introduced earlier is wagering something of value. Maybe I didn't say that. It's wagering something of value, usually money, on an event with uncertain outcomes. Gaming is, and I don't want to play it down like it's not a big thing, because I know a lot of individuals who are impacted by gaming as well, but it is usually starts out played for fun, for entertainment, often skill-based, without real-world financial stakes. Primary motivation for gambling, financial gain, thrill, or risk. Generally, for someone who's not impacted by gaming disorder, entertainment, social interaction, and skill building, as it mentioned for the definition. Elements of chance, high demands for gambling, largely on luck, slots, roulette. It varies for gaming. Some games are skill-based, others combine chance. Loot boxes, which kids get into, is a part of gaming as well. Monetary risk, always involving risking money or something of value. I remember doing a training in one of our correctional facilities here in Illinois, and I didn't train the actual individuals that were incarcerated, but I trained the staff, and they told me about the massive problems that they were having on their unit around gambling because they weren't gambling money. They were gambling things that they could buy from the, I think it's called the commissary. Like they could buy like goodies, food, things like that. And so there were fights breaking out on the units and they were wondering why. And it was all related to gambling. So it is not just money that people are wagering, it's other things as well. Just regulation in Illinois, it is heavily regulated. We got a lot of gambling opportunities, but it is heavily regulated. For gaming, it's less regulated, but I would say that we're probably moving in that direction as more things are happening. I know that there are some universities that have gaming centers in Illinois and maybe even around the country. And then outcome kind of speaks for itself as it relates to the financial gain or high demands, win or lose money for gaming, win, lose in games rewards, progress and achievements. I want to say that some of that is changing as it relates to gaming. In the state of Illinois, we primarily, I'll say this as a disclaimer, we primarily deal with the individuals who are impacted by gambling. Gaming is coming under our purview as we speak. And this next slide, really quickly, I'll go through this one, really speaks to the similarities that we see in the two between gambling, gambling and gaming. Reward systems are pretty much the same. Both use variable reinforcement, unpredictable rewards, addictive potential. Both can lead to compulsive behavior or addiction. Digital platforms, both are widely available online and on mobile apps. It is social interaction. There are individuals who go to casinos, as I indicated, and they gamble recreationally. Me, I want to walk away with something, so I will keep my money. Thank you. Give me a pair of shoes. I'm good with that. But for gambling, you are chancing losing your money. And there are individuals who pay big fees at the casinos or wherever it may be that they gamble. For even socially, they'll do it. And then psychological impact, I'll just jump there. Both can affect mood, cognition, and behavior in ways that mimic substance use patterns. When I train around gambling, I usually compare the two, substance use and gambling disorder as well. And there are lots of similarities, like with alcohol use, there can be a blackout when an individual blacks out because they've drank too much. And the same with gambling. For an individual impacted by gambling disorder, they could have what's called a brownout, where they forget what they've done in terms of how did I get here at this casino? How did I end up in this place? So those are called brownouts. So now I'll start bringing it back to just the faith, addiction, and recovery as I start to bring it to an end. There are several opportunities, not just for gambling, but for substance use, as well as for trauma that exist around faith, addiction, recovery. 12-step spirituality, we know that there are AA, NA. It began much of the literature that comes out of 12-step. You can go and find it in the Bible. Celebrate Recovery is actually a program that is specifically for the church. And I will tell you, during COVID, I went through Celebrate Recovery for an entire year. They don't only deal with substance use, and we were online. It was very impactful, and I feel myself getting emotional about it because we're right back where we were when I did Celebrate Recovery. I was dealing with racism, and I went to Celebrate Recovery, and I met with a group of women. It was called Cultural Community, and please forgive me, because I can't believe we're back in this place again, politically. But Celebrate Recovery, it really helped me because I was able to express to a group of women how I felt around the things that were going. I don't know how many of you knew, I think it was worldwide, about what happened to oh my gosh, George Floyd in Minnesota and the killing that happened. It smeared so many people, but Celebrate Recovery, and I really want to get back to what it was. I'm trying to get myself together here. Sorry about that. Celebrate Recovery is in the church. It is church-based. And
Take your time. Sorry, we're here. We're supporting you.
Thank you. I wasn't supposed to cry. I'm trying to be cool.
Support you.
So anyway, thank you so much for that. Celebrate Recovery is powerful. I just want to mention that. It is church-based. It does not happen outside of the church. It is church-based. Spiritual practices, prayer, meditation, fellowship, service and purpose, even that's part of 12-step, giving back to others as you have been given. And I go back to that whole grace. Give grace as it has been given to you. I have got to stop crying. I got to get myself together here. Whew. All right. So then there's also spiritual first aid. Spiritual first aid is very similar to mental health first aid. Here in the States, I'm certified as a mental health first aid instructor, and I've also gone through this training. This is church-based, it's faith-based, and it's a training that is online, and I'll share that information momentarily as well so that you will be able to access that if you'd like to. But it's on-demand spiritual first aid certification program, and it teaches you using a system how to address and help individuals who may be impacted by trauma, mental health, substance use from a spiritual lens. I mentioned mental health first aid. Mental health first aid parallels first aid in general, physical first aid, where an individual gets trained and they're able to, and it's for anybody. You don't have to be a therapist. You don't have to be a pastor. You don't have to be a teacher. It's for anybody. Mental health for everybody. But with that, and the same with this, anybody can be trained. It is awareness. And I push and I say, please take this course because we serve in our churches, we serve in our communities. People are impacted by trauma, mental health. These courses help you to be able to recognize, wait a minute, something's going on. This person needs help. How can I be of assistance? Both courses give you the skills to be able to recognize and to know when you need to escalate up to getting professional help for an individual. So I just wanted to share that's one evidence-based model that is on the faith-based side. And I will, again, share that slide with you all in the chat once I'm done. Just to kind of go back to a couple of evidence-based addiction treatments, it's been mentioned already about medication-assisted treatment. My early years prior to the state, I was in the community working at a treatment center where methadone was utilized primarily at that time, but now there's so many different medications that can be used for opioid as well as alcohol use. Also, these are all clinical and other ancillary ways that people can receive assistance for their traumas, as well as their mental health, as well as their substance use. Motivational interviewing is really just, where is the person? Where are you meeting this person? Everybody's not coming into the church the same. Everybody's not coming into treatment centers the same. Some people are contemplating, do I really want to go through this? Some people are like, I'm tired. I'm sick and tired of being tired. I need help. So there's very levels of motivational interview. And I know we have clinicians on here, but for those who may not be, that is another evidence-based model that can be used. Contingency management is kind of like, you do this, I'll give you this. It's behavioral reinforcement. And I remember working at an agency where we were giving away big things. I was like, can I get something just for showing up as a therapist? They were getting strollers. They were getting baby Pampers. I didn't need those. They were getting baby Pampers. They were getting a lot of stuff. And then it kind of slimmed down a little bit once funding's changed in our state. However, it can still be used in many different ways. And it's not you do this, I do that. I don't want to put it that way, but it is behavioral reinforcement strategies to help individuals show up to be where they need to be. If it's therapy, even if it's church, we know in contingency management, as it relates to being involved in churches, you keep coming back, it's going to get better. Your life will get better if you stay involved. And lastly, there's family therapy, of course, and I don't have to address that, is one individual or way of individuals receiving therapy as family members when it's available. I'm going to really quickly go through these last few slides just to show you some book resources. I love books. I have books all around me right now, and I would love to share them. but these are just some that I could get on the slide. So I tried to categorize them in substance use disorder. I actually have a list that I can share as well, but these are just some of the ones that I've used. Some are faith-based, Addiction and Grace, Trauma in the Pews, excellent book. Another book I used during my dissertation phase was It Didn't Start With You. This goes back to that whole conversation around generational trauma and how someone can be impacted by trauma from generations way ahead of them, and they may not even know that they have been impacted generationally by something that happened to a family member generations ago. The body keeps score. When we're impacted by trauma, it impacts our bodies, and our bodies hold on to that trauma. And then Breaking the Power of the Mask. My intern supervisor a couple years ago wrote this book, and I really love it. It's trauma-based as well and very impactful, but just removing the mask. And that's what we have to help individuals do when they come into our churches, when they come into our treatment centers, and our families. And then again, there's these also books related to gambling disorder. The one by Tony Evans is actually a very old book. I was looking to see if there was an updated version of it. It still is relatable to today, but it really kind of speaks to the church and gambling. And then there's an evidence book there around problem gambling. And this last book that I want to share is the book that I actually have a copy of it, the NIV Celebrate Recovery Study Bible that is used in Celebrate Recovery, very Bible-based, the whole program. So this was one of my favorites a couple of years ago that I keep on my desk. Last thing I want to share, and I think I'm about done for real this time. In 2008, the Lord blessed me with a vision, and it still exists. I haven't done a whole lot with it, but I was blessed to begin an organization, a grassroots organization called I Am My Sister's Keeper. And the scripture that the Lord gave me was repairs of the breach. And I'll talk about that in just a minute to just share what that means. But on the back of my business card, and this is that whole grace. Why am I getting sentimental here? What is going on? Who is cutting onions behind me? It is a lot going on, but I will say this is on the back of my business card. And it says, a man falls into a hole so deep he can't get out. A doctor walks by and the man calls for help. The doctor writes a script and tosses it into the hole and walks on. A priest walks by and the man tries again. The priest writes a prayer, tosses it into the hole and walks on. And finally, a friend walks by and again the man asks for help. To his surprise, the friend jumps in with him. Why did you do that? The man in the hole said. And he said, the one who jumped in. Now we're both, the one who was in the hole said, now we're both in this hole. And the person that jumped in said, yes, the friend responded, but I've been in this hole before and I know the way out. And that's what grace does for us. When God has been good to us and has granted us unmerited favor, we do the same for those who come behind us, because I didn't go into my church with no issues. I was tore up from the floor up, like they say, and someone extended grace to me. So as a therapist, as a minister, in every capacity that I walk in, I try to remind myself that I am a repairer of the breach. Isaiah 58:12 says that you will be the restorer of past dwelling. I don't know what's going on, but this was my dissertation topic because God brought it back to my remembrance. You are a restorer of the breach. And I say that to each and every one of you, that you are a restorer of the breach. Read Isaiah 58:12. It was around the scriptures around fasting, but God said to his people, and it's still very true to us today, we will build up the waste places. We will rebuild the walls in our communities that have been torn down.
Amen.
We are restored of the breach. It takes a village, and I'll leave you with this. We are repairers of the breach. There it is again. Let grace not only be received, but give. Grace is the turning point. Encourage someone to believe that they are more than a diagnosis, I am part of a village, and so are you. Thank you so much. And I'm gonna stop crying. Thank you.
Thank you so much. Oh my goodness, powerful. Kevin is raising his hand.
Oh, all right. I'll just give him the opportunity.
Thank you. That was so powerful. Thank you so
Thank
much.
you. I'm sorry.
No, please don't be. Kevin, can you give Kevin the opportunity to?
Apologize. That was a mistake. I'm sorry. I was trying to applaud. Really good hearing.
All right. Thank
That was powerful. Thank you so much for sharing. And I'm sorry, we'll probably ask for some of the resources that you shared, like the gambling. Yes. So when we'll definitely need to share that, the training and all. But yeah, so Sophie, go ahead. Question.
All right. Thank you so much, Kelly. That was such a powerful session. And it's okay. It's okay. So we have some questions here, about 8 of them. Sorry, 6. Yeah. So what are some early signs that someone might be carrying unprocessed trauma?
Process trauma. I would say they are one that get my thoughts together. They are one that may actually react to certain situations that occur, like one that may actually not be able to interact in certain relationships. It may be that they don't do well in group settings. They don't do well in relationships. They have a hard time discussing their past. They may relive their trauma over and over again. Those are just some early signs that I can think of that I've seen in individuals who have had been impacted by trauma.
All right. Thank you so much for that. The next question here is, okay, sorry. What's one myth about addiction that you wish more people understood, especially in faith communities?
Yeah, I think I would go back to the whole willpower part of it. That they just need to have willpower. That's not, when someone is impacted by substance use, and they're beyond the first day when they picked up a drug to use or whatever, or alcohol, whatever it may be, that they're impacted by. It's not just, it takes more than that. And I think the speakers prior to me have emphasized how the impact of addiction impacts someone. It changes the brain chemicals. So I think I would say, and I have said to many individuals, that it's not just about willpower for an individual. And I use the example of exercise. I want to exercise and I haven't gotten out there to do it, not one time recently, but it's not just about willpower. You have to change behaviors. And many times you need someone to walk alongside you with that.
Yeah. All right. Thank you so much. The next question here. Can someone truly overcome addiction without first addressing their trauma? Why or why not?
That's like what came first, the chicken or the egg. So I think that individuals can definitely work on you need to arrest the use or to help the individual be able to want them to not be using or using at the capacity that you may have encountered them in. For instance, when I was working in treatment, the first thing we needed to do was stabilize the person. We needed to get them on the medication that they need to have, or get them detoxed off the alcohol that they might have been using, so that their minds were clear, that we can process and then get them to a place. And it takes time. You don't jump right into talking about trauma at intake. It may come up in a question, have you been impacted by it? But you don't go into a whole conversation. You may never see that individual again. So you want to get the person as stable as you can before you begin to address. There is some work that, as I mentioned, in intake that comes out where you are talking about the trauma, but you're not delving in deep. You establish relationship with the person, make sure that they're clear-headed, they're not using at the capacity, especially because it takes time for people to if their goal is, to become abstinent from the use. Many people come in with the idea that I just want to reduce my use. So to answer your question, you want to make sure that the person is stable and clear-minded, clear-headed, that they are able to begin to process. Because if they're using and you're processing it, you may lose that individual to their active addiction.
True. Yeah. Thank you. The next one here. Throughout your work, what did receiving grace look like practically? Was it through people, faith, or therapy?
A personal work, you mean, or just working within? Can you repeat that question? I'm sorry.
Okay. Throughout your work, what did receiving grace look like practically? Was it through people, faith, or therapy?
Yeah. So I'll answer it in two ways. So I kind of indicated for myself, coming into settings, specifically my church, where I had individuals who walked alongside me, grace extended. For working with individuals in the field, I've sat and prayed with clients. When I was doing direct, well, I still do direct services, but when I was doing direct services, primarily, that was my primary work. I had clients who would ask me to pray with them, to cry with them, to hear them. It's being heard. That's the main thing, is people want to be heard. So the grace extension is hearing people, meeting them where they are, speaking the language that is not condescending and blaming and what's wrong with you, the trauma language that I mentioned a moment ago there. So I've seen it in walking in my own work with individuals, walking alongside them wherever they may be, praying when I needed to pray, praying outside of if they didn't want prayer, I'm praying for them anyway, not to myself, but that is what that looks like and has looked like in the work that I've done. You all still there? Okay, I see you, Mark. Okay, I see your head. Well, I hope this was helpful. I really do. I hope that the information shared was insightful, helpful. As I indicated, I know many of you are therapists already practicing many of the therapeutic techniques that were offered. Many of us are from faith-based institutions. And I just, if I could re-stress the grace extension, those who have been extended grace to extend grace. I think that's so important for individuals for us to do as we work in the communities that we work in, not just in the church setting, in our homes, and just education, understanding where people are through the addiction, the trauma, the mental health that individuals may be impacted by.
All right, thank you so much. Sorry, I had to turn off my video. My network is a bit unstable. Okay, the next question here. Thank you so much, Ma, for this session. It was very informative. You mentioned grace. How do we extend grace to ourselves when we feel like we've failed too many times?
That's a good one. That's a good one. I think the main thing is we are usually our hardest critics, and I had to think about that one because I think I'm my own critic, and I am. But it takes practice. It's so easy for us when someone asks us to list 10 of our greatest assets, list 10 of our worst assets. We can list more than 10 on the worst side. So I think the thing is that practicing grace and remembering that God has extended grace to you, extend it back to yourself. Sometimes we don't take care of ourselves because we're so busy focused. And I am talking to myself right now. Lord, help me. We extend to other people the grace that God extends to us. yet we have to also make sure that we do that to ourselves. So in terms of addressing the question, just remembering that grace has been extended to you, not just to pass it to the other person, but grace has been extended to you. So to soak in the grace of God. And it definitely takes practice. It truly does. We're not used to being good to ourselves, unfortunately.
All right, thank you so much. There's another question, and I think it's closely linked to the one you just answered. So, sometimes I feel like my trauma makes me unworthy of love, especially God's love. How can someone in recovery overcome that deep sense of shame, not just mentally, but spiritually?
Yeah, that's what it takes work. Because the world has, and that this is the part that is just so heartbreaking, is that the world and we ourselves are self-sabotaging ourselves, and the world also looking upon individuals who are impacted by trauma, mental health, substance use, illnesses, medical illnesses in a particular way. So there's a lot of shame that is placed on us externally, but then there's the internal as well. And I would say that it takes work, and work meaning not just time, but working with someone, getting with someone who can walk with you on this journey. If it's a therapist, someone from your church, that you can actually begin to talk about what is the root cause of that shame that is there? What is the root cause of that use? Or if it's mental health, there's a cause there. It's a mental health diagnosis, but it really takes walking with someone and understanding what the trauma is, understanding what the addiction is, understanding what the mental health may be that has impacted your life. And we can get to that place of healing, self-healing from shame. I hope that helps that person who asked that question.
Yeah, I believe it does. Thank you. So, two more people have questions. So, from Fortune, he has two questions. How do we really make people in our localities understand that trauma is a thing that really matters and should be addressed? And then the second one, how does one find grace in times of a relapse?
Yeah. So relapse, I'll start with the first one and go back to the second. You probably have to remind me of the first one. But relapse, when I started in the field of substance use, I would always hear relapse is part of the process, relapse is part of the process. And it happens, relapse happens, but it's how you deal with that relapse. There was a song by an American singer, Donnie McClurkin, that we fall down and we get back up. And I don't want to say it's as easy as falling over a crack and getting back up, a crack in the street. But it's just that it is. We fall down, we relapse, and I'll use for myself when I'm whatever it may be that I'm trying to get away from. But for that person that asked that question, as it relates to relapse and addiction, it is part of the process. It happens. That's not giving license to just go out there and I'm gonna, because it's part of the process. Work hard with wherever you find yourself to be, for the help that you need to get the healing that you need. But relapse happens, and you can get back up, and you can move from that place and get better. And so that is what I would say. The shame is there. The therapy, the involvement in church, and the love of God. God has forgiven us, and that's the most important thing. God nailed all this to the cross. Christ nailed all of this to the cross for us. And I don't want to say something that someone said to me, but once before, and that is, you need to feel better because you shouldn't be where you are because, God nailed it to the cross. He did, but things happen, and God knows that. He knows we're going to fail, but He forgives us. He forgives us, so we have to work to forgive ourselves. And so that all is what happens, and through that grace, that time of grace, and the dealing with the shame and all of that, it takes time, but it also takes community.
Yeah. Yeah, very important. Community is so important in times like this. So thank you for that reminder. And then the last question here by Victory. She'd like to know more about the spiritual first aid course, the duration of the course, and
Yep, absolutely. So it's actually offered through the college. I'm sorry, Sophie.
Oh, please go ahead.
Did I cut you off? But it's offered through a university here, and I will drop the links in the chat if I can do that, and make sure it's. I think there's a fee of like $120 or something like that. But once you get connected, they send you resources almost weekly, emails almost weekly, and it's really self-paced, on demand. You can go and do the course on your own. And once you are completed, they will send you a certification stating that you've gone through the spiritual first aid certification. For mental health first aid, there is an acronym called ALGE, and it's like 5 different letters that we use where we assess the situation. I'm getting my ALGE acronym, but then there's also the same for the spiritual, where it's called BLESS. And there are 5 different things that you do to recognize or to identify if a person is in stress from trauma, crisis, in mental health, or whatever the crisis may be. But I will drop those links that I promised to drop in the chat after I'm done.
All right. Thank you so much. Those are all the questions we have for today. It's been such a pleasure having you join us. Okay, there's some reactions. Yeah, thank you. We're really grateful.
Thank you, everyone.
Right. Okay. Sorry. Thank you everyone for staying to this moment. We have one last session. But before I invite our next speaker, we'll just do some activities just to get us ready. And yes, just to get a feel of the room. Taking that up will be one of our team members, Ayopami. So I'll just give her the opportunity to talk. Okay, you can go ahead, please.
Okay, hello everyone. I'm sorry I might not be able to share my put on my camera, but I hope that we can hear me and hear me well. Can we hear me?
Yes, I can. I believe others can too.
Okay, awesome. So I'm just going to be here for a few minutes and creating a space where we can all relax, reflect, and reconnect. I've titled this session Pause and Breathe, right? Just want us to, we've had from day one, it's been amazing. They've been dropping, points, I'm sure, in fact, without a doubt, that you've taken something, you've noted something that you want to change, something that you want to help someone with, or that you want to take into, the community where you are. I know we've all taken, powerful insights, powerful points. So I just want to pause for a bit, and this is not to disconnect from the, conference, but this is all part of the conference for us to go inwards, to reflect, and to recharge. So before we go further, I want us to take a quick poll. Sophie, please, could you help with that? So I just want to, how are you feeling so far in the conference? I want to, get our responses. I want to know where we're at right now. Some of us are, it's evening here in Nigeria. Some of us are in, morning, afternoon, wherever it might be, connected from. So I just want to, get a feel of, how you're feeling so far. Is it poll up?
I just launched it. Yes, it is.
All right. Thank you. All right, people, let's get those responses in. Let's get those responses. Okay, give it 1 more minute. So how's the how people responding? Let me know when we have about about 5 people or more.
Oh, sorry, I didn't know I was muted. I was speaking all along. Yeah, we have 11 responses now. 12 now.
Oh my. Wonderful. Awesome. Okay, I think we can proceed. I think you can let's see the
Okay, let me end the
results.
poll. So that I can see the results. Yeah, okay. All right.
Oh, awesome. Awesome. So we have 43% for energized and inspired, 43% for reflective and quiet, 14% for a little tired but still soaking it in. Thank you so much. Thank you so much. So right now in this moment, right, I want us to take a moment to breathe. There's sometimes that I just I go through days and breathing is like on autopilot, right? And there's some days that you're like, oh my God, I just took a breath in and I took a breath out. You just have that awareness that you've breathed. So I just want us to take a moment to breathe wherever you are. You're seated, you're in bed, you're in the car, you're going to work or you're coming back. Just I want you to relax. So I'm getting an echo. So I want
I'm
us to
sorry about
relax. Okay. I want us to relax and take one deep breath in. Let it out. Ooh. Now take it in again. And out. Ooh. You just breathed consciously. Consciously. You've shown up today, and that really says, something powerful about who you are. And I know that you believe in change, you want to help others heal, and maybe even still healing yourself. I want you to know that you're not alone and your presence here matters. We see you, we feel you, we see your reactions, we see your comments, we see everything that you do. So now I want us to do something, right? It's called put a finger down. It's called put a finger down. You're going to have your both hands up wherever you are. And I'm just going to be reading some prompts. So you put a finger down if it applies to you. And then at the end of the session, I'll let you know what you should do about that. So number 1 says, put a finger down if you've ever smiled when you were actually struggling inside. Put a finger down if you've ever felt guilty for resting. Put a finger down if you've ever helped others even when your cup felt empty. Put a finger down if you've ever thought, I should have it all together by now. Put a finger down if therapy or talking to someone helped you see yourself differently. Put a finger down if you've ever said, I'm fine, but you really weren't. Put a finger down if music or prayer has helped you through something hard. Put a finger down if you've ever encouraged someone else while you were still healing. Put a finger down if you've learned to say no to protect your peace. Put a finger down if you're still here, still showing up, still becoming despite everything that you've been through. Okay, we've come to the end of put your fingers down. So if you put all your fingers down or most of your fingers, I want you to know that it means that you're human. It means that you've definitely felt deeply, you've carried a lot, you've given a lot, and yet somehow you are still standing. You are still standing. And really, I must commend that because that is strength. That is strength. And sometimes we think that, breaking barriers looks like we're having it all together, but sometimes it looks like this, showing up even when life is messy, pouring even when it feels like your cup is empty, still showing up, choosing to keep going, choosing to, let yourself be seen, be heard, and, just showing up basically. Cheers to you for showing up. Now I have another assignment for you. Sophie, you help me. If there's anyone that wants to raise their hand and speak, I want us to share one thing. I know that we have lots of points that I might have gotten from this conference, but I want us to share one thing that we've taken from this conference and how we intend to apply it. Just one thing. Is anybody raising up their hand? Does anybody want to speak?
I haven't seen any yet.
Or you could send a chat if you want to speak.
Okay, we have to. Okay, great. 2 hands are raised. Okay. So I'll just allow them to talk. So Fortune will go, and then Emil's hand is also raised. Fortune, you can speak now. Yeah, and Emil will go
Okay,
next.
so can you hear me?
Yes, clear.
Okay. One thing I've learned from the conference so far is that no one is beyond redemption from addiction. Like I said yesterday, I talked to the friend and then he said, that some people, he thinks that some people are so condemned that they can't be redeemed. No, people are not beyond redemption. And one thing I plan to do now is more of the sensitization. Let these people know that there is help out there so that when you are aware that there is help, you can reach out for help. I think that's one thing I've learned from the conference, and it's a good take home for me.
Wow, thank you. Thank you so much. No one is beyond redemption from addiction, and he plans to sensitize people as it goes forth. Thank you so much, Fortune. I really appreciate the response. Okay, have someone else?
Yeah. Oh, am I being heard?
Yes.
Yes. Thank you so much. Oh my God. So one thing that I'm going with from this conference is that empathy, it's a very essential skill, very essential tool that we need in society, which means that we should live for others, live our lives, open to help others, those that are struggling, those that are around us, very, very essential. And from here, I'm going to open my heart more to listening and also observing, so that when I see those who are hurt, if I'm not in a position to help, I can look for where there is help for them to get. Thank you so much.
Thank you so much. And really, that's very important because sometimes we feel like, I can't help this person. Thank you so much, Emil. We feel like, I can't help this person. I don't have the, certifications or this and that. But, you can do the bridge, connect them to someone that, can help them, connect them to someone that can hold their hand and walk them through recovery, through transformation, and basically just, uplift them. Thank you so much. Is there any other person that wants to speak?
Yes, so we have someone's hand raised, and then we have 2 comments. Yeah. So I'll just read the comments before I allow Favor to speak. All right. So one thing, this is from Victory. One thing I've learned is that everyone deserves grace, even those who are on a journey. They need our love and support. Then this is from Counselor Joanne. She says, I sincerely believe humans are resilient enough to bounce back, but sometimes need the support of loved ones and other members of the community.
Awesome. Thank you so much. Everyone deserves grace, even those who are on a journey. And humans are resilient, but we need support. Yes, we always need a push. Thank you so much for your response. You have the floor.
All right.
Good evening, everyone.
Just go ahead.
Good evening.
Good evening, everyone. One thing I learned from the Breaking Barriers conference is to learn to show people suffering from mental health or usage of drugs love. They deserve love and empathy because they feel like they are out, like they don't deserve. They feel they have issues they are facing. This love that is being shown to them and calm and calm like correcting them calmly and love that is being shown go a long way to help them. They'll know they have people around them that want to support and help them come out of it. And secondly, if someone is suffering mental issues and stress, I think as people around them, prevention is better than cure. If you notice it immediately, don't allow them get to the extent that they have to like rely on drugs. Prevention is better than cure. Talk to them about the disadvantages of whatever they're taking or whatever they're using. Soft soft correct. That's all I have.
Oh, yeah. Thank you so much, Favor. Thank you so much. Everyone deserves love and empathy, even those that are struggling, those that go through a phase of addiction. They deserve grace. I'll just share a brief um, story. I don't have someone, with addiction living with me, but I have a very young, he's not a teenager now, let's say an adolescent. He's 11, almost 12, and he frustrates me so much, if I can use that word. Like, he gets on my nerves, right? And whenever I'm, correcting him, disciplining him, I just feel like I've not, been so angry in my life, and then I hear this still voice in my heart saying, love him, grace, just be gracious. And I'm like, really? But he gets on my nerves. So it's things like that. He's just being a child, and he would, everything that I'm correcting him about, he's definitely learning one way or another. So I think it goes to is someone speaking?
No, go ahead, Ayo.
Okay, ma'am. Okay, so it basically just goes to show that even with people who are going through addiction, sometimes they really want to stop, they genuinely want to stop, but some way somehow they find themselves back in that same spot. We need to show them grace, show them love, empathy, let them know that I see you, I hear you, I know that you want to change, and just basically just hold their hand through the journey. So I have one last activity for us to do.
Okay.
Sorry, before you go ahead, sir, I think Barrister Crawford would like to speak. His hand
Yes.
has been raised. I'll just give her the opportunity.
And we also have
Yeah.
our guest speaker here. So after that.
Oh my, okay. Barrister
Okay,
Crawford.
thank you so much. Yes, one thing I learned that is very, very paramount for me is that this drug addiction, therapy has to really be, God has to be involved in it. It's not only physical, but spiritual. In fact, faith-based counseling and faith-based therapy is very, very crucial. If God is not at the center of it, I think we are really not, we are really not working well if we don't involve God. And that is why I love Living Vine Mental Health Foundation, that is faith-based. Because if we don't involve God, just like Kenneth said, honestly speaking, prayer, fasting, and involving family to support in prayer, honestly, God answers prayers, and I believe that. Thank you.
Thank you so much. So much. Really appreciate it. And the good thing is, as you said one word, family. And that's what we'll be wrapping up with at the end of the day. Our last speaker will be talking about that. So Sophie, do you want to do the introduction?
Yes. All right. Thank you, everyone. Good evening, good afternoon. So I will just go ahead to read the introduction of our final speaker. All right. Sorry, please give me a moment. Okay. So Chu Haligra is the founder of Grace and Hope Consulting and an advocate, speaker, and caregiver with lived experience in mental health and disability. An immigrant from Congo, now based in Pennsylvania. Chu is a single mother and the primary caregiver for her 3 amazing children with diverse medical, developmental, behavioral, and physical needs. She brings over 12 years of experience supporting families impacted by chronic illness, mental health, and neurodiversity. Chu has served on multiple statewide family initiatives and is certified in trauma, suicide prevention, peer support, and biblical counseling. Through her work, she empowers families to thrive by integrating evidence-based practices with faith-informed care and lived experience. So, Chu, you have the floor. Thanks for joining us this evening.
Yeah, can anybody hear me okay?
Yes.
And thank you so much for having me. I am excited to be here. And as Sophie was sharing, I do a lot of work around mental health, but not because I need one more thing to do. I do this because it's more than work for me. I'm a person in mental health recovery myself. I have a loved one who also identifies people with disability in different ways and have their own mental health diagnoses. And I actually have an uncle who died of overdose of alcohol, and his liver was just damaged from the alcoholism. He's been drinking most of my childhood, and it was sad to lose him that way. So I share all that to say I'm here not just wearing my professional hat and all the hat and all the credentials and certifications and degrees. I come here as a family member, as a person in recovery, and so that we can together create communities where all of us can thrive, all of us can have the support that we need. So I don't know, are you able to share the slides, Sophie? If not, it's okay. I can just go without the slides, but it'll be helpful maybe to have the slides.
Yes, I am. So I'll put it up now. Okay.
Thank you.
All right. Please confirm that you can see the slides.
Yeah, can you put on slideshow so we can see one slide at a time? Thank you.
Okay.
All right, great. Appreciate your help. So we're going to talk about the role of family recovery, and I will share a definition of recovery in a couple of slides here, because for me, recovery is broader than just, drug and alcohol addiction recovery. But the focus here is so that we can start support all of us, ourselves, a loved one, maybe the people we work with, and start promoting healing through connection, compassion, and collaboration. Okay, next slide, please. There you go. So Sophie did a great job of introducing me. So I don't like this slide usually because I don't like talking about myself. But as I mentioned, my personal journey on this, my personal experiences are what leads me to do the work that I do. And everything I do, I also do from a trauma-informed lens, because often trauma impacts not just the individual, just like addiction, mental health, and chronic illnesses, disability. Doesn't just impact the individual, it impacts the entire family. And unless we address the trauma that we're dealing with, all of us are impacting, we keep impacting others. And we'll talk about that in a little bit. So you'll see a little bit of trauma-informed care infused in everything I do, because I believe that often is the bottleneck, if you want, of many, many, many of our mental health challenges. And now there's even lots of research that proves that many people, I think it's up to like 90+% of people who struggle with addiction are people who are also have experienced trauma. Many people go to drug and alcohol, go to other substances, and even working a lot, right? Sometimes we hide in the work because we have unresolved things, unresolved wounds that we never dealt with. Next slide, please. So just a little bit of what I like giving people, like a little roadmap, so you know what to expect during our time together here. So we're going to kind of understand the family's role and in supporting one another, but also get to my own slide on my computer here. You can see it better. There we go. The family's role in understand the family's role in recovery, but also identifying some support strategies. I want to share some case studies. That's because I believe statistics are good. We can all Google that. We'll see and like, oh yeah, there's so many percentage of people who need this. There's so many this diagnosis or this evidence-based approach helped. It's good to know the stats. But here's what I know to be true. Stories are what sticks. So I'm pretty sure at the end of all of this, you're all going to remember that I lost an uncle to alcoholism. You might not remember anything else that I said, but you remember why I'm sitting here today talking about this, right? Because stories are what sticks. So I'm going to share some case studies to take us just beyond the stat. And I will share some research for that too, but I want to take us beyond just research and seeing how applied research makes a difference, right? Where we apply the knowledge, the research that's been done in helping people live better lives. And then I'm going to share a few resources at the end. All right, next slide. So I mentioned earlier that I was going to talk about, give a definition, if you want, of recovery. So the one I'm using here is from SAMHSA. For those who are not aware of what SAMHSA stands for, it's the Substance Abuse and Mental Health Service Administration here in the U.S. But they have a ton of resources that are free that you can go on the website and just explore and learn, and use it for yourself, for your family, and for people that you serve. So this is how SAMHSA defines recovery. It's a process of change through which individuals improve their health and wellness, live self-directed life, and strive to reach their full potential. So when you look at recovery in this way, it's broad. Someone can recover from mental health challenges. They can be recovering from drug and alcohol addiction. They can be recovering from a job loss, right? They can be recovering from grief. They can be recovering from a sickness. Something recovering from, let's say, traveling or moving. And I share all that to say that, so when we are thinking about well-being, we're not just limiting to, oh, the person that has a diagnosis, or if maybe they don't even have a struggle that is, if that's easily to identify, right? So there are people, and I've been there, where I was sinking in depression, but I showed up for work every day. I took care of my kids. So on the outside, I looked like I was okay, like I had it all together. But only God and myself knew how much I was struggling inside. So when we talk about recovery, this applies to all of us. That's why I share this definition. So I want you to think about everyone is either in recovery of something or coming out of recovery or going into recovery from something, because life is hard. You don't need a diagnosis to be in recovery. You just need to be living, or to be honest, to be recovering from something. Sometimes it's a breakup, right? Sometimes it's a divorce. Like, we're all recovering from something. So this applies to all of us. All of us need support. I like to start with that because I don't want you to check out as you enter this conversation. It's so easy to think, well, I don't have a mental health diagnosis. I don't have an addiction. So this does not apply to me. I'll just come here and listen for the other people. No, I invite you to listen for yourself as well, because this applies to all of us. All right, next slide, please. So some of the recovery pillars, according to SAMHSA, are the one that are here. I'm going to go through them quickly here, just going to give us a sense. So when we talk about recovery, in order for all of us to recover well from whatever it is that we're recovering from, it needs to be person-driven. Meaning I cannot decide for even my child, or my spouse or my client, how the recovery should go. The person themselves sets the goals for that. Because once when I decide for myself that I want to be in recovery, I want to work on this, I want to recover for whatever it is, then I have more buy-in. I feel then motivated. I feel, I can persevere when things get hard if I choose it for myself. If it's forced on us, it's forced on me, let's say, I probably will not follow through with it. So yes, we can love, when we speak of talking about families, we can love a loved one, we can support them, we can pray for them, but be careful not to be pushing recovery on them until they're ready to embrace it themselves. We can talk about it, present it as an option, but don't make it as a punishment. Because I've seen this sometimes, our families will reach out to me and say, well, my son needs to to do this therapy. He told me if he does not come to you for therapy, we're going to kick him out of the house. I get it that sometimes we need that tough love. But what happened is the person will come for 1-2 sessions and say, hey, I did it, check the box. And then they go right back into whatever it is that they were struggling with in the first place. But when they own it, they choose it for themselves, they own the journey. They put in the work. So it's very important. It has to be person driven. And it's hope oriented. And we know that recovery is hard. But when we're looking at hope, for those of us who are people of faith, it's even easier, right? We can say that we put our faith in the Lord, and we hope that we know that we have hope. He's going to help the person as the person surrenders, their challenges and seeks the support they need. So no matter how far the person has come, no matter how bad it's been, hold on to hope. And I know as a family member, it can be actually very hard because the person's behaviors, the person's challenges impact us. We're the one up at night, maybe, praying for them. We're the one sitting in the emergency room at the hospital with them. We're one seeking for treatment. So it's draining. And it's so easy to say, well, they have not done X, Y, and Z before. I don't think they're going to do it this time. It's easy to say that, but I want you to hold on to hope. Because as long as you hold on to hope for someone and for yourself, recovery is possible. And there are times where the person cannot hold on to hope for themselves. They need to lean onto your hope. So whether you're a friend, whether you're a teacher, whether you're a pastor, whether you're a neighbor, hold on to hope for the person that is around you. But if yourself are also struggling with something today, hold on to hope. Or God is still able. Or God is able. Like I can briefly share my own story here. Myself included, would have never thought that today I could be sitting here doing this. Because I remember just as it was yesterday, but actually it was 17 years ago. I was in a psychiatric hospital. I didn't have the strength to live anymore. I was done. Depression has taken its course on me, and I was there because I needed to be supervised. Otherwise, I was having suicidal thoughts. And today I now help others, right? Recover from things like depression, anxiety, and trauma. And I teach communities how to create safe environments where people can thrive, can heal, so that suicide is not even an option. Hold on to hope. If I didn't hold on to, at that moment where I couldn't even hold on to hope, if I didn't have people who held on to hope for me, I wouldn't be here today. Right? And recovery is also holistic, meaning it's not just one thing. It's so easy to think, well, they're struggling with drug addiction, so we just need to make sure that they get treatment for that. Well, think about how that challenge impacts the rest of their lives. Impacts them at home, how to interact with their family, impact them at work. I remember my uncle couldn't keep a job because of alcohol. It impacted his marriage, he ended up being divorced. So you think about that, the challenges that we face impact many areas of our lives. So our recovery should also be holistic in a way that we look at people, all the areas of life, home, work, community, family. And the multi-pathway there just means that there are no one size fit all. For someone, maybe therapy is all they need. For someone else, maybe the therapy will look different. It could maybe they're doing talk therapy. Maybe someone is doing art therapy. The people doing that, they do music therapy. And maybe for someone else, it's like they need to be in the treatment facility for a short period of time. They get intensive treatment there and they're fine, they come home. For someone else, they're doing all these therapies and they're doing coping skills like journaling and deep breathing, and they're incorporating their faith into it, they're praying about it, and they're still on that journey maybe longer than someone else. That is still okay. And recovery is also community-based. Healing happens in community. I cannot stress that enough. Healing happens in community. I have another training I do where the title literally is, when we change I to we, illness becomes wellness. So think about the word illness, the way you write it, right? ILLNESS. Well, if you take that I off and you just replace it with WE, we, it becomes wellness. Mental health, addiction, even illnesses are often isolate us because there's shame that comes with it. And that's what the devil wants. He wants to isolate you so that you suffer alone. But we know the Bible tells us two are better than one, right? And that's not just a marriage scripture. That is for life in general. We all need each other. So in order for me to be in recovery, I need people around me to support me. And it needs to be trauma informed. Like I said earlier, realizing that many of us are struggling with unresolved trauma that is impacting our physical, mental, behavioral, spiritual, and even financial well-being. We need to address trauma in our lives. And respect-based, and I know there's a lot of stigma around mental health, around addictions, and we don't always see it as just health conditions. When someone has, someone's struggling with, let's say, diabetes, we have no shame saying, hey, go see the doctor, get an insulin. When we hear someone, is struggling with mental health and they're antidepressant, or now they need to get injections, or, to control the opioid in their body, we start judging them. That increases shame. And when people feel in shame, feel shameful, nobody wants to heal. It becomes harder to heal when shame, we're covered in shame. So let's show respect. Remember that beyond the addiction, beyond the depression, the anxiety, the outbursts, beyond even the behavior that comes with addiction, where some people will sometimes steal from their own family in order to feed the addiction. Remember that behind all of that is the soul for which Christ died for. I'm not saying I agree with the behaviors. I'm not saying I agree with all the hurtful things they're doing. No, but love the soul for which Christ died for. And if we love that soul, it becomes so much easier to show respect. Let's give people dignity when they're struggling. Next slide, please. So when we talk about supporting families, one of the approach that is very helpful is family system, which is a type of psychotherapy that looks at the individual as part of a bigger whole, as a bigger entity per se, bigger community. It's so easy in our medical model to say, oh, this person has a diagnosis, so we treat this person, we give the medication, we give them therapy, we do whatever they need. But unless we start supporting the entire family and realizing that the interaction that this person has with people around them also impact their recovery, we're always going to be coming short. We're not going to meet the goal of recovery if we keep isolating people, right? Mental health challenges, addiction, all of that, illnesses already isolates folks. And if our systems of care also come and isolate even more, we will not be able to support people in meaningful ways. So I want you to keep that approach when you meet someone. Yes, support them, but remember, in order for them to stay supported, in order for them to stay well, the people around them also need to be supported. And the implication of the family system model into this conversation about recovery is that patterns will influence recovery. So if someone can go to therapy all day long, they can be in a treatment facility, and they come home and people don't respect them. They come home and nobody wants to talk to them because they're like, well, you did that to yourself. They look at them as less than. That will not help them continue to be well. I've heard people say, what's the point? I did all this work and I come home, nobody wants me. Nobody cares about me. So those patterns might be, yes, what people are doing, or the patterns in the environment, but also sometimes the person themselves. What are the things that they keep running to when life gets hard? What are the people they keep reaching out to that takes them back into that same lifestyle that we're trying to pull them out of? Nobody's perfect. We're all going to make mistakes. There are going to be times we're like, oh, I wish I could have done better. But you want to focus on the pattern. If something's happening over and over again, if every time you go to see Jimmy, every time you go see, I don't know, Auntie so-and-so, she's always has a bottle for you, maybe that's the place we don't want to go anymore. And it might take another family member to say, hey, we love Auntie, but Auntie does not realize how detrimental that bottle is to your well-being, right? We're looking at patterns. And the emotional support helps. Recovery is hard. It doesn't matter what people are recovering from. It is hard work. You might say, well, they just sat in therapy. They just took a pill. No, they took the antidepressant pill. It is hard to choose life every single day. Life is hard to choose abundant life that Christ has for us every single day. So you as a family member, you as a friend, you as a neighbor, you as a church member, giving the emotional support is really, really key. And it could be as simple as just saying, I don't know I don't know exactly what it feels like, but I'm sure it's not easy. If you just need a listening ear, I'm here. And the last point on this slide is what I mentioned earlier. Recovery impacts the whole family. When my uncle was drinking and comes home and he's struggling and have yelling and screaming and saying all kind of, all kind of words in the language that we often will not use around us, then all the adults have to go hide the kids because we don't want the kids to hear that. And sometimes he used to come sadly, like he wouldn't even know where he was, and you'll start thinking he's in the middle of the compound and thinking that he's in the bathroom. And the people there, we all got impacted by that. I grew up not wanting to see even a bottle of beer in front of me because I remember what it did to my uncle. I remember my mom and her other brothers working so hard to gather money to make sure that he got treatment. I'm originally from Brazzaville, Congo. And back then, and even today, made things a little better. But back then, there was no such thing as as treatment available to him. And I often say it for myself. I recognize honestly the privilege that I have to have been in the U.S. when I struggled with my mental health challenges. Because the support I got here would not be the same support that I would have had back in Congo. And this is why we do this, right? This is why we have these platforms to make sure that all folks, all families are getting the support that they need, that we're educating everyone about mental health, about addiction, and so that we can start healing as a community, as a people, as an African continent. Next slide, please. So what can a family member do? We talk about the emotional support. It looks like encouragement. I know you're trying. I know it's hard. And some days things don't just go your way. And I'm sure some days you feel like giving up. I know that we're here. We show that love, right? You're not alone. I might not always understand, but I'll always stand by your side. I don't care what you've done, but I always want you to know you can always come and tell me. And when we start showing that love, the encouragement, and even understanding as little as possible, it breaks those walls of stigma. It breaks the isolation, and people become more motivated to recover. But let's not just go loving with words, right? We love with action too, like the Bible tells us. So we need that practical support. Maybe someone needs to get to an appointment to get support, but they can't get there. Can you help them cover the bus fare? If you have a car, can you drive them? And maybe you don't have a car, but they have the bus fare, but if they left to their own device, they might back out and not go to the appointment. Maybe you go with them. You don't have to go into the meeting with them, but at least you ride the bus with them, you get there, you sit in the waiting room and let them go see the counselor on their own if they need to. But that's that's practical support. And sometimes when a loved ones are taking medication, I had to do that with my loved one now in my house. I had to be the one holding the medication because we had the episode where they got suicidal and they wanted to take the entire pill, the entire bottle. So ways to support, it's also helping them manage that medication, taking things away that could be harmful to them. I remember at one point we had to hide all the forks, all the knives, anything that was sharp in our house in order to keep one of my children alive. Maybe someone who is in treatment and they have children, maybe you help with childcare so they can go get the help they need. And if you know someone is just stressed, and stress is often I call the silent killer, because from all of us, we could have pre-existing conditions, things that are just dormant, if you want, in our system, in our DNA, in our genes, in our bodies. And as soon as stress hits us, the higher the stress, the more stress we deal with, the more it impacts every area of life or well-being, and all the dormant stuff start coming out. So you could see someone that been in recovery, which I've seen, someone been in recovery of, let's say this person was drug and alcohol for years, and then they lost their job, the mom died. That's a lot of stress, a lot of grief. And they tried every coping skill they knew to do, but the stress was so high that they felt like they didn't have any more internal strength to deal with it, and they went back to the bottle. They went back to drugs. So during those times of crises, if we provide practical support, someone lost their job, maybe next time you make that stew, just bring them a plate. Maybe help them if you have an opportunity to have to pay them to do little jobs around your house. You might feel like, well, that's small. How's that going to help someone stay in recovery? You have no idea. Work, it gives people a sense of purpose. It gives them something to wake up for, to go to every day. So if you see someone struggling, you're like, well, whether they've been in recovery before or not, whether you know they're struggling or not, the tangible support we give to one another helps all of us be well. Someone is less likely to think about the bottle or sink into depression if they have something to do to people who love them and support them along the way. The next point there is accountability. Like I said, recovery is hard work. Unless we have people who hold us accountable, it's so easy to give up. So as that family member, as that friend, as that the pastor, the priest, the church member, whoever you are, with all the roles that you have, you wear, I want you to know that people around you count on you, whether they tell you that or not. You showing up and saying, hey, how are you doing today? Means a lot to someone who's sinking low, who hit rock bottom. There's actually a guy, I can't remember his name now, who was, where they was here, this was here in the US, was suicidal, thinking about jumping off a bridge. Someone came and smiled at him, and that's what turned his life around. And now he speaks and shares that story worldwide. A total stranger saved his life by a simple smile and saying hi, because it showed one person cared. So you might say like, well, I didn't set up to have like an accountability meeting with them and check what they're doing. Yes, if it's someone that you know and you can do that, no, if they say they're going to an appointment, check them. Did you go to the appointment? How did it go? I don't need to know details, but just holding you accountable that I believe in you. I believe you can do this, and God will give you the strength to continue your treatment. But if it's someone you don't even know, someone you meet at the market, put that smile on. Say hi. Back to showing people that dignity. Even if you see someone who's drunk, and yes, of course, keep your own safety too. But if you can just probably say hi, you never know what that's going to do to someone else. But family also serves as a powerful motivator. I share my story 17 years ago when I was in psychiatric hospital. What I didn't tell you is that I was home, and the one thing that helped me not to complete suicide was the fact that I had family that needed me. My daughter, her name is Hope, and when I named her Hope, I didn't even know that she would be my Hope. She was only 2 at the time. Now she's 19. I thought of her as hard as life was at that point, as weak as I felt in that moment. Just knowing that I had family, from this case, my daughter, who needed me. I didn't want her to grow up without a mom. That's what saved me. I was then, instead of taking the bottle of antidepressant, the entire bottle, I actually picked up my phone and called for help. So you just being present in someone's life can save a life. I call it the blessing of presence. With something like, I don't know what to say. And I know it. Sometimes we find ourselves in difficult situations, right? And it naturally, even when someone dies, we're like, well, I don't know what to tell the family member. Sometimes you don't have to say anything. Just show up, be there, have a seat, put a mat, lay there with them, be there and just tell them, I am here for you, no matter what. That's a whole ministry in itself, my friends. Although I have all this accolade and all of that, do this for work, I can't tell you how many times I just show up and I don't even talk. It makes a difference. Like as we've been doing this, I have someone who lost their child, but actually a year ago, and no, earlier this year, sorry. And this week is the child's birthday, and grief hit so hard that this parent started sinking for depression because the grief was so high. I didn't have to tell them how to grieve. I didn't have to tell them that it's going to be okay or this too shall pass. I just had to be there. I showed up and reminded them that they were not alone in this. And that made a difference. Next slide, please. So I want you to take a moment and think for yourself. Just take a moment. Who is your family? Who is in your family? And another way to look at it, who do you call family? So when I'm using the term family here in the following slides, this has nothing to do with blood relatives, although blood relatives are included. But for some of us, those who we call family, those who are there for us, are not people we're related to by blood. When I was struggling deeply with mental health challenges and had to be in the psychiatric hospital, it was a friend who stayed with my kid. She is family. So think for yourself, the people who are around you, who support you. And if anything else today, if you're able to, I really encourage you when we're done here, send them a text. If they're physically there, give them a hug and just say thank you for being my family. Because their presence alone is a blessing in your life to buffer through stress, to help you through hardship. And it might be a 2-year-old. For me, it was a 2-year-old who didn't have anything to give me, right? Nothing tangible. But just her presence saved my existence. Next slide, please. So here's a case study. I think we have 3 of those. So this one is for Maya. Maya, at this time, was a 22-year-old. She was diagnosed with bipolar disorder. And the family was struggling because, again, when you hear bipolar, people think, oh my goodness, she's crazy, she's cuckoo. I don't like those terms. Life is crazy, right? But people are not crazy. So people deal with challenges and it manifests one way or another. But it's very dehumanizing to call someone crazy. But because of stigma around mental health, the family also has stigma. They're like, well, nobody wants to talk to her anymore. So everybody was kind of leaving her alone. But say, well, we'll just leave her alone because we don't know what's going to upset her, and then she'll be yelling and screaming and tearing things out, things here and there. Not only that led to her being more isolated, but also it really fractured, if you want, the family dynamics. Maya was an aunt, Maya was a sister, Maya was a friend. And she brought so much joy into people's life. But when she started struggling with mental health challenges, she was struggling alone. People forgot about who she was, forgot back to what I was saying earlier, forgot about the soul beyond the challenge, beyond the diagnosis. And the way that we support this family was through psychoeducation. Because the way to break walls of stigma and confusion is to educate people. So we talked about bipolar, teaching families what that meant. How yes, she's struggling, but it's not something, one, that she chose for herself, and 2, it's not something that defines her, and 3, hope is possible, recovery is possible. I know people with bipolar disorder who are working as nurses, who are leading businesses. Because with the right support, all of us can thrive. So when we start educating the family, not only Maya, who was in and out the hospital all the time, was able to stay home. So she was not hospitalized as often. That definitely reduced that. Even when she was hospitalized, usually maybe because she stopped taking her medicine for a little bit, because sometimes when she was feeling better, she's like, I'm better, I don't need my meds. And then that was what led her to the hospital. But it was not like before, where it was because she felt alone and didn't want to live anymore. And this is what we know from research. When we educate families on mental illness, it actually reduces relapse rates by 20 to 50%. Education alone, knowledge is power. So if you have a diagnosis or a loved one has a diagnosis, I encourage you, Google it. I'm going to share some website towards the end here. Take a screenshot of those. Go check out those websites. You can look at things by diagnosis, understand it, but also have a conversation with your loved one who's struggling with it. How is this impacting you? How can we support you? What makes things hard? What makes things easy? And then when we know what the things are hard and easy, then we do something about it. Next slide, please. So this one is Moses. Moses was 35, and he was recovering from alcohol addiction. Of course, because when he drank, he was not pleasant. He would miss work, and then the family didn't have the income, and he would get mad. And and when he was sober, he would realize there were things that he couldn't tell his family sometimes, and he'll wait until he was drunk to just start cussing people out left and right. Like all his own anger came out because he had unresolved trauma that he never took, that was not dealt with. And so not only alcohol became his way of coping with his unresolved trauma, but then when he was, intoxicated by alcohol, he did things that were really hurtful to the people who loved him and cared about him. So guess what? The family became angry. And when they became angry, they became distant. And what we did with this one, the intervention that was helpful, it was including the family in the therapy sessions. So that Moses could share, when he was sober, could share some of the things that he was struggling with internally in a safe place with a mediator, in this case, a staff member, a counselor, who can help him, remind of his coping skills so he can regulate, his emotions when it was hard to say some hard stuff, but also for his family to have the support there to understand how that impacts his psyche, right? His mental health. And they were able to talk for things that they did not talk for decades. As a result, his family started trusting him again. His family now, so part of that, those counseling session is also giving, providing psychoeducation, of course, but then in addition to that, giving families a safe place to process and heal together. So not only Moses got off the bottle, because now he had tools to utilize when he felt overwhelmed, but he also took care or addressed that unresolved trauma that he was dealing with for things that happened during childhood, what mom, dad, uncle had done to him. So when this is the words in bold there in black, is kind of what comes from the research, and I have the links there. But what we know from research is that family therapy will improve substance abuse outcome in a major, very significant way. So instead of isolating the person, just having the person themselves getting help, getting support, we need to support the families. A lot of families go through new trauma just as a result of having a loved one with substance abuse, a loved one with a mental health diagnosis. Families need support too, as they support the loved one. And the stronger the family feels emotionally, mentally, spiritually, the more strength they have to support the loved one who's struggling. Next slide, please. So you might be saying, oh, that sounds all good and dandy, Shu. That sounds really good, but you don't know in real life it doesn't work like that, right? So those case studies are very short to kind of tell you this, what were the issues, what helped, and what was the outcome after we did those intervention. But I realized that there are barriers to families getting involved, right? We talked about that stigma and shame. Because it's not just the person who is going through the challenge that feel shame when they're sober, when they come back to themselves per se, but even for the family. It was shameful for us to have an uncle naked in the middle of the compound and the people passing by. Or sometimes little teenagers from the town driving him back home because he's drunk and such, it just like disheveled, and it was very shameful. So that's what families need to understand, right? That even when we talk about drug and alcohol addiction, there are literal biological conditions. It impacts people's brains and bodies to the point where it becomes hard to let go unless they get real help. So when people understand that, then we start separating the person from the situation. Then I can say that my uncle struggled with alcohol addiction. Instead of maybe saying my uncle was an alcoholic, right? Because I don't want that to define him. It's easier to remember the person behind the soul, right? Behind the behavior, behind the challenge. But families also get burnt out. It's hard to take care of people, to take care of loved ones during challenges. It's tiring physically, mentally, financially. And sometimes families want to help and they don't know how to help, and they start enabling instead of supporting. So you might say, okay, what's the difference? I'll give you an example. If every time they'll go to Moses case study here, every time Moses got mad, if his family gave him everything he wanted, he'll be, for their sake, they'll think, well, that will keep the peace. He'll be quiet. He's not going to be yelling and drinking more and all of that. But in doing that, they didn't realize that they're actually enabling his drinking. They're enabling that behavior. And for him, he was saying, well, I'm so mad, so angry at everybody. I need to drink in order to, and when I drink, then not only I feel better, I numb that pain, but then it gives me the courage to tell them all the stuff I want to tell them. You want to support, not enable. Support looks differently. Support is trying to help people be and stay in recovery. And sometimes that means tough love. Your loved one will not like you when you're exercising, if you want that tough love in order to support them. I said this to a family once when one family member had reached out for help for another one and said that now they won't talk to them anymore. They, deleted a number. It's like, wow, I just lost my sibling. It feels like I lost my sibling because all I did was try to get them help. It hurts. But here's what I told that person. I said, 10 years from now, you will be grateful. I'm sure you'll be grateful that you saved your sibling's life. Even though here and now in the moment, they don't appreciate it. Your sibling down the road will realize the reason they're still alive, the reason they're still here is because you made that call. And I hope at that time they find you to thank you. So support does not always look pretty. It is definitely not easy. But make sure that you are supporting and not enabling. That you're giving them reasons to live a full life, opportunities to improve themselves, to get help. Don't lead them back into the addiction, back into the pain, back into the depression, just because that keeps the peace. That's no peace at all. That's an illusion of peace. And then there's also the lack of knowledge, right? Like the first case study I mentioned, we did a lot of psychoeducation about bipolar to help the family understand what was going on. And sometimes the family conflict, like in Moses' case, there was family conflict before he became an alcoholic, the way the family is calling him, right? But before you start dealing with, being challenged, if you want, with alcohol, there was conflict that was never resolved. Just like there was also trauma that was never resolved. And when he got the support that he needed to resolve the trauma, and the family got a safe place to address the conflict, guess what? There was no more need for the bottle. Next slide, please. So speaking of trauma, this is our last case study. So Aliyah was 16, and Aliyah was a sexual abuse survivor. And as a parent, and I'm just going to put a disclaimer here, if this had happened to you or this had happened to someone you know, it's not your fault. It's not your fault, and help is available. I'll have my contact information at the end. I'm available on WhatsApp, so no matter where you are in the world, if you download WhatsApp, you can reach out to me. Do not blame yourself for this. No matter how it happened, nobody is responsible for the other person's behavior, right? And as a parent, in this case, mom was so hurt. She's like, I couldn't protect my child. And she withdrew. So the child was abused and the mom became depressed. So both of them were struggling, battling the challenges there, and nobody was talking to nobody. The child felt all alone. It's like, well, I came and shared what happened to me instead of supporting me. Mom is just in her own little corner. She's not even talking to me about it. Nothing's being done about this, what happened to me. But mom was struggling as well. And so in this case, we had to do trauma therapy for everyone. Individual session for mom, individual session for the daughter, and then family session together. So each one of them had a safe place to process and start healing and recovering from the trauma itself so that they can rebuild their family, rebuild that attachment they have for one another. Like I said earlier, most of us Probably, I would say at least 90% of us on the call here, just based on statistic, probably experienced traumatic things in our lives. And it doesn't mean there has to be something big. Sometimes what might be big to small to someone might be big to somebody else. And making sure that we are getting the support we need to address those things that happen to us helps us to be well so we can support others as well. Trauma-focused therapy, family therapy, increases resilience for everybody. It helps all of us bounce back from adversity. And then we learn coping skills and strategies to not only prevent future things from happening, but to even address challenges better in life in general. Next slide, please. So then how do we support families in recovery? So I shared many, many tips there already, right? But I also want to leave you with this. If you're looking for therapeutic support, you want to make sure that whoever is supporting you has some understanding of family system therapy. That they understand that you don't just live in a vacuum. As a human being, we come from people, and we're connected to people, and all of those connections impact our well-being. And maybe you want to consider multi-family group therapy. We even do support groups now with my agency. We do support groups for families because we understand it's so easy to think, oh, I'm all by myself in this. This doesn't happen to anybody else. And then until you sit in a room or you're in a call like this and you realize, oh my goodness, there are others who deal with this. So it's okay to talk about it. It breaks those walls of stigma. It breaks the walls of shame. And I already mentioned earlier about trauma, right? We need to address it. So make sure that there's some kind of trauma-informed care model infused into the support you're getting. Next slide. But also, as we're supporting families, for those of us who do this as for work, right? Whether it's as a volunteer or paid staff, it doesn't matter. If you are in a role where you're supporting others, I want you to make sure that you are respecting people's cultures. And I know, here many of us on this call from Africa, and I often share this example where, for myself, I was born in Congo. I left Congo the first time I was 10, came to the US. But even when I was in Congo, my stepmom came to Congo when I was 5. So I was 5-year-old Black from Congo, born in Congo, and by being raised by a Caucasian American mother. My skin culture was not my family culture. And back then, I didn't need the support that I needed later on in life. But I share the example to say that just because someone presents one way doesn't mean we don't assume that this is the way that the culture they present is how they want to be supported. That's why it's good. It's really important to have this conversation, asking people how they want to be supported. But also in different cultures, there are different family roles. When there's an addiction in the family, when there is health issues, disability, mental health challenges, there's often like a gatekeeper. There's someone who's like, the glue that keeps everybody together in most families. And you might think, sometime in Western culture, it's the adult, but sometime in African culture, it's a child. So being aware of that, right? Getting to know people first, back to, again, seeing the soul behind the challenges. Get to know people, what's important to them in their lives. What are the dreams and aspirations they had before even the challenges came and even happened. The more you get to know people, the easier it becomes to support them. But not only that, the more you're giving them dignity and respect, that empowers them to choose recovery. And I know there's a lot of, ramification, if you want, with mental health and behavioral health challenges, the spiritual and all of that. I'm not against all of those things, but I also want us to just be very, 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 very careful. I've seen in my own life, I remember back home, and even when I came here, I have an uncle, another uncle who's younger, who had a drug-induced psychosis. Didn't know where he was, who he was, and nothing. Like, he was really struggling. And the church meant well, but we start hitting the poor guy to get the demons out of him. I am a person of faith, and I didn't even share this, but I'm actually ordained minister. So I believe in power of prayer. I've seen how God has delivered myself and my loved one from many things. But hitting people because they're struggling with depression or anxiety, with drug addiction or with alcoholism, that is not what Jesus called us to do. Let's lead people back to Jesus as the healer. Lead people back to the Holy Spirit as the comforter. But let's remember there are people behind that. Back to that respect. And sometimes I've seen this, especially with mental health. I've been there where people are like, well, you just have to believe harder. You just have to be stronger. Read your Bible more. If you read your Bible, you'll see there are people in the Bible who were depressed. When you think about the one that was I can't remember the name. Is it Joshua? No, it's not Joshua. Jonah. Jonah would rather die in the whale's belly than to go do what God called him to do. He probably at that point he was choosing not to live. Yes, that could be suicidal ideation there, right? But even before he got there, he had so paralyzing anxiety that he couldn't do what God called him to do. And you see David, you will see many kings in the Bible, right? They go for victory and then they sink down so low that they can't function. But God. So maybe that Bible isn't called, you don't see a black and white depression, but you see those symptoms there, right? For depression, anxiety, even bipolar. So you see all that. We all love Abraham. Abraham denied his own wife, called him sister because he was trying to protect himself. You say, well, he's just a coward. No, he had some issues there. My point here is to say that mental health challenges and substance abuse challenges are part of the human experience. And yes, we want to make sure that people know that Christ is the ultimate healer, but he also works for people. He said, we're five counselors, right? That we prosper, we flourish in the multitude of counselors. We need people to walk with us on this journey. People who respect us, love us, and yes, understand the cultural consideration per se, but who are not using that against us, but rather using it to support us. When I was struggling with my own mental health challenges, I had counselors and psychiatrists who were so good in their field. My pastor, my faith community was so good in their field, right, in prayer, but they couldn't merge the two. I couldn't go to church and openly start talking about being depressed even after I fasted and prayed. I couldn't go to counseling and start telling, oh my goodness, no, yes, I had a rough day, but I pray that God helped me. Like the two are so separated. And that's actually why I started doing this work that I do today, because I wanted to be able to incorporate faith and give to others what I needed when I needed the most. People who could, really consider my cultural background, right? As an African raised by an American Caucasian mom who is a Christian, right? And yet still struggle with depression, anxiety, and PTSD back then. So again, see the people, get to know them, get to know even how the family functions. When you come to support someone, you're not coming to impose your way of doing, you're coming to support them on the goals they set for themselves. That's why we started with that first tenet, that first pillar of recovery. It is person-driven. And everybody that comes is supporting that person. Next slide, please. So here are some resources. NAMI, again, most of these are based in the US, but they are available like online, and there are resources for everyone on there. And so if you want to take out to just take a screenshot so you have it. So I mentioned NAMI, that they're free education and support for mental health, especially for caregivers. They even have support groups online. The Family Caregiver Alliance, they have a lot of tools for caregivers, just caregiver.org. I mentioned about SAMHSA, right? And there, if you go samhsa.gov/families, you can get a lot of resources for family there. The next one is for family addiction support. And now you go there again, you're going to find support there, resources that are free to start there. I know, and this is again why we do this thing, because the resources are so scarce, in Africa, that we need to be talking, having these conversations in order to break the stigma, so people can utilize and seek the little help that is available. But it's also why we need that peer model. right? I think Sophie was the one who was reading my bio. How I know I champion, if you want, peer support, because I realized when there's no psychiatrist, there's no psychologist, there's no rehab therapist, there's no counselor, a peer sometimes, and even when those things are those other people in place, a peer usually has the biggest impact because it's someone who been there, done that, and I often say has the dirty laundry to show for it. And I met people who would say, oh, I've seen a lot of psychiatrists, a lot of psychologists, they helped me. But it wasn't until I met someone like you, someone in your staff who has lived it, that I believe that recovery was also possible for me. So if you are someone who's struggling with some of those challenges we talked about here today, you can be a beacon of hope for someone else. Provide that peer support. Be the reason why someone else stays alive, and say, no, if God did it for her, for him, he can do it for me as well. The last one there is the Child Mind Institute. They offer a lot of trauma and behavioral help. Again, free resources. That one you can, on the Child Mind website, you can even sign up for some courses. I believe to still do it. But back then they even had little online modules you can do for free. Just you can learn more and then you can serve more, or serve better per se. Next slide, please. I think we're towards the end here. So here are the takeaways. I'm going to close in this. Recovery is relational, right? We don't recover alone. We need people. That's why family involvement is so crucial. It's actually a vital key to recovery. The second point there says that families that we talked about, as I shared in those case studies, they need education, we need support, and sometimes we need healing of our own, because our loved one's condition has impacted us too. Last point, if we empower families, by empowering families, we're empowering recovery for everyone. Because when one person heals, the whole family can heal too. Thank you. I think the next slide is my contact info. Now, we can go to my contact info just for sake of time. There you go. All right. So there are my contact information. Feel free to reach out. That phone number is available on WhatsApp. And when Sophie read my bio, she mentioned that I'm the founder of Grace and Hope Consulting. Yes, Grace and Hope Consulting is the main umbrella. The support that we provide to families is under graceandhopefulfamilies.org. So you can check that out. You can email them, talk a little about the peer support. They're building relationships, supporting families with with mental health, with challenges, with disability, chronic health issues, and so forth. So I'm going to pause there. And I think there's some questions and we can address those.
Yes, there are some.
Oh, I can't hear you anymore. Uh-oh. Sophie, I don't hear anything on my end. Well, let me see if I can get to the chat too.
Thank you so much, Sophie. Thank you so much. It was fantastic presentation. Thank you for sharing the information. It was so good to learn this. I don't know if anybody has questions. I don't know, maybe there's something going on.
Can you hear me now?
Yes.
Okay. Hear you.
Okay. I'm sorry, it was my network. I apologize. Okay, yes, we have some questions here. Thank you so much for that session, really. Okay, so I believe burnout is real. What advice do you have for family members who feel emotionally exhausted while trying to support someone in recovery?
Yeah, I think the first thing is recognize that you cannot serve from an empty cup. Right? So if you're drained, you cannot be fully present. Most of us, when we're tired, we become irritable. So we don't have as much patience. We don't have as much grace to give. So don't wait until you get to that point to pull away. Start making it, as I often tell family members, try as much as you can to infuse little time for yourself while you're caring for someone else. And maybe when you start on this journey, it might be just 5 minutes to hide in the bathroom if you have to. I've done that, right? Maybe it's, if I have to take a loved one to an appointment, I bring my book, If You Love to Read, where I'm going to do something for myself. I'm going to read that book. Maybe I bring my headphones so I can go listen to my worship music. Make sure that you are doing little things here and there to fill your own emotional and spiritual cup. Don't wait for the sky to fall and to figure and try to put everything back together. Prevention is the best medicine, right? Not just for a loved one, but for ourselves as well. So I'm not going to wait to get to burnout. If you're already there, definitely try to see if there's others who can take care of the loved one, so you can take a little break. Maybe if you cannot do a whole day, maybe just half a day. Can someone be there for your loved one so you can just rest? You can sleep even. Some of us, we have to stay up at night just to make sure that a loved one is still awake, or they're not leaving the house, or they're not going to do something that's going to be harmful to themselves, right? Trying to build your community. Families need families, right? Whoever it is that we define as families. So who is in your court, who is in your circle that can support you while you're supporting your loved one? Then don't be afraid to tap onto those individuals. And maybe like, well, they don't understand, what my loved one is dealing with. They won't come and support him or her. What can they support you? If they can go pick up stuff at the market, if they can come and clean or cook, that is one less thing you have to do. Then you can take a nap. Then you can rest. You see what I mean? So sometimes it's not just support directly to the person in recovery, but taking some things off your plate, off your to-do list, can also be helpful. I hope that helps. Any more questions?
Yes, there's some more questions here. You listed lack of knowledge in barriers to family involvement. What should be the first thing a family learns when someone close to them is in recovery?
I think first will be trying to learn as much as you can about their condition. And yes, look up things online, use some of the website that I share, but also just love your loved one enough to say, hey, I know this is hard. How is this impacting you? Because you can read stuff online, but hearing from their perspective brings things to life, right? And then sharing them, asking them, how can we support you? You'll be surprised. We often have families create this care plan, and not the individual himself in recovery creates the care plan for themselves, and then we ask that person to share with their loved one, the people who support them, and then we ask the primary caregiver to create one for themselves too. So that in that care plan, we talk about things such as if you see X, Y, and Z, that means I'm having a bad day. If it's 10 o'clock, I didn't leave my bed yet. If you called and text me for 2 days in a row, you've not heard from me. That means, I'm sinking low. Here's what I need from you. And people actually create for that care plans, kind of creating a list of contacts and what people can help them with. And the way that those people get activated per se. So for one, it might be, if you didn't hear from me for 2 days, I need you to call me because most likely I'm not doing well. For people who live with them, if you didn't see me come out of my room by 10 a.m., I want you to come check on me. I might not like it in the moment, but this is where I'm well. I'm telling you what that support that I need. So it's important to educate yourself on the condition, have that conversation with your loved one, and definitely make sure your loved one is getting help, and you be part of that meeting if you can, if they allow you, right? So like I shared those case studies that, whether it's coming for some education, attending workshops, with Grace and Hope for Families, we do workshops on a monthly basis. So, if you go on our website, you can sign up there. And once we have workshop coming up, you'll know, you can come learn about these different conditions, learn about ways you can support your loved one. And then again, very crucial, have that conversation with them. Another question?
Yes, we have some more questions. We don't have so much time, but okay, let me run through them. Family conflict is almost unavoidable. How can families still be a safe space even when there's tension or past wounds from past experiences?
Yeah. So you definitely need a mediator, like in Moses, I think it was Moses' story experience. They needed someone to come and help walk them through the healing process, right? Someone to unpack some of that trauma. If you do not have that person that can help, or even before you get that person, even during the time you have that person, always remember that well-being is priority. When you're in a moment of crisis, you're not seeking perfection, which I don't I tell people to focus on progress, not perfection. So especially in moments of crisis, you want to focus on your well-being and your loved one well-being. So temporarily, if you can, is to put the issue aside and ask yourself, what do I need to be well in this season? What do they need to be well? And once we are doing better, everyone is doing better, everybody's mind's a little clear, heart's a little more at peace, then we can have the hard conversations. Because when everybody is, oh, my screen just went, there you go. When everybody is, anxious or mad, upset, we can't really resolve anything, right? So try to take care of yourself first, put the issue aside, focus on the well-being, and seek support if you can to help mediate per se. But make sure that you are back to whatever your healthy status looks like, right? And that you're focusing on your loved one, getting medication, getting treatment, getting the counseling, whatever they need, so that as they're becoming well and more stable, we can start address those issues. And that's back to seeing the soul behind the challenge, right? Because if I just see all the bad things they've done, doing the addiction, and nobody will feel motivated to go help them. But if I see the soul behind it, I'll put the problems, the issue, the wounds aside and say, for his soul's sake, I'm going to do what I need to do to support them. And so that, and with the hope that as they become well, we can deal with these wounds then.
Okay, the numbers of questions are increasing. So I will take them in twos, if you don't mind.
Okay. Now, so too, if there are questions that we won't get to cover today, Sophie, feel free to copy them and email them to me. I can respond to them, and then you can distribute to the folks who signed up.
Okay, all right. So the next question here: what role does accountability play in preventing relapse, and how can families create that structure without being overbearing?
Yeah, and it depends on the age of the person, not just age, as calendar years, but developmental years. So you might have a loved one who is 25, but the developmental age is at 15. You want to meet them at 15. In a sense, like the expectations you have for them should connect to where they are developmentally. And the way we create accountability is when you want to presume competence. So no matter where they are in the development, you want to presume that they are able, if they function at the 15, they think or behave as a 15-year-old, and that's where they are developmentally. You want to presume that they can do 15-year-old stuff. So it could be that, okay, I'm going to let them, they can pick up, let's say, the sibling from the school bus, for example, or they can cook a meal. And then I can then be assigning them the tasks that help them be part of community, that keeps them busy, that shows them that they're important. And then the way I build accountability is making sure they get it done. So it will be asking them if they did it. And when they don't do it, what are the consequences for not doing it? Because life is full of consequences. If you speed down the street, if you're driving, you're going to get a ticket. That's just life, right? If you're running and you don't stop, you're going to bump into something. There's always natural consequence in life. So if we don't build accountability, quote unquote, those natural consequences as we are supporting our youth, we're not preparing them for life. I hope that helps.
It does. Thank you. Okay, so this is not a question, but from Counselor Joanne. She's saying, splendid and relatable with the case studies. God bless you. So yes, I really love the case studies that you shared. The next question here from Fortune says, how can one initiate the conversation of family support in a case where the family members of the person in recovery are ashamed of societal stigma, thereby isolating the person in recovery?
So I'll say, put it on me. This might sound funny, but I've used this example many times. So because for people to break the stigma, we have to have the conversation. People, often the stigma because people don't know what to expect. And because we have bad connotation, if you want, around mental health, around addiction. So I say, share success stories of people in recovery who are doing well. So I always give people, all my clients and everybody at me, I say, you have permission to say, oh, I met this lady today. Her name is Shu. And oh my goodness, she now, she's a counselor, she's a coach, she does, runs her own business. But 15 years ago, she was so depressed that she didn't want to live. She was in a psychiatric hospital. Today, you can't even tell. So use my story if you want to. but not just mine, but there's more stories of other people who are recovering and doing well as a way to open that conversation. And you say what helped her was support, right? The daughter was a reminder of what she needed to live. She got help, medical help, and so that she could do well. And she continues to get support so she continues to do what she needs to do. So starting those conversations with a positive note is something that it's good. And sometimes I tell families, if you don't have a story of anybody else, sometimes it's okay to start telling your family how much you care about them, how much you want to be part of their lives, how much you want your family to do well, but you're struggling with X, Y, and Z. And this is how you can help me. So it could be simple. Like I'll say, I love my family. I love doing things with you. I love spending time with you, go to church together, praying together, eating together, all the stuff that we do, we have fun. But sometimes when there's too many things, I get overwhelmed. And that moment I need rest. And there's so much put on my plate. I get stressed. When I get stressed, anxiety gets higher. And maybe when there's things to do, we can share the load. You see, I'm speaking from my perspective. It's an example. That's maybe not my case per se. So you're speaking from your perspective, using I statement to show how the situation impacts you, how what it is that you're struggling with. But you start that the main goal is to be a functioning member of your own society first, your own family, and that you need the support to do that. But if you start saying like you did this, you did that, pointing blame, but nothing gets built on blame. So you want to put the blame aside and just speak from your own perspective first.
Yeah. All right. Thank you. The next one here. Were there setbacks in Moses' journey with his family, and how did the therapy process navigate those moments without discouragement?
Yeah, sometimes we just need to take a break. Like emotions are so high that he started talking, and the mom was like, no, that's not what happened, that's not what I remember. And then and we actually had to start a process where, and I've used different things for this. It could be a little just stick, it could be a pen, a pencil, that we pass it on. The only person who can speak is the one who has the pencil in their hand, who has the little ball, so it's like a talking stick if you want. That allowed us to only have one person speaking at a time. And so if the another person starts talking, I'm like, oh, who has the pencil? Or who has the ball? Who has the pen? And I'm like, oh, so-and-so has it. Okay, it's their turn to speak. Once they're done, then they can pass it to whoever wants to speak next. So although it seems very childish per se, but it was those simple things that brings order and harmony and will help part of that healing. And there are times even when each person took turns speaking, the emotion was so high that the words couldn't come out the way they wanted to. We had to stop the conversation and do some self-regulation exercises. It was deep breathing, some grounding exercises, right? Sometimes it was prayer, because of the family of faith, just to have everybody kind of ground themselves again. And then we continue. And the bedtime, we're like, we cannot keep talking right now. We're going to stop here. We're going to call it short. We're going to talk about self-care. What would family members do? What would Moses do? And then we'll reschedule the next session. Because we can't rush the recovery process.
Yeah. Okay. Thank you so much. The next one here from Victory. Okay, sorry. Yeah. Thanks for your presentation. Please, can the children of a mother who suffered from depression or trauma also be affected in the future? After seeing their mother at a very young age in a very vulnerable state and with a busy dad, is there an 80% chance that the children may grow and be easily exposed to substance abuse?
So I'll share what research says. I will share what faith shows and what God says and what life says, right? So through science, we know there's a lot of research that shows that those of us who've been grew up in families that are impacted by domestic violence, trauma, addiction, mental health, have a higher likelihood of also developing those conditions or those situations. Higher likelihood. It doesn't mean that it's always going to happen. It just means that we are more predisposed, if you want, to having those. But there are some so my phone keeps shutting off. But there are some safety measures, if you want, but I call them buffers, that help prevent those things from happening. It's almost back to the example of diabetes. So both of my maternal grandparents died from diabetes. My entire life, my mom didn't have diabetes. Until later on, like now my mom is in her 60s, she's still developing by diabetes. Doesn't mean that she never had diabetes. No, she had it the whole time or didn't have it. She had the DNA, she had traces of it, if you want, in her DNA, but they were not activated into other external factors impacted her life. So sometimes like people might be predisposed to it, but if they have good support, they have they live in a good environment. When I say good, I'm not talking money. Money does not solve all the problems in the world. I know money buys food, buys houses, and all of that. But I have met people who are as rich as you can think, money that I never see in my life, who are struggling with things that some of us would never struggle with. So when I'm saying, live in a good environment, I want to really reinforce that. I'm not speaking about money. I'm speaking about where you feel loved, safe, respected, supported. That makes a big difference. So you might have those tendencies per se, but you don't have a full-blown diagnosis. So for those children, if that's your family, I want you to nurture those kids, remind them that they matter. Teach them coping skills now, like help them to know how to communicate, meaning when they feel something inside, not to keep it hide inside. And I know on African communities, often it's kids are seen and not heard. That's not healthy. I'm not saying that children should just be disrespectful to adults. That's not what I'm saying either. But we need to create spaces where our children can talk to us one-on-one. If you're the mom, maybe it's like having those, I do that with my kids. I'm not a divorced mom, I'm a single mom of 3 kids. I know that divorce alone impacted my kids. So I have moments when I like now just spend time one-on-one with each one of them, allowing them to talk about those things. And then I can answer questions based on their age. I'm not giving them, they don't need to know all grown-up stuff, but I need to know that what happens between the grown-ups had nothing to do with them. It's not their fault. Because often children are just part of development. They're very self-centered, not in a bad way. The world revolves around them because that's just part of development. So even the good, the bad, and the ugly, they think it's them. So something goes bad against the parents. I've seen kids say, my dad drinks because I'm not a good child. It had nothing to do with the child, right? So those of us who are around, support those kids, support those youth, remind them that they matter, that they're important, that the adult stuff is not their business, but they also don't have to become the adult that they see. I chose to stay away from alcohol because I saw what it did to my uncle. It wasn't until literally in my late 30s that I could just even get a little bit of wine with a meal at a function or a wedding or something like that. So yes, they're predisposed, but that doesn't mean that they have to have it. They need those protective factors. And we as adults, safe adults, create those protective factors.
Okay, yeah, that answers it. Thank you so much. So we have 2 last questions and then we'll wrap it up. Yeah, so from Councillor Fumi, she's saying, how do we get family members to be more understanding as the feeling of slow recovery of a loved one creeps in?
Yeah, and I think even just that's why education matters, right? So the more we know, the more we understand, the better we support others. So part of, I don't know if I said this earlier when we're talking about the tenets of recovery. Recovery is not linear. There are going to be ups and downs. There have been times when years past, I'm like, I'm fine, I'm doing better. It's been a long time since I've been depressed, and then a health issue hits me. And it takes me back to the days where I couldn't do things for myself. Me back then was because of depression, but now because of the health issue, back when I was saying stressor is a silent killer, because stress comes and poke at those old wounds, and then I'm finding myself starting to become depressed. I'm like, then I need to reach out to my support system, right? Reach out into the tools and coping skills that I have. So the more knowing that recovery is not linear allows us to give ourselves and others grace. Grace that they're going to have ups and downs. But I often also say this, it doesn't matter how many times you fall, it's how many times you get up. Because even the Bible says that we're going to fall, but God wasn't going to pick us up. It always raises us up. So when we are on the lower point where we feel like, we hit rock bottom, keep calling on the name of Jesus, right? Keep seeking for support so you can continue to rise up. And then remember past successes too. Because if you're only focusing on destination, sometimes we have what I call destination paralysis, where we're so focused on the end goal that we forget how far we've come. So if I want to take a journey that, let's say that I'm going to visit someone, it's 10 kilometers, just to give an example. And I'm like thinking, oh my goodness, I'm looking ahead. I'm not there yet. I'm not there yet. This is taking for so long. I should have just changed my mind and now go. I might forget that I already traveled 7 kilometers to get there. Like where I am now, I did 70% of the journey. That makes sense? So remember the past successes, and that helps you build on your faith. Well, I think it's David that's remember the God who pulled him from the lion's den, the God who helped him with the bear, and says, so then the same God will help me with Goliath. What has God done for you in the past? Right? Remember those past victories. He's the same yesterday, today, and forever.
Yeah. All right. Thank you so much. And then our last question, this is from Fortune. He's asking, what advice can I give to a teenager that came from, what advice can I give to one teen that comes from a family that's a teenager that comes from a family that happens to be the cause of his trauma?
Yeah. I'll say this. I came from a family that was the cause of my own trauma as well. But that does not define them. So that's what I'll say. Start there. It's like what happened to you does not define you. Nobody chooses a family of origin, but all of us can choose a new family. And I'm not saying that they have to cut the family off. I'm saying that they need to start building people, choosing people around them that are healthy, who can help them heal and recover. So you might be that person. You might be saying, I don't know what happened to you. I don't agree with what happened to you, but I'm helping you move forward, and I'm going to be a safe person for you. Let's see if God can send more safe people for you, so that you must still be connected to your family, but they're no longer going to impact you the same way if you have other people who are pouring into your life. Think about it. If I hear is I'm not good enough, I'm not pretty enough, I'm never going to amount to anything, that's all I hear all the time from my family, all of us will feel like we don't matter, like we're not good at all. But if I have that teacher, right, that Sunday school teacher, that friend at church, that the guy, the kid next door plays ball with me saying, oh, you're good at basketball, you're good at soccer, right? Somebody at school, the teacher at school saying like, oh, you're doing really good, with X, Y, and Z. All of that, I didn't know my video was closed. Sorry, friends. All of that can actually empower me, right, to start seeing myself in a different light. It doesn't take away what was said to me, but then what was said to me doesn't have the same power and impact in my life anymore, because now I'm hearing other things are positive. So you be that positive person for that kid, for that youth, and tell him that as he gets older, now he can choose the people who are around him.
Yeah. All right. Thank you so much once again. That was such a beautiful way to wrap up this conference. Thank you for reminding us. Thank you for reminding us.
Wow, I can't believe we are done. It felt like, oh, thank you so much. Oh, it was amazing. I have a question, and my question is, what do you do? This is the last one. I'm sorry, everybody. People are probably like, yeah, whatever. But I do, and it's more like, what do you do when the person refuses to even acknowledge that they have a mental illness?
Yes.
I think it's one of the toughest things that I have to deal with. Being in the field and having people that I know that are already struggling, but they just refuse to accept, and their family is like, okay, initially the family maybe were like, oh, it's okay, but then they don't acknowledge. You don't know. Maybe they think, it's a spiritual problem. They've tried everything. They prayed. It's not working. They don't want to take medication. They don't want to. The family's at wit's end. So so how do you address that?
So like I was saying before, somebody's not ready, they're not ready. We cannot shove recovery in people's throat, which is hard, especially as a family member. What has helped and what I've seen help in my life and people that I support, it's often focusing on what matters to that person. So for example, if someone, let's say, wants to go to college and they're like, I want to go to college, I'm going to be an engineer, I'm going to do all this. I'm like, wow, that's great. I support that. I want to be there and support you. I think you can do it. But how do you think you would deal with when there's so many exams, if someone's struggling with anxiety? So you start asking them questions that makes them realize how their condition is impacting their goals or even impacting their life right now. I had a mom who was saying like she didn't realize that she had an anger problem, but her anger problem was because she had so much unresolved trauma from her own childhood that she got so overwhelmed when she was around her kids. All she knew to do was just yell. So we start talking like, she's like, I know you love your kids. Yeah, I love them so much. And we talk about how much she loved her kids and what her dreams and aspirations for those children, what she wanted to do for them and how she wanted them to have a different childhood as her own. And then I say, well, how your interaction with your children? She's like, well, they're fine. Like we talk when we need to. I'm like, oh yeah. And then so I just start asking questions, right? And then I start asking about her tone of voice. And then I say, well, when you use that tone, how do you think that makes your children feel? And then it hit her. And like right there, we still from the positive, right? We still from the things that they matter to them, the things that the reason to be. Like for her, she's years because she wants to live for her kids and all of those things. And for that young man, I was saying with college, like he wants to go to college. I focus on the things that matter to them, and then showing them how the current condition is impacting that, and how if they don't get help, those dreams, those goals might not become a reality. And that flip. So for that mom, when I say, how do you think that your tone of voice impacts them? She got quiet and she started crying. And that broke the wall from her own trauma. She's like, it was me. I was the little girl that always got yelled at. But I get so overwhelmed with my kids, I don't know what to do. And so not only able to acknowledge her own trauma and deal with that, but also able to actually give grace to her mother because she realized maybe my mom also did not know what to do with me. A traumatized mom raised a traumatized child who became a traumatized mom. So what I mean? And so focusing on what matters to people often motivates people to start changing. Yeah.
Wow. Okay. Thank you so much. Thank you.
Welcome.
All right. I think we're done. Oh my goodness. I can't believe it. It's been a super packed 2 days of amazing. And you guys are coming to Nigeria, I tell you, as in we cannot wait to have you. We need to do this physically.
I would love to.
Have everybody there and do like an in-person training for everyone. We're so grateful. And so Sophie, what are before we wrap up the last things, we're going to be getting we're going to be emailing the certificates of attendance to people. Yes, right?
Yeah, and a link to the recordings.
The link to the recordings and also the
speakers' resources that
the speaker is giving, and also the link to the recording, the speakers, and also the resources that that's shared, and even the profile and the contacts of all the of all the speakers, so you can have access to them and contact them if you need. You can talk to them as well. So
yes, that will be all. Thank you, everyone.
Thank you,
I mean,
everyone.
you give us a little task before she started, or at the start of our presentation. So I mean, family doesn't necessarily have to be people that are related by blood. So send that text to your family and tell them, thank you for being my family, right? It doesn't have to be your biological sister, but it could be a friend, but just send that text. Please ensure you do this task.
Let us wrap up with the closing prayer as we go. Father, we just want to thank you for all that you have done. This is a beautiful, thank you for these 2 beautiful days. Remember, we thank you for all the planning and the bringing people together, everything, and we thank you for how well everything has gone. We thank you for the speakers, we thank you for the organizers, we thank you for the participants, we thank you for just a great time. We are so grateful. We pray that in the name of Jesus, everything that we have had, that everything will go well in the name of Jesus. We pray that we will take that what we have heard, we will put it into practice in the name of Jesus. And that, you bless the speakers, bless everyone that has been part of this. Keep them, watch over them in the mighty name of Jesus. Thank you, Lord, for this wonderful thing done. In Jesus' most precious name we pray. Last but not least, sorry, we're going to be sending evaluation. So before you get your attendance, please, we're going to send evaluation just to a link. So that please we'd like to know how you feel, how everything went. So we're going to send evaluation so that we can get, we can get feedback from everybody. So that will be perfect. Thank you, everybody.
Bye, everyone.
Bye, everyone.
Bye.
Oh, it's wonderful.
I'm going to meet
Everybody, thank you.
Okay, have a good evening,
Have a
everyone.
good evening, everybody. Needs to stop recording. Okay. Oh no, I need to stop.